Good morning. Good morning. Welcome to the New York City Council hearing on the Committee on General Welfare, joint with Public Safety. At this time, please silence all electronics. Fill out a slip with the Sergeant at Arms at the back. Thank you for your cooperation. You may begin.
Gavel. I won't take that as a bad sign, but okay. Good afternoon and welcome to today's Oversight hearing on New York City's Code Blue operations. I'm Julie Menon, Speaker of the New York City Council, and I first of all want to begin by thanking you all for being here. I want to thank my colleagues, Councilmember Oswald Filez, who chairs our Public Safety Committee, Councilmember Crystal Hudson, who chairs our Committee on General Welfare, and so I want to thank them and all of you for being here for today's emergency hearing. As New Yorkers, we have collectively endured extreme weather over the past several weeks. We've shoveled our neighbors' sidewalks, we've navigated remote learning with our students, and we've checked in on vulnerable New Yorkers to ensure their safety. We are here today, though, because 18 New Yorkers have lost their lives since the city declared Code Blue. These deaths are not inevitable. They are the result of gaps in outreach, shelter capacity, mental health services, and follow-up. Every person who freezes to death in this city is a reminder that systems that are designed to protect human life are failing the people who need them most. Code Blue literally refers to an emergency notice that is issued automatically during winter nights when the temperature drops to 32 degrees Fahrenheit or below, including wind chill between 4 and 8 a.m. We are experiencing one of the longest cold snaps in recent years. As a city, the response to such an endured period of freezing weathers is obviously complex and difficult, but our number one priority must be on protecting and preserving the lives of vulnerable New Yorkers. We must remain constantly vigilant in helping those who need our help the most. And we must help those New Yorkers who cannot help themselves get access to a warm and safe place. That is the humane thing to do. What is not humane is allowing New Yorkers to linger on the streets knowing that they will die in these freezing extreme weather conditions. Code Blue means action, it means urgency, and it also means deep care. But for too many New Yorkers experiencing homelessness in our city this winter, Code Blue is a warning that unfortunately came too late. I would like to take a moment to name and recognize just a few of the 18 New Yorkers who passed away. Frederick Jones, 67 years old, of Midtown Manhattan, who was under an Adult Protective Services guardianship and who was found by emergency workers about a mile away from his building. Barbara Stuter, 64, who was found dead last Saturday morning and was identified by law enforcement as having been unhoused. Another man, who was 60 years old, was found outside of St. Barnabas Hospital before he was rushed inside, where he was tragically declared dead. Noberto Jimbo Noyola, 52 years old, originally from Ecuador, and found on a park bench in Queens with discharge papers from Elmhurst Hospital. These New Yorkers should be alive today. In 2025, the Hope Count identified 4,504 unsheltered individuals in New York City. This was 364 more individuals than in 2024, a 9% increase. When temperatures drop, our responsibility to each of these New Yorkers rises. That means meeting people where they are, expanding safe and dignified shelter options, improving coordination across city agencies, and treating this crisis with intense seriousness. Data from the New York City Department of Health, Environment, and Health Data Portal indicates that cold stress deaths, or deaths that are due to cold weather, have increased citywide since 2016. Similarly, the number of cold-related emergency room visits, such as for hypothermia, frostbite, and worsened chronic conditions due to the cold, have unfortunately also increased. While I recognize that this period of Code Blue presents significant challenges, we must do better. It is imperative that we hear today from city agencies on what they are doing to improve operations and outreach during this time to protect the lives of unsheltered New Yorkers and ensure that they have what they need to stay safe. I first of all want to thank the administration for being here today to testify. I want to thank the chairs and all of my colleagues who are here today for this very important hearing. And now I'm going to turn it over to my colleague, Councilmember Velez, for his opening statement.
Thank you, Speaker Menon, and good morning, everyone. I am Councilmember Oswald Feliz, Chair of the Committee on Public Safety. I want to thank the Speaker for her leadership on this critically important issue, and Chair Hudson for partnering with me for today's urgent hearing on New York City's Code Blue operations. I would also like to acknowledge we've been joined by Council members Aviles and Encarnacion. Thank you for joining us today. When emergencies arise, New Yorkers should have full confidence that their local government is fully prepared, ready to respond efficiently and effectively, especially when dealing with the health and safety of our most vulnerable New Yorkers, homeless populations. Keeping New Yorkers safe is one of the most important duties of city government. Our preparation was tested in recent weeks when freezing temperatures triggered the issuance of a Code Blue emergency notice. As you've been hearing, when this notice takes effect, it sets in motion a series of obligations our city agencies must undertake to ensure that everyone is warm hours and put more outreach teams on the streets to identify unhoused individuals in need of services and shelter. First responders also play critical roles. EMS is dispatched to calls related to unhoused people to provide medical care, including treatment for cold-related injuries and hypothermia, and offer transport to hospitals and shelters. And since our police department has the resources and personnel to respond quickly, police officers are also a critical part of the Code Blue response. During these emergencies, NYPD officers work alongside DHS staff, Department of Homeless Services staff to increase patrols and outreach at known locations where unhoused individuals gather. When people are willing to relocate, police officers will offer transport to the nearest DHS shelter. And in limited circumstances, officers may play a role in determining if, in accordance with applicable laws and policy, whether a person can or should be transported involuntarily to a hospital emergency room. Now, on the January Code Blue response, it is hard to argue that the response to freezing temperatures was enough. It is difficult to maintain that our city's response met the need. Our city's response to the severe weather clearly fell short. We lost 17 vulnerable New Yorkers, 13 due to hypothermia. New Yorkers who died in freezing conditions, most who were homeless and in a state of crisis. 17 vulnerable New Yorkers. These are not just statistics, these were lives. Real people who were in a well-documented state of crisis. As a city, we must take every step to ensure that something like this never, ever happens again. As a city, we must take every step to ensure that something like this never happens again. So today I look forward to hearing from the agencies, including our police department, but also from the Department of Homeless Services, EMS, and other agencies who play an important role in ensuring vulnerable homeless populations are safe during freezing conditions. As chair of the Public Safety Committee, I'm especially interested in hearing from our police department, but also from all the other agencies who respond on current processes to make sure we're reaching homeless populations and providing them with safe spaces during freezing temperatures, but also current rules to ensure agencies are working together so that we can provide assistance efficiently and effectively, but also, most importantly, steps that we can take to make sure that another tragedy like this never, ever happens again. I thank everyone here today for participating in this important hearing, and I look forward to a thoughtful and constructive dialogue. Thank you so much. And I'll pass it on to our co-chair, Councilmember Crystal Hudson.
Thank you so much to Speaker Menon and Chair Feliz. Good afternoon, good morning, and welcome to today's oversight hearing on New York City's Code Blue operations. I'm Crystal Hudson, General Welfare Committee Chair, and my pronouns are she, her. We are additionally joined by Council members Ung and Hankerson. Today, our city mourns the tragic loss of life that has occurred during the recent period of extreme cold that has gripped New York City. Since late January, the prolonged freeze and sub-freezing temperatures have claimed at least 18 lives outdoors across the 5 boroughs. These deaths are not just statistics. They represent parents, siblings, and neighbors whose lives were cut short by conditions that should never be fatal in a city as resource-rich as ours. While official data indicates that not all of the individuals who died were confirmed to have been unsheltered individuals, many had past interactions with our homeless shelter system, and a number of these fatalities reflect the acute vulnerability that people living without stable housing face during extreme weather. Our city has been under a Code Blue emergency since January 19th. Under New York City's Code Blue protocol, which is activated when temperatures fall to 32 degrees Fahrenheit or below, the city, led operationally by the Department of Homeless Services, or DHS, is required to ensure that no one experiencing homelessness who seeks shelter is denied entry. During these emergencies, DHS expands and relaxes normal intake procedures so that shelters, drop-in centers, safe havens, and stabilization beds are open 24/7 and available to all in need. Anyone can walk into any facility for warmth without undergoing the usual eligibility process, and outreach teams are deployed throughout the 5 boroughs to connect unsheltered individuals with these life-saving resources. The Department of Homeless Services also coordinates a citywide street outreach effort that operates year-round and intensifies during Code Blue conditions. DHS-supported outreach teams, including nonprofit partners and trained staff, canvass neighborhoods, subway stations, parks, and other outdoor locations to identify and engage individuals living on the streets. Their goals are to offer immediate access to shelter, provide information and encouragement, and build the trust necessary to help people transition off the streets and into safer environments. These teams work in coordination with other agencies to maximize their reach and effectiveness during life-threatening weather. According to Mayor Mamdani, at least 1,100 people have been brought into shelters or safe havens since the Code Blue was activated. Despite these efforts, the recent deaths underscore how emergency responses alone are not sufficient without broader strategies that address the deep-rooted causes of homelessness, including lack of affordable housing, gaps in mental health support, addiction services, and long-term care. Outreach and shelter placements must be complemented by sustained investments in housing stability and compassionate social services so that individuals are not put in harm's way in the first place. We honor the memory of each life lost and extend our deepest condolences to the families and communities affected. Let these tragedies be a catalyst for action to strengthen DHS's capacity, improve interagency coordination, and expand preventive services that protect our most vulnerable neighbors, not only during emergencies, but every day. Excuse me. We hope that today's hearing will inform an assessment of the effectiveness of the city's Code Blue operations thus far, to learn more about the city's successes, areas for improvement, and ideas for better Code Blue operations going forward. I want to conclude by thanking the committee staff for their work on this hearing, Aminta Kilawan, Panina Rosenberg, Justin Campos, and Colby Porter. I would also like to thank my staff, Andrew Wright and Elika Ruentan. We've also been joined by Council Member Banks. Okay. And now the committee council will administer.
Thank you, Chair Hudson. Now, in accordance with the rules of the council, I will administer the affirmation to the witnesses from the mayoral administration. Would you all please raise your right hand? Commissioner Molly Park, do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee and to respond honestly to councilmember questions?
I do.
Commissioner Zach Iskel, do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee and to respond honestly to councilmember questions?
I do.
Thank you. Deputy Commissioner Alexander Cron, do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee and to respond honestly to council member questions?
I do.
And finally, Jason Graham, do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee and to respond honestly to council member questions? Thank you all. You may begin when ready.
Thank you. Good morning. My name is Molly Wasso Park, and I serve as the Commissioner of the New York City Department of Social Services, which includes the New York City Department of Homeless Services and the New York City Human Resources Administration. I'm joined by New York City Emergency Management Commissioner Zach Iskel and Deputy Commissioner Alexander Crone from the New York City Police Department. I would like to thank Speaker Menon, Chair Hudson, Chair Felice, and the members of the Committee on General Welfare and Committee on Public Safety for holding this oversight hearing on New York City's Code Blue operations. To start, I want to remind New Yorkers to call 311 if you see someone experiencing unsheltered homelessness. An outreach team or first responder from NYPD or FDNY will be dispatched and work to make sure that the individual is connected to a safe and warm place. New Yorkers can also sign up for Notify NYC to learn about current resource conditions. Notify NYC provides information about emergency alerts and important resources and services. During the past 3 weeks, New York City experienced weather that was as cold or colder than some parts of Alaska. We want to be sure that every New Yorker is safe as we confront the coldest temperatures we have encountered in nearly a decade. Our hearts, my heart, go out to the families and loved ones of New Yorkers who have tragically died outside due to the cold temperatures as a result of this horrible cold spell in recent weeks. The reason that we do the work that we do is to prevent these tragedies and connect vulnerable people to the shelter and resources they need to stay safe and warm. We are acutely aware that extreme cold is particularly challenging and dangerous for people experiencing unsheltered homelessness. DSS is taking action to keep our unsheltered neighbors safe. Part of our job as public servants is delivering the message that help is available at every opportunity we can. That is, at public meetings like this, in person with outreach workers, through social media, spreading the word through community partners and faith leaders, and through public service announcements. I thank you all again for this opportunity to use this platform to highlight the resources available and share the work DSS is doing to get people experiencing unsheltered homelessness the help that they need. Our preparation for Code Blue begins before the winter starts. Before winter begins, our team at Street Homeless Solutions reviews our Code Blue procedure with the outreach team directors and discusses winter preparedness. As needed, trainings include a review of how to identify and assess at-risk clients and resources available during a Code Blue. We maintain ongoing targeted placement of the most chronic and vulnerable clients experiencing unsheltered homelessness into housing with an enhanced effort in the 3 months before winter. Each October, outreach teams will create a Code Blue priority list of clients and identify the usual locations where they congregate. Clients living in vehicles or in exposed geographic areas, such as near bodies of water, may be especially at risk and are included on these lists. This list is based on published evidence, the vulnerability index, and can be updated as additional at-risk clients are identified through the winter in New York City. Individuals may be placed on this list if they are or have more than 3 hospitalizations or emergency room visits in a year, more than 3 emergency room visits in the previous 3 months, aged 60 or older, cirrhosis of the liver, end-stage kidney disease, a history of frostbite, immersion foot syndrome or hypothermia, HIV/AIDS, trimorbidity, which means co-occurring psychiatric, substance use, and chronic medical condition. In addition, the vulnerability index takes into consideration the following: living conditions, whether they're in a structure or lack thereof, appropriate dress, layering and head, hands, and feet covered, whether there are open fires, contained fires, and the risk for carbon monoxide poisoning, the ability to be logical and goal-directed towards meeting basic needs, active signs of hallucinations or gross disorganization, current alcohol dependence, a known history of heart disease, diabetes, peripheral vascular disease, and/or severe psychiatric illness. As demonstrated by that list, which is non-exhaustive, of factors that were taken into consideration for placement on the Code Blue alert distribution list, we are seeking to take individual circumstances into consideration and remain sensitive to the unique vulnerabilities a New Yorker may face. Each November, relevant teams within DSS DHS review Code Blue procedures. This group includes our Street Homeless Solutions Unit, DSS's Health Services Office, DSS's Office of Performance Management and Data Analysis, and DSS's Office of Legal Affairs. This review is conducted with an eye towards strengthening best practice and ensuring our policies and procedures are positioned to meet our mission of serving vulnerable New Yorkers. Outreach work occurs year-round and aims to build the trust necessary for people experiencing homelessness to connect with shelter, resources, and assistance. Building trust with vulnerable New Yorkers is a vital component of successfully delivering assistance. During a Code Blue, the city delivers assistance to vulnerable New Yorkers through several pathways. In this period of emergency, 311 calls about people experiencing unsheltered homelessness are routed to 911 in recognition of the serious life safety danger that needs to be taken into consideration with such severe weather. DHS directs shelters to suspend their normal intake procedures to more readily accommodate New Yorkers in need of assistance, and shelters make accommodations for walk-ins. Outreach teams also gain greater latitude in assisting bringing individuals to shelters. All drop-in centers are open year-round and 24 hours a day. Drop-in centers assist as many people as they can safely accommodate, taking account of health and safety regulations. And if necessary, the drop-in center will identify an alternative location, such as a shelter, a warming center, or another drop-in center, and offer transportation to that alternative location. Shelters, safe havens, and stabilization beds make beds available to accommodate individuals brought in by DHS street outreach teams or who walk in. Those individuals are engaged by shelter or safe haven caseworkers to encourage them to stay indoors and access services. Outreach teams contact vulnerable individuals, including those on the Code Blue priority list, to ensure safety and bring them to shelter. During a Code Blue, DHS street outreach teams contact individuals on the Code Blue priority list a minimum of once every 4 hours, beginning at 8 p.m. until 8 a.m. During an enhanced Code Blue, DHS street outreach teams contact individuals on the Code Blue priority list a minimum of once every 2 hours, beginning at 8 p.m. until 8 a.m., to encourage them to accept transport to a safe and warm place. During Code Blue, hospital waiting rooms also serve as warming centers. DSS reminds hospitals of this protocol each year at the beginning of the season. Given the historic nature of the recent cold spell, the Mamdani administration has mobilized additional resources beyond the established enhanced Code Blue protocol to ensure no New Yorkers experiencing unsheltered homelessness are left without access to shelter and warm spaces. For the first time ever, a 24-hour enhanced Code Blue was established on January 31st to ensure the safety of those experiencing unsheltered homelessness. Over the past 2 weeks, the mayor directed DSS-DHS to open approximately 300 additional low-barrier beds across multiple locations in Manhattan, the Bronx, and Queens to assist with capacity needs for those in need of immediate shelter. These provider-operated sites are equipped with wraparound services to ensure unsheltered clients have the resources they need to get back on their feet. During the first weekend, the city mobilized to open warming centers in schools that operated 24 hours per day and have subsequently opened warming buses in each borough operating 24 hours. Winter Access Relief and Medical Outreach, also called Warm Outreach, operated by the Health and Hospitals Corporation, also serves as a resource during a Code Blue. Each Warm Outreach mobile unit is staffed by a team that includes a nurse, someone providing administrative support, and a driver. Warm Outreach buses can provide clinical care, food, and warming supplies. As this unprecedented emergency requires an all-hands-on-deck response, the city, in conjunction with our partners at the MTA, New York City Public Schools, CUNY, and H&H, operated nearly 65 warm outreach centers, including an additional 29 newly established this past weekend at 10 New York City Public Schools, 2 CUNY-based sites, 2 Northwell sites, 2 overdose prevention centers, and more than 13 H&H mobile units. Understanding that there is a need for innovation during this unprecedented time, the city has embedded people with lived experience who have been connected to housing to outreach teams. We've also reminded all of our shelter providers to expand their perimeter walks around their buildings and to proactively engage anyone who appears unsheltered by encouraging them to come inside and stay warm as they call 311 for assistance. This has not only been a DSS-DHS response, volunteers from other city agencies have answered the call to help staff the warming buses. In addition to understanding the efforts DSS and our sister agencies are making to identify vulnerable New Yorkers in need of assistance and deliver the shelter and resources they need, it is important to understand the complex reasons why a vulnerable New Yorker may refuse shelter. As clinicians and community experts have shared, there are psychological or mental health barriers that may prevent an individual from seeking refuge from the cold. People with medical conditions experiencing psychosis, hallucinations, delusions, disorganized thinking processes, individuals who have experienced severe trauma, individuals with substance use disorders, or individuals with co-occurring substance use and mental disorders may all resist help. As Dr. Van Yu, the Chief Medical Officer at Janian Medical Care at the Center for Urban Community Services put it, It's difficult to convince people we are the good guys when many traumatized people don't believe good guys even exist. We also recognize other reasons New Yorkers may hesitate before accepting assistance. An individual may be concerned about their separation from their pet, their privacy, or their safety. In collaboration with 3 drop-in centers in the Bronx, Manhattan, and Queens, we recently instituted a pilot program that during a Code Blue, person can also bring in 1 pet, either a cat or dog that is under 45 pounds, to these 3 sites. Those challenges are precisely why the work of our outreach teams is so important. Regardless of the presence of a Code Blue or enhanced Code Blue alert, DHS street outreach teams operate throughout the day and night, canvassing and engaging with individuals experiencing unsheltered street homelessness. Building a relationship over time, consistently treating people with dignity, understanding the lived experiences of clients, and taking a person-centered approach are some of the tools in the toolbox of outreach workers in overcoming those barriers and assisting clients to voluntarily come indoors. DHS also works continually to ensure clients' rights are respected, among others, including the right to ask for reasonable accommodation, the right to a safe, clean living environment, and the right to receive courteous, fair, dignified, and respectful treatment. Thanks to their work, as of February 9th, we have made approximately 1,400 placements to transitional housing, which includes shelters, safe haven beds, and stabilization beds, since January 19th. Outreach teams overwhelmingly focus on voluntary transport. From January 19th to February 9th, involuntary transportation represented approximately 2% of placements, or 34 out of about 1,400 individuals. In cases where New Yorkers refuse service or treatment, in accordance with the New York State Mental Hygiene Law, Section 9.58, the agency conducts clinical assessments to see if an involuntary removal is warranted to ensure the health and safety of the individual. In other words, if they are a danger to themselves or at risk of succumbing to hypothermia. In these cases, the individual is typically taken to a hospital emergency department. New York State mental hygiene law provides that transport does not create a presumption that the person should be involuntarily admitted. As Mayor Mamdani has said, extreme weather is not a personal failure, it is a public responsibility. Alongside our sister agencies, including New York City Parks, Sanitation, Buildings, Transportation, Education, and Health and Hospitals, we have mobilized dedicated outreach teams, clinicians, and conscientious New Yorkers to make every effort to keep vulnerable New Yorkers safe through this dangerously cold weather. Before I pass the mic on over to my colleagues, I'm going to go off script for a moment just to speak from the heart. I am proud of the work that DHS has done over the last several weeks. The agency has been creative, persistent, and compassionate in very challenging circumstances. The responses that I outlined in my formal testimony would not have been possible without the creative problem solving and the operational skills of the DHS team. That doesn't mean that these deaths are not a tragedy. They absolutely are. When the cold snap is over, I'm sure the agency will do a debrief, and there will be things that we can learn and build into future cold emergencies. If any of us gets to the point where we cannot learn from experience, we are no longer doing our job as public servants. But I also hope that as a city, we are also taking a holistic look at all the systems and institutions that discharge people to the streets, leaving them so traumatized that they would rather stay outside than accept help. And lastly, I would like to say a huge thank you to my DHS colleagues who have worked around the clock. I'm so grateful to you. You are the best of city government. With that, thank you for the opportunity to testify today, and I'm happy to take questions.
Thanks, Mom. Good morning, Speaker Menon, Chairperson Hudson, Chairperson Feliz, and members of the Committee on General Welfare and Public Safety. I'm Zach Iskell, Commissioner of New York City Emergency Management. Today is my last full day as Commissioner of New York City Emergency Management. I cannot tell you how much I appreciate the opportunity to be here in front of the City Council on my last full day at Emergency Management. I also, in all seriousness, want to just say how much I appreciate the opportunity to testify today alongside so many great public servants, including Molly Park, who I have shared this dais with before and who I consider, along with her team at DSS and DHS, amongst the heroes of the migrant crisis. I also appreciate the opportunity to talk about extreme weather, including cold, that puts so many New Yorkers, especially our most vulnerable, at risk. While I recognize that much of the public conversation around this weather event has been focused on the tragic loss of life among New Yorkers experiencing homelessness and on questions as to whether emergency orders should be used to involuntarily remove individuals from the streets or whether encampment sweeps should resume, it's important to acknowledge that winter weather is just one example of how extreme weather conditions in New York City can be extraordinarily dangerous across many contexts. We see this not only in exposure on our streets, but also in fires, in heat-related illness during the summer, and in flooding and other hazards that impact New Yorkers in different ways. As we have seen with other aspects of severe weather, climate change and its impacts continue to pose new challenges to New York City. City agencies are working to adjust our plans and outreach to New Yorkers to address increased extreme weather hazards and their consequences. Climate change is already reshaping how New York City experiences heat and cold, forcing changes in how we plan, build, and communicate about severe weather. Average temperatures are expected to rise by about 3 to 7 degrees by the 2050s and 5 to 12 degrees by the 2080s. Days at or above 90 degrees could increase from about 17 per year today to as many as 54 by the 2030s and more than 100 by the 2080s. Heat waves may grow from about 2 per year to as many as 9 or 10 by the 2080s. At the same time, very cold days below 32 degrees are expected to decline from roughly 70 per year to as few as 17 to 34 by the 2050s. This means less sustained cold, but more frequent temperature swings above freeze-thaw cycles that can put considerable strain on infrastructure. While the city has experienced prolonged stretches of sub-freezing temperatures before, what makes this one so notable is the confluence of other factors around it and some nuanced aspects of the cold itself. Not only was this cold air outbreak preceded by significant snowfall, but also unusually daytime temperatures, which often rise into the high 20s or early 30s or low 30s, remained dangerously cold throughout much of this event. These prolonged cold temperatures and snowfall not only complicate response, but present an additional hazard that quickly drain heat away from anyone exposed outside. It should also be noted that temperature extremes have been growing more intense in New York City with the changing climate. These growing extremes, along with rapid transitions between them, are increasing risks to public health, city systems, and vulnerable New Yorkers. City agencies are updating plans and public outreach to address these evolving hazards and their impacts. At Emergency Management, we work every day with a singular focus on reducing risk, strengthening preparedness, and ensuring that no New Yorker faces extreme weather or any emergency alone. Our hearts are broken for those lost over the past 2 weeks, not only for the families and loved ones of those New Yorkers who have passed, but also for those lost in fires in recent weeks and to hypothermia. Each of these losses is felt by our entire team, and they also serve to show how serious we must take the dangers of today's weather. These tragedies remind us that extreme weather is not a single incident or a seasonal challenge. It is a persistent and evolving threat that requires coordinated planning, clear communication, and sustained partnership across government, communities, and the private sector. Our approach in emergency management is proactive and collaborative, built on supporting New Yorkers through training, education, and timely emergency notifications, aligning government agencies with community and private sector partners to coordinate responses in real time, and supporting individuals and neighborhoods through recovery so resilience is strengthened with every event. Our intent is clear: to ensure that every New Yorker has the information, support, and coordinated response necessary to reduce risk, protect life, and enable communities to recover stronger after every emergency. At Emergency Management, we work extensively with community groups, local and ethnic media, and other organizations to educate the public about the dangers of extreme weather and ways to protect themselves and their loved ones. Last year alone, our team conducted 435 Ready New York events across all 5 boroughs. And as I said at the January 26th press conference with Mayor Mamdani at City Hall, just because the snow had stopped falling and cleanup was underway, we were not out of the woods. As we have seen over the past 2 weeks, dangerous weather conditions persist beyond the snowfall, with frigid temperatures that place vulnerable New Yorkers at risk, as well as our critical infrastructure and utilities. Winter weather can also mean hazardous visibility conditions due to high winds and blowing snow, and in some cases, coastal flooding. It can also mean icing in the waterways of the city. All of these hazards require emergency management to coordinate and communicate so the city and its residents are ready to prepare for, respond to, and recover from winter weather events. Emergency management is always tracking weather conditions in real time in conjunction with our agency meteorologists, as well as the National Weather Service, 24 hours a day, 7 days a week, and then disseminating related hazard information to agencies and to the public. In preparation for the storm, NYCM started hosting multi-agency calls on January 22nd when the winter weather plan was activated. The Emergency Operations Center started staffing on January 24th and remains staffed to this day. Calls were held with elected officials, providing forecast updates and inviting multiple agency partners to speak directly to their operations and response posture. Daily private sector calls were held with participants representing multiple industries, including financial resources, retail, food distribution, airlines, and real estate. Calls were also held with community partners and those representing vulnerable networks throughout the city. We worked with the Board of Elections to communicate about early voting and with New York City Public Schools to communicate about the pivot to online learning. Emergency management conducted 4 briefings for city, state, and federal elected officials. Notify New York City, New York's official free emergency communication pad program, had nearly 70,000 new subscribers in 1 week, the largest organic growth surge in its history, bringing the system close to 1.5 million users. Between January 24th and 27th, the program added almost 35,000 new subscribers, the 3 largest day increases ever, demonstrating rapid public response to coordinated city leadership and safety messaging. Citywide Notify NYC English Nixle subscribers more than doubled in 7 days, increasing by over 33,000, showing unprecedented demand for real-time, location-specific emergency alerts. We know that people want to know what is happening, and since January 22nd, the program has sent out 86 notifications and counting relating to the winter weather emergency. Examples of Notify NYC messages sent in 14 languages, including American Sign Language. During this time included alerts around weather preparedness messaging, real-time weather impacts, transportation disruptions, warming center hours, and amplification of the city's enhanced cold blue. As dangerous cold temperatures moved through New York, the extreme and prolonged cold weather required flexibility and changes to the city's operations to keep the public and most vulnerable population safe. As a coordinating agency, emergency management's role in this extended cold weather event has been to work with and support our partner agencies with core competencies in sheltering and care for vulnerable populations in their operations, and to connect them with other partners who have assets and resources that the city can leverage in emergencies like this one. This prolonged, still ongoing activation has demonstrated the city's flexibility in rapidly scaling emergency operations and targeting them to population and locations experiencing the most acute needs. This operation further demonstrates the interagency staffing model to recruit interagency staff to fill emergency shifts, and the city will continue to refine this model to better coordinate with agencies and staff. As we have seen with other aspects of severe weather, impacts continue to pose new challenges to New York City, and city agencies are working to adjust our plans and outreach to New Yorkers to address this hazard. We will continue to pursue giving New Yorkers the most up-to-date information on the potential dangers so they can make any adjustments to their activities as needed and to stay safe. Thank you for the opportunity to testify today.
Good morning, Speaker Menon, Chair Felice, Chair Hudson, and members of the Council. My name is Alex Crone, and I am the Deputy Commissioner of Strategic Initiatives at the NYPD. On behalf of Commissioner Tisch, I thank you for the opportunity to testify today regarding the department's role in the response to the recent winter storm and extreme cold conditions in New York City. The city has been under a code blue emergency since January 19th, with code blue consistently being declared every night until an enhanced code blue emergency was declared on January 31st. Code blue is activated between the hours of 4 p.m. and 8 a.m. when the temperature, including wind chill, is expected to drop below 32 degrees. By contrast, enhanced code blue is put in place 24 hours a day when there's a significant amount of precipitation, temperatures drop below -5 degrees, there are sustained high winds, or at the request of the New York City Office of Emergency Management or City Hall. During a code blue or enhanced code blue activation, all 311 calls concerning homeless individuals are deemed code blue calls and are immediately routed to 911. EMS is the primary responder to those code blue calls. The NYPD will typically only respond to such calls if requested by EMS. That being said, if EMS is in backlog, or if EMS expects that it will not arrive on scene within 10 minutes, an NYP unit is also dispatched to help ensure a timely response. Oftentimes, NYPD officers are the first to arrive on scene in response to code blue calls. In those instances, officers will verify that an individual is in need of assistance, and if so, coordinate with EMS to expedite the arrival of an ambulance. This has not only improved the response time to code blue calls, but also helped EMS triage and direct its resources where they are most needed. Since January 19th, the NYPD has responded to 2,679 code blue calls as of midday on February 8th. In 22% of these responses, officers determined that an EMS response was unnecessary because the individual either was not at the location or was not in need of assistance. That information is relayed to EMS, which then removes the code blue call from its queue and enables EMS to direct ambulances where they are in fact necessary. During the course of the emergency, officers across the city and the subway system have offered shelter to 1,570 individuals, with 540 of those individuals accepting shelter. In a small number of code blue cases, responding officers may identify circumstances that require the involuntary removal of an individual in distress to a hospital. Involuntary removals are governed by strict legal standards and are only permissible when individuals reasonably appear to be suffering from mental illness and, as a result, pose a risk of serious harm to themselves or others. For example, there are times when an individual suffering from mental illness is at risk of death from the cold and is refusing assistance. In those circumstances, officers will, consistent with the law, forcibly transport that person to a medical facility for evaluation. They do so to save that person's life. Since January 19th, our officers have made the decision to involuntarily move 52 individuals who were outside at the time our officers encountered them. To be clear, the efforts that I am describing are completely separate and distinct from homeless encampment cleanups. Those cleanups are conducted by the Department of Social Services and the Department of Sanitation, with NYPD officers serving in an ancillary role to provide for the safety of those conducting the cleanups and to voucher certain types of property. The city paused all such cleanups on January 5th as it reassesses its approach to homeless outreach, and that pause remains in effect. Throughout this period of extreme cold, the men and women of the NYPD have tirelessly assisted in the citywide effort to keep people safe, and we will continue to help EMS and other city agencies in their critical work. Thank you for the opportunity to testify today, and I look forward to answering your questions.
Thank you so much. I first of all want to recognize that we've been joined by colleagues Councilmember Arreola, Felder, and Sanchez. I'm now going to turn it over to our public advocate, Jimani Williams, for an opening statement.
Thank you, Madam Speaker. As mentioned, my name is Jimani Williams, public advocate of the City of New York. I want to thank the Speaker and Chairs Felice and Hudson, as well as the members of the committee and the City Council who are here today for this important hearing. The snowstorm that landed in New York City in late January was the first major snow event in 5 years. Parts of the city were blanketed in 15 inches of snow and ice, and temperatures as cold as we've seen over the past months are far lower than what we have come to expect. I do want to credit the administration and OEM, particularly in those first few days, of making sure that the city can still move. So congratulations on that. I think there's some questions that need to be answered as we move a little further. But temperatures, as we mentioned, were just far colder than we expected for a longer time than we expected. So I know that it made things harder. It does make us continue to ask questions. Are we prepared for the next major snowstorm or the major cold spell that is going to seemingly just keep coming now? And even more generally, are we ready for climate and weather-related emergencies going forward? As we enter the budget season in Albany and soon after in New York City, what are we doing to backfill the vacancies in vital services roles left by the previous administration while we look at very real budget gaps, especially from programs like City FEPS, which by design keep people in their homes, when we know that the most basic prevention from deaths during an extreme cold emergency is shelter. The deaths of New Yorkers on streets during these frigid weeks are very tragic. As I understand, at least 18 New Yorkers lost their lives between January 23rd and today. Of those, which we haven't confirmed, but from the information we received from admin, 10 are presumed from hypothermia. No matter the cause of death, it is heartbreaking to know that our neighbors lost their lives out in the cold, believing something could have been done to prevent it. There needs to be a full accounting for what led to these losses. We also must look expectantly to continually expanding efforts from the new administration to provide government support that helps ensure such future pain is prevented. Unfortunately, some are using the deaths of our fellow New Yorkers for bad faith political and policy attacks. I think there's room for discussions about what to do with encampments, But I do know that tearing down encampments and taking away people's personal possessions would not help them not die in the cold. Shelter would. Today, the City Council will look at what steps the city has taken and where the programs can and should be expanded. I presume and assume the loudest voices like the New York Post that were using these bad faith political attacks will join us, not just in weaponizing these deaths, but speaking out for expansion and supportive and deeply affordable housing and increased services for New Yorkers, instead of putting more effort into exploiting New Yorkers in death than they do in supporting them in life. I would also just for DSS and HRA, I know that there was a combination of the agencies a few years back, and I'd be interested to hear in responses if that has led to any people waiting to receive their housing or receiving their vouchers, which may lead them to be homeless more than they might have if these two agencies weren't combined. I know there were some lawsuits around these, the combination of these agencies, and I just want to make sure that they're working as optimally as possible, because from what I hear and from the lawsuits, it may not be, and I'm wondering if that had contributed to some of the homelessness. But thank you so much, and I appreciate us having this hearing. I think the city deserves to hear what was done, what wasn't done, and how are we going to prevent it from happening in the future. Thank you.
Thank you so much, Public Advocate. So we have a number of questions, and our questions are in the spirit of trying to understand what happened so that improvements can be made. And so that is really our goal here. The first question I have is that obviously two of the commissioners on the dais are leaving city service. So first of all, I want to thank you both for your dedication, your years of public service to the city. My first question is, what are the administration's plans then, given the critical role that your two respective agencies play, and given that we're in the middle of this crisis right now, what is the administration's plan then for sort of a seamless transition so that there are not gaps in service?
Thank you. I'm happy to start. While I will defer questions about the administration's plans to the administration, I will note that DSS has an immensely deep bench, a lot of very talented and very experienced public servants, and I am a 22-year veteran of city government. I am not going to run away and leave the agency in the lurch, and I will do everything I can to ensure a smooth transition.
I'm going to echo Molly's words. I'm not going to speak for City Hall administration in terms of finding my replacement. What I will say is I'm leaving an agency that has historic low vacancies, historic retention, and 100% of our executive staff positions are filled right now. So I'm leaving an agency in a really good place in terms of continuity and their ability to keep going. Also, tomorrow is my last day, and the city will be a balmy 45 degrees.
That's very fitting. Thank you. So, Commissioner Park, you testified in your testimony that if an individual that is experiencing homelessness refuses to be moved to a shelter, that your team conducts a clinical review to see if that individual might be a danger to themselves and therefore appropriate for involuntary removal. I guess my first and fundamental question is, how can a person refusing to come indoors in freezing weather, where they are obviously at great risk of potentially dying, not be assessed to be a danger to themselves?
Thank you, Council Member. These are very individualized assessments in accordance with the law and with best practice. So clinicians really are looking to see if the individual meets the twofold test, which is, are they exhibiting signs of mental illness, and are they a danger to themselves or others, right? So if an individual is completely lucid, they are dry, they are wearing enough layers of clothing, and they do not want to come inside, they have the right not to come inside. That being said, absolutely the weather contributes to that assessment of danger. So since January 19th, we have, and running through the beginning of this week, DHS and our contracted outreach providers have done a total of 33 involuntary removals, which is far more than we would normally do in a few-week period.
But is it humane to leave them outside?
This is a very challenging situation, and I fully acknowledge that it is a very challenging situation. First of all, this is based absolutely on individualized assessments, and it has to be done in accordance with the law, right? Which is this twofold test about exhibiting signs of mental illness and danger to self. These are adults with agency and civil rights, right? So if somebody does not meet that test that is codified in state law, we do not have the right to bring them inside. And that is why we lean so hard into the relationship building and the trust building, because our goal really is to get as many people inside as possible. We have had about 1,400 placements from the street into various shelters and warming centers.
I'm sorry, how many? Can you?
About 1,400 into various transitional settings. That includes shelters, safe havens, trips to the hospital. It actually does not include the warming centers, which are a much more informal, people walking in and more ad hoc basis. So we have been able to get people inside, and the involuntary removals are a small slice of it, but it is a tool that we use. And as I say, the 33 that we have done in this time period is substantially more than would be typical.
So DHS reports approximately 2,000 vacant city-funded supportive housing units. What actions, if any, were taken during this emergency to bypass prolonged shelter stays and connect unsheltered individuals directly to housing?
So let me start by saying that connecting people to permanent housing is incredibly important to us. In prior years, DHS, with respect to people experiencing unsheltered homelessness, sort of declared victory when somebody was indoors and off the street. Under my tenure, it has been very important to me to make sure that we are continuing with that follow through and making sure that we are getting people to permanent housing. Last year, we placed about 1,200 people who had been experiencing unsheltered homelessness into permanent housing. So that work is incredibly important. The supportive housing landscape is an incredibly complicated one. We tend to talk about it as if it is a monolith, but is in fact dozens and dozens of different programs. And so with different oversight agencies, different contracting agencies. The vacancies that exist, the majority of them are linked. There are tenants who are linked, and we are working through the process to get them inside. There are a relatively small number of units where there isn't a tenant yet linked to it. That is a combination of really a reflection of the normal churn in a portfolio of units that is about 39,000 units of supportive housing across the city. In terms of expediting placements, we are certainly working very closely with the supportive housing providers to do whatever we can, but I will note that almost all of these buildings have very high stakes financial and regulatory requirements attached to them, right? So particularly all of those buildings that have low-income housing tax credits, which is the bulk of the supportive housing attached to it, if it gets used for an alternative use or a person who moves in is ultimately ineligible, there are enormous financial consequences for the housing that can jeopardize its viability going forward. So we have been laser focused on getting people indoors during this crisis, into shelter, into warming buses, into hospital waiting rooms, whatever the setting. The permanent housing piece of it has been sort of somewhat secondary right now, just because there are such complicated regulatory environments that it is hard to move fast. So our priority has been on what can we do quickly. And as I noted in my testimony, but we opened 4 additional low barrier sites during this time period with hundreds of beds, so that we would be able to ensure that we had that capacity whenever.
And were all of those beds filled?
3 of the sites are full to the allowable capacity. One of them has some additional requirements that on who is allowed to move in there that were agreed to during some community negotiations, so that one's going a little bit more slowly, but it will be filled.
You mentioned the warming buses, and I know there was a number of different reports, and I heard concerns from a lot of my colleagues about the warming buses that in terms of public notice about them, in terms of reaching those experiencing homelessness where they are, what can the city do better next time? Because I think that's something that that's the whole point of this hearing, is to sort of uncover answers and to try to come up with best practices moving forward. But what were the issues around the warming buses? Why weren't they connected to communities that really needed it most? And also, we saw a lot of reports from the press that they weren't allowed to take photos of the buses, or they weren't allowed to access. What was the policy reason behind that?
Sure, thank you, Speaker. So, we were moving very quickly on this. So, the morning after the first buses were up and running, I got an email from an advocate saying, the sidewalk wasn't shoveled around the buses and there wasn't a sign. And so we dealt with that same day. So those were not in place the first night, but they were in place by the second night. We actually have been quite nimble with the buses, moving them around to places where we are seeing the highest demand. And because of that, we have not been putting out sort of hard copy written documentation of where the buses are, because we are adapting on real time. Instead, what we've been using is the 311 website, and certainly people can call 311 as well, and making sure that all of our partners know that that is the live source of information. So certainly our contracted outreach providers are aware. We've also worked with the SOS teams, which are outreach teams that are contracted by the State Office of Mental Health, engaging with sister agencies that have teams that, while they're not doing dedicated homeless outreach, are interacting with people on the streets. So, for example, the DOHMH mobile crisis teams. We have shared this with our DSS partner list, which is hundreds and hundreds of organizations, with faith-based partners, and on, and really reinforcing that 311 is the best source of information about where those buses are on a given night. Also grateful that the mayor had was put out public service announcements on the kiosks, that those are very visible. So we are really trying to reach every source of communication. I think we will, as we debrief, we've still very much been in the throes of it. So I would say that the analysis and self-assessment is still in process, but we will certainly look at all those communication tools and think about whether or not there's things that we should add.
Yeah, I think you'll hear a lot from the colleagues on that. I know they have a number of different suggestions about how we can increase notice around the warming buses. So that's an area of real concern.
I'm more than open to those suggestions.
So we know that obviously more New Yorkers have died during this cold spell, according to city-compiled death toll of 18, which is more than the 14 who died in the aftermath of Hurricane Ida in 2021. So we're obviously deeply concerned by the number of deaths. One death is too many. 18 is certainly far, far too many. So we want to understand, how does this rate of deaths compare to past snowstorms? What do you attribute this increase to? What steps are you taking to address these issues? Are you going to be doing a corrective action plan? And if so, what would that look like?
Thank you. So for an average year, for the total number of hypothermia-related deaths for people experiencing homelessness, it ranges from about 10 to 20. So we are certainly seeing, although we do not have final causes of death for people, and from everything that we know at this point, it will be not all 18. I think it is certainly safe to say that this is going to be a year that is outside the norm, which is tragic, and I feel that every day. So I think we will be looking at what we can do differently, absolutely. As I noted, we have been very much in the throes of this, so I think we are still doing, but I think we made a lot of innovations during the course of this cold snap that I think are going to be things that we build into our normal toolbox going forward. Really grateful for the partnership with H&H. The ambulance services that they have stood up have been incredibly helpful. One of the things that has been a relatively small part of our response, but that I would like to see more of, is the peer work. We brought people who are currently living in shelters and safe havens onto our outreach teams. I was able to get a small foundation grant so that we could pay them, in real time onboarding people is not necessarily something that we can do quickly from city government, so that's why we went to the private sector. I think there are moments where, particularly as I have mentioned, people who are deeply traumatized and distrustful of systems are not going to take, government or government workers as a trusted messenger, and a peer can be. So I think that is something that we should be building on. I think, recognizing that we need to continue to build on our safe haven capacity is important. So there absolutely will be lessons learned, and I think there are, and as well as pieces of our response that we evolved on the fly that should be incorporated into the ongoing response.
Now, I want to talk a little bit about Kendra's law and understand if this administration is slowing or curtailing the use of Kendra's law, particularly regarding those individuals with serious mental illness who pose a danger to themselves. Is there a change in position in terms of Kendra's law, and if so, what is that?
There has not been any change in position, and just to be clear, for somebody to be subject to Kendra's law, that goes through the court system.
And how many Kendra's law petitions were initiated during this Code Blue period?
I don't have that data. I'll have to get back to you.
Okay, if you could get back to us. I want to understand how many were initiated and how that compares to prior cold weather emergencies as well. Now, in terms of street outreach capacity, the New York Times reported that DHS street outreach staffing declined from 600 workers in 2021 to roughly 400 today. Given current levels of those that are experiencing homelessness, how can DHS credibly claim that this workforce was sufficient during a life-threatening cold emergency?
So there was a little misrepresentation of the numbers, confusion about the numbers in what got published. So there are two ways of looking at the number of people that are doing outreach. There is the literal boots on the ground, people whose full-time job it is to be out on the street. There are about 400 of those, and that has been the case for quite some time. Then there are another approximately 200 people whose job it is to do related support services. So this includes the caseworkers, the housing specialists, the supervisors, and so on. They may spend some of their time on the street, some of their time working with clients in indoor settings. That's about another 200 people. So when we've talked about going, the number 400 and 600 get used, and I think it has been there's been some confusion about
what is the number then?
So it's about 400 who are on the street as their full-time job, and 600 when you include the caseworkers, housing specialists, and other related staff. So, and just to be clear, this is with contracted outreach providers, so not DHS employees. So there has not been an appreciable change in the number of people. It's some confusion about which number we're talking about.
Well, how many outreach workers were deployed during Code Blue? Where were they sent, and what data was used to determine the deployment locations? And specifically, did outreach teams speak with any of the individuals who passed away in the last couple weeks?
So there are about, as I mentioned, about 400 outreach workers working through our contracted outreach providers. That 400 number covers our 3 shifts a day, 7 days a week. So there was never a moment where there were 400 people on the street at one time. But they were, outreach workers were working overtime. We had DHS staff, additional DHS staff working overtime. So we did have a robust presence on the street. We also engaged with sister agencies that were doing adjacent work. So the SOS teams, the State Office of Mental Health, I mentioned this, talking about communication as well. So a lot of work going. The deployment is based on where we know that there is historic concentrations of people experiencing unsheltered homelessness. So we send people to the neighborhoods where we have patterns, what we have observed doing outreach in other on other days of the year, what the 311 data shows us, where we were seeing high demand on the warming buses. So we were being very responsive to the trends that we were seeing on the ground. So we did do quite a bit of adaptation there. I'm sorry, there was one more question. Can you repeat that?
Well, did the outreach team speak with any of the individuals who
Thank
passed
you.
away?
So with the caveat that we are still doing, full assessment of the individuals, of the people who passed away, the majority of them, not all of them, had had some contact with DHS, but the number that had had some contact in the very recent times was fairly small, right? So when I say some contact, that can include that they interacted with us in the weeks or last month or two, but it also includes individuals who are in shelter for a week, 10 years ago or even 20 years ago. So we took a very expansive view of looking at who had contact with the system. So it's a relatively small minority of people who were active clients.
So of the 18, how many would you say had contact?
Active clients, it was a handful.
And can you be more specific then about what that contact was?
Again, the circumstances for each individual are different, but there were people who had active shelter placements that they but that didn't arrive at the active shelter placement. There were people who had come through intake. So it was a variety of different circumstances. We are still assessing the specifics of each case. And then, as I noted, a number who had their last contact with the Department of Homeless Services was many years ago.
Okay, if you could please provide to the two respective committees the details about what that contact was. We would like to get information on that. I have a lot more questions. I'm going to ask 3 more questions, and then I'm going to turn it over to my colleagues. So what is the required protocol when someone declines shelter during Code Blue, and how often must outreach teams re-engage them? And do you then ensure that no one is simply marked, refused, or forgotten?
Absolutely. That's an important question. So during a regular Code Blue, the DHS and provider outreach staff are going out and checking on people on that vulnerable list that I mentioned in my testimony every 4 hours, and during an enhanced Code Blue, which is what we've been under for several weeks at this point, it is every 2 hours. Obviously, people move. They may not find each individual every 2 hours, but that is the goal.
Okay. 2 more questions before I turn it to my colleagues. So with DHS, H&H, NYPD, EMS, state outreach teams, and multiple non-for-profits all operating simultaneously, who was in actual operational command during Code Blue, and how were decisions coordinated in real time?
So DHS staff, our outreach providers, the SOS teams, and DOHMH all have access to our database that we use for managing and working with unsheltered clients. It's known as Street Smart. So we do quite a bit of shared data. In addition, DHS has a 24-hour command center, is what we refer to it, that handles all of the placements, so that all of the entities that are engaging with people on the street, should they have somebody who wants a placement, that they call that centralized location, and they can figure out where the vacancy is and make sure that that placement is happening in real time. But I would also say that this is an area where we have very strong relationships, and so there was also quite a bit of let's pick up the phone, and if we need to do any problem solving, if we need to say, hey, we need more teams over here, we picked up the phone and we did that in real time.
But does one agency have the final say?
I think it depends on the final say on what. If it is the final say on placing people into DHS facilities, absolutely, that is DHS.
Okay, and last question before I turn it to my colleagues. You mentioned in your testimony that after this emergency, the agencies will take a look at sort of where there may have been gaps, failures, et cetera, that to focus on corrective steps moving forward. So has the city conducted, or will it commit to, an after-action review of Code Blue operations, including the deaths, any outreach gaps, hospital discharges, NYPD coordination, and when will the council receive these findings? And I would just add on that on terms of one of the deaths I mentioned, Noberto Jimbo Noyola, he was discharged from Elmhurst Hospital during Code Blue. He returned to the streets, and he later died from exposure. So that's an example of what we want to fix. Obviously, that never should have happened. We need to fix that moving forward. So what I'm specifically asking is, will you commit to a corrective action plan that you will then share with the City Council?
Well, I can't commit to anything for my successor. I don't think I will be here. But I do know that the DSS team is an exceptional group of public servants and who remain committed to always learning, thinking about how we can do better to serve our clients. So I am confident that some version of that will happen, and I will defer to my successor.
Yeah, so at New York City Emergency Management, we do a lot of after-action reports, and I think it's something that we can commit to doing an after-action report. We will do an after-action report for this winter weather event that takes all of those issues into consideration. And I just want to add that, this is something that nobody takes these tragedies, other than the families of those lost, more seriously, more personally than the people who work for this city. Right? We count each one of these 18 deaths as a tragedy and something that we always ask those questions of what more could we have been done. And I think, Speaker, earlier you had asked you brought up Ida. And I think when you look at, and I mentioned this briefly in my comments, we are in an age of extreme weather. Last summer in June, we had an extraordinary heat wave in the city. That death count is on par with what we experienced from Ida or what we have experienced from this cold weather break over the last couple of weeks. Ida, as you mentioned, 13, 14 people lost their lives. And I think that there are also still, looking at Ida, there are still some legislative fixes that could be implemented as well. I've read those casualty reports, remember those after-action reports. And so just what I would ask is that in the spirit of this hearing, I think there's a lot that we can focus on the response, but at the same time, there's always more that we can be doing holistically across government to ensure these things don't ever happen again, and I think that's a conversation worth having. Thank you.
Okay, thank you. I have more questions. I'm going to go on second round, but I'm going to turn it over to Chair Hudson for her questioning.
Thank you so much, Speaker Menon. I'd like to acknowledge that we've also been joined by Council Members Nurse, Mealy, and Wong. Commissioner Park, you were speaking about the circumstances under which DHS would have the final decision. Were there other examples of other agencies that would have a final decision on moving folks off the street?
So, thank you, Council Member. I would say there is a form of involuntary removal that is done through the police department. I think my colleague testified to that. With respect to coordination, right, there are certainly entities in all of this process that where we do depend on collaboration and good communication and relationship building to be able to manage through this. So, for example, there's been discussion about hospital systems. We send at the beginning of the Code Blue season, so this year in November, we send a letter reminding hospitals that it is their obligation to allow people to stay indoors during Code Blue, to be in warming centers. We reissued that guidance on, I believe, January 30th, that again reiterated that waiting rooms could be used as warming centers, but also reminded them that nobody should be discharged without an adequate plan, and that should be the case always, but particularly during Code Blue. At the end of the day, we are not the regulatory agency for the hospitals, so in terms of, most of the hospitals are extraordinary partners, but I can't compel them to do anything. What we did see, though, was that the State Department of Health also issued guidance. They were a few days later than we were, but I think, I believe I said ours was the 30th. I think ours was the 26th. Theirs was the 30th, reminding hospitals of their obligations as well.
Okay, if yours was the 26th, you said, right? January 26th?
Yes.
Okay. The first major snowfall was on the 25th, followed by freezing temperatures on the 26th. I just want to note that. And then just with regard to the letters to hospitals, and then Deputy Commissioner, I'd like to address training for the police as well. But the letters are sent to the hospitals. Are you aware of any specific trainings or reminders before shifts? Same for the police. Are there any, announcements during shifts, about Code Blue status and what's happening?
So let me speak to the hospitals before I turn it over. So just to clarify, we sent a notice to to all the hospitals in New York City in November of 2025 at the start of the Code Blue season, and reissued it with stronger language on the 26th. So this was, we didn't start
Was a reminder.
mid-storm.
Understood.
We were engaged before then. We talk regularly to the hospitals, and in fact, the DHS team, our Street Solutions team will call hospital emergency rooms on a nightly basis for those that we know have particularly high concentrations of people who might be in the waiting rooms. So we do a lot of regular check-in. I can't speak to what they might do in terms of, real-time training with the hospital staff.
Okay, I'm just noting that there was at least one report, a publication that reported that there was a person who was found with actual discharge papers from, I believe, Elmhurst Hospital on his person when he was found. So I know you're not responsible for the hospitals, but I'm just noting here for the record that clearly there is a gap there.
Understood.
Thank you.
As to how we inform our officers about Code Blue, so when Code Blue is determined by DSS, a notice goes out to across the entire department about the activation of Code Blue and what the obligations of our officers are to homeless individuals during that time. That happens on a continual basis throughout the entire emergency. In addition, just given the length of what happened here, we sent out subsequent notices informing officers more specifically about safe havens, places where homeless New Yorkers can go to provide them more information. And officers are extensively trained on what to do during Code Blue, how to handle the difficult decision of involuntary commitments, and that's done on a regular basis.
Thank you. What type of assessment, if any, are outreach workers doing to identify the needs of individuals they encounter, such as identifying any physical, psychiatric, or cognitive disabilities which may inform the placement that is appropriate for them?
Thank you. That assessment is the core of what we do, and what it looks like on the ground is going to depend on how willing that individual is to engage. So at bare minimum, there is going to be a visual assessment, right? Is the person covered? Are they dry? Are they wearing a lot of layers? And then to the extent possible, we are always also looking to engage, ask questions. How are you doing? Do you have a plan for what you're going to do if you get colder? Those kinds of questions, which are assessing the individual's ability to understand the challenge of their circumstances, but also getting a handle on whether or not that individual is experiencing obvious signs of mental health crisis. It is very much based on the clinical judgment of the nurses and the teams that go out with nurses, and the experience and the training of the social service staff that are out there on a night-by-night basis. It is absolutely on an individual basis. It's not a, checklist. If this, then the person is okay.
And according to agency data entry protocol, what information is entered concerning contact with a street homeless individual into the Street Smart database? And at what point does data entry occur? For example, while in the field or at the end of a shift?
So right now it does happen at the end of the shift. Our system is web-based, and we don't have a way to do it in the field. We are looking at an option to have an app base that could allow for real-time entry. With respect to the items, we are looking at the time and location of the engagement, what happened, what did the person say, and why, if we know why they refused placement, and follow-up that is recommended. So we are actively looking to make sure that we are sharing the best possible information across the system, knowing that somebody might be in the above ground today and in the subway system tomorrow, and that is going to be a different outreach team.
And are all the street outreach workers deployed to do Code Blue outreach performing data entry to Street Smart?
Yeah, Street Smart is our system of record.
Okay. And are organizations who have contracts with the city for street outreach able to access information regarding contacts entered by other organizations, or only their own contacts?
No, everybody can see what is in Street Smart comprehensively.
Okay. And is the data in StreetSmart available to access in real time for others with access to the system?
For the SOS teams, for the DOHMH, the other organizations where we have data sharing agreements, yes, they can see it. You know, the only caveat on the real time is that the data entry for a given shift is happening at the end of the shift.
Okay. And how many unsheltered homeless individuals have entered a shelter or drop-in center since the beginning of the current Code Blue? Is that the 1,400 number that you mentioned?
That's about 1,400 placements made. That may not necessarily correspond to unique individuals, right? So somebody who accepted, went to a placement, was left the next day, might have another placement.
Okay.
I will note that does not include placements to warming buses because that is being done on a much more informal basis. The design behind the warming buses is to have it the lightest touch and easiest to access system. So people
Are you collecting data, though, for information? I mean, on people who...
We have counts on the number of people who've been on the warming buses, but, you don't even need to give your name to get on a warming bus.
Okay. And have any drop-in centers or safe havens hit full capacity? And if so, how often and how does DHS serve additional clients in need when this happens?
Right. So, certainly our safe havens are running at very low vacancy rates. There are sites that are completely full. It is a big part of the reason why we opened 4 additional sites during this cold snap, 3 of which were sites that were in the pipeline already, but we were able to expedite, and one that is fully new.
Moving on to, well, I guess it's in the same vein, but street outreach specifically, what options for shelter were offered to individuals staying outside? So, for example, are they offered a congregate shelter placement, a bed at a safe haven center, a warming center, a warming bus, all of the above?
It is really an all of the above answer, right? What we want to get somebody inside, and what might work for one individual isn't going to be what works for another individual, right? So somebody might, the warming bus where you don't have to give your name might be the best option for some individuals. Somebody else might be ready to take the step and accept a bed, which does require a little bit more engagement with us. And so we are putting everything we have on the table when we're engaging with clients.
How long are folks allowed to stay on a warming bus?
So most of the warming buses we've had are open 24/7 with a brief break for cleaning during the day. There was, I think it was not this past weekend, but the weekend before, there were a number of MTA buses, and those were provided to us only on the overnight hours.
They're open 24/7, but is one allowed to stay on a warming bus for 24 hours?
With the exception of the
cleaning
cleaning
time.
break, yes.
Okay. Were individuals always offered transportation to an indoor site?
In almost all cases, yes. We really do try and make sure that we are transporting people. We know that it increases the likelihood that somebody's actually going to check into a site. There have been resource constraints through this whole thing, so in some instances, we're connecting people to the subway.
Okay. Can you talk about the folks who are actually on the Code Blue outreach teams? Are they social workers, clinicians, police officers? Who makes up that Code Blue outreach?
So there's very rarely an instance where there is a police officer on an outreach team. The only instances where that's the case is these designated subway teams that started during the Adams administration. But the street outreach is all done by social service staff. Many of those teams have a clinician that could be a social worker, could be a nurse, but the bulk of the staff are going to be trained social service canvassers, but we do a lot of training to make sure that people are equipped for what is a very difficult job.
And what hours were teams conducting outreach? Are there more teams deployed during nighttime hours when the weather is coldest?
So outreach teams are out 24/7. They are spread relatively evenly throughout the day, but as I noted, we've had people working overtime, engaging with other partners. H&H has really been a tremendous partner during this, and their mobile teams have been working specifically on the overnight shift. So there is a presence around the clock.
I see Dr. Long here. I don't know if you're prepared. Okay, so we'll swear you in, and then I'd love to ask you a question.
Dr. Ted Long, do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee and to respond honestly to councilmember questions?
Yes.
Thank you.
Thank you. How is Health and Hospitals notified when Code Blue is activated? And how is that guidance communicated to frontline staff, such as emergency department clinicians, discharge planners, and social workers? And I'd love for you to address the training, if any, as part of this in terms of the letters that you receive from DHS.
Yeah, absolutely. So I can break it down in 3 ways. I could talk about our hospital's role in the trainings pertaining to the letters from DHS. I could talk about our warming centers and how we are doing things differently in concert with DHS. And I can also talk a little bit about what Molly Park was referring to, about the new mobile warming units that we've created as a response to this particular emergency. So first off, in terms of the trainings that, and how that works when a Code Blue is activated, we do receive the letters and we distribute them to all of our frontline providers. I confirmed yesterday at one of our sites that the doctors had received it and the social workers, who are a key part of this, had received the trainings as well. That links into the discharge process, where we make sure that during a Code Blue, 1, we're making all of our patients aware of new resources like the warming centers. 2, our social workers are taking into account getting a patient from the hospital to where they're trying to go. That will mean making sure that we keep a patient in the hospital until we can arrange safe transport for them. And 3, even if a patient leaves the hospital or any New Yorker come into our warming centers, we have an enhanced social work process at some of our sites now where the social workers actually come in around at the warming centers to offer patients there the opportunity to engage and the opportunity to potentially transition directly to a DHS site. So that's at the level of the hospital. At the level of the warming center, I want to make an important point, which is, and actually I will quote Speaker Menon here, in terms of how we can improve operations and outreach. So as we've gone into this particular emergency, there's a requirement that at our hospitals we allow people there, we designate places for people to come, like lobbies, to remain warm. But we've gone way above and beyond that, working with DHS to make sure that we're doing everything in our power to help New Yorkers in need. For example, at all 11 of our hospitals today and at 7 of our large community health centers, which have never done this before, it's not just a place to come and stand. It's a place to come, get food, get blankets, get jackets. And if you stay with us over the night, we're offering everybody a same-day primary care appointment with a doctor like me to get you on a healthier journey going forward. Also, as I mentioned at some of our sites the following morning, we take the opportunity to check in with you and see where you are and see if you're ready to have a discussion with our social work team to enter into the DHS shelter system. The next thing that we've done, which is unique to this emergency, is we did think about how we could improve operations as we were seeing this emergency draw on. And in lockstep with DHS, we together learned from DHS about where we needed to go, and we said we're not going to rely on New Yorkers to come only to our warming centers. We're going to bring warming centers to them. So we have 33 new units. We call them the warm units. They stand for Winter Access, Relief, and Medical. It's a new model that we created as part of this emergency. 33 units will be going to over 200 locations tonight. They've been doing this since January. We started doing this January 29th. And our mantra is, we'll come out, Councilmember Hudson, and if you're a person experiencing homelessness, we'll say, how can we help you today? We'll offer you a blanket. We'll offer you a jacket. We'll ask how we can help you with your medical needs, because every one of these 33 units is run by a clinician. Then, and people tell us they have a lot of medical needs, then we'll say, do you want to come onto this warm unit, ambulette, or van with us? There, we offer you a warm meal. We see how we can help you with your medical needs further. Then after that, after we've offered you help, brought the warmth to where you are, and helped you with your medical needs, we then say, can we take you anywhere you want to go? We've driven people to residences, to shelters, to warming centers. Wherever you want to go is where we want to take you. So this has been an effective strategy so far. We've actually completed over 4,000 client engagements with over 1,500 medical engagements as part of the effort, just showing the importance of bringing the medical perspective as an additional tool in the tool belt, working lockstep with DHS. They identify sites, there's a dispatch number, they call us, we go there.
So a couple of questions. One, when you're returning folks to wherever their final destination may be, are you providing them with like transportation via cars or?
Yeah, exactly. So when you come onto one of our warming units, one of our ambulettes or vans, you could stay there with us for a few minutes. We'll give you a warm meal, and then you don't even have to move. We'll drive you directly where you want to go.
Okay. And can you talk a little bit about folks who are in the emergency room versus admitted patients? Because as I stated earlier, there was somebody who was found with discharge papers in their pocket. It's likely that they were maybe a visitor to the emergency room and not an admitted patient. Are all the protocols that you just mentioned applicable to those visiting the emergency room?
Yeah, so I'll walk you through it. And while I can't talk about the facts of a specific case, as you know, the protocols for the emergency room and for a patient that's been admitted, so an inpatient patient, if you're a person experiencing homelessness, we will have a social worker engage you. What happens every time when we have our social workers go and talk to our patients is they see what your individual situation is. If you came from a particular DHS shelter, we will call that shelter, and there's a coordinated process with DHS to ensure that we can get you back there if that's the place you want to go and that's the best place for you to go. If you have not had experience with the DHS shelter system, or if it's been a while and you don't have a particular shelter that you're coming from, we will again coordinate with DHS. Our social workers lead this, they're the heroes here, and then we will get you to DHS intake. What's different about Code Blue, whether it's the emergency room or the inpatient units, is we'll ensure that you have the right type of transport to make sure that you can get there safely, given whatever your particular medical issues are. And as part of that, we'll also, on your way out, make you aware of the fact that we have these warm units, which are active over this past weekend. Many of them were 24/7, but the hospitals are always 24/7.
But it sounds like there is a likelihood that someone could be discharged from the hospital and end up on the streets, maybe despite being informed of all of these resources, or how would that happen?
Yeah, it's a great question. So, and Commissioner Park was talking a little bit about this earlier. Our job and our mission in the hospital is to take care of you medically, and offer you all of the resources and all of the hard work that we put into making sure those resources are the best they can be, meeting you where you are, including literally bringing the warmth to you. You as an individual, though, if you have capacity to make your own decisions and you're not a threat to yourself or others, can make your own decision. So if we offer you the resources, which what I can speak to for sure is that we offer these resources to everybody in need. That is why the public health care system exists, and the Elmhurst team has been there for patients, since COVID, serving a critical role in really helping to save the city. But patients don't have to take us up on those resources if they, again, have capacity to make their own decisions. It's their choice how they want to interact with us.
Okay, thank you. I'm going to turn it over to Speaker Menon for some additional questions.
Yeah, I just want to ask two clarifying questions before I turn it over to Councilmember Feliz. So I want to, Commissioner Park, circle back to a question that I asked earlier about outreach staff, because you had stated in your testimony in response to a question I asked that outreach staff has not decreased since 2021 because the 600 outreach staff you have includes, you said, 400 boots on the ground and 200 who play a supportive role and do some outreach work. But in 2021, you testified before the council, and I'm going to quote, "This administration has tripled the number of outreach staff engaging New Yorkers on the streets since 2014 from fewer than 200 to more than 600. Those dedicated staff canvass the streets every day, building relationships over the weeks and months through regular contact and concerted engagement with New Yorkers experiencing homelessness, focused on encouraging them to accept services and transition off the street." So that was a quote. So my question is, it seems like in 2021 there were indeed 600 outreach staff on the street every day, and now there are really only 400 on the street every day with 200 in supportive roles. So I just want to make sure I'm understanding that discrepancy correctly.
No, I appreciate that, and this is a statistic that I've spent a lot of time digging in on with the team. So I think the reason that the language has been, and the number has been challenging is that while it is very clear when somebody is spending full time on the street, there are a number of full-time working with individuals on the street. A caseworker spends some of their time, a supervisor spends some of their time, so the language was less precise in the past. So I'm trying to be more precise now. It is 400, for our contracted outreach providers, it is 400 people who are full-time on the street and 200 who are spending some of their time in different settings.
Okay. It just does contradict the last testimony, but I know you're going with these numbers now. It just is, it's still not completely clear. It just seems very different than what you had said to the council in 2020. The main point and the reason for my line of questioning is the New York Times had reported this, and you're saying that the New York Times number is not correct. And so what our goal is to increase the number of outreach staff you have. Our total goal is to make sure that you have the staff resources that you need to do the proper outreach. So that is where my line of questioning is going.
And I'm grateful for that. And what I would say is that, outreach is very much a relationship-based process, right? That while involuntary removals do occur, and that is an important tool that we have in our toolbox, it is far better for the long-term success of getting somebody off the street if it is happening on a voluntary basis, and that's only going to happen if there is a trust-based relationship, and that takes time. So certainly, more people and more access to more resources, can make a difference, and we are in ongoing conversations with the Office of Management Budget on that.
And then one last clarifying question is, there was an article in the Daily News recently that quoted a deputy chief of staff at DHS saying, quote, "None of the 18 New Yorkers who've died in this cold stretch had an interaction in the past few weeks with a city outreach worker." But that doesn't completely align with what you mentioned previously in questioning, where you said some of those individuals who tragically passed away were in recent contact with DHS. So can you please clarify that discrepancy?
Yeah, I think the discrepancy is the difference between outreach worker versus DHS writ large. So I was giving you a more expansive answer, right? So somebody who came into intake at 30th Street, for example, and was placed in a shelter, they might not have had experience in engagement with an outreach worker, right? But so it is, outreach is a component of what DHS does. It is not everything that DHS does, right? It is operationally distinct from the shelter, although certainly interacts with the shelter system. So when we have been looking at the people who have passed away, we have been looking at their DHS history writ large, not just outreach.
Okay, and then you're going to, per my follow-up question, provide to the council the interactions that those that did tragically pass away, with the interactions they had with DHS, so we can understand what those interactions were.
Yes.
Okay, thank you. Chair Felice.
Thank you. Thank you so much, Speaker Menon and Chair Hudson, for the many questions. I have a lot of questions for the police department, for our NYPD, specifically questions on the NYPD's role on this issue, also coordination. How are you all working together to make sure that the services we're providing are provided efficiently and effectively? Also questions about voluntary removals and many other topics. And of course, my goal is to learn more about the processes and the systems that we have in place so that we could learn about areas that need improvement and also fixing, so that we could be better prepared to respond to emergencies like the emergency that we saw in January. So lots of questions. Some of them we already know the answers to, but I'll still ask them just to set general context for the future questions. So I guess for the NYPD, what's the NYPD's role on the issue of homelessness during severe weather?
So I could break down our response during Code Blue into 3 categories. One is 911 response. So I think you've heard a number of people said already that in Code Blue, calls for homeless help assistance that normally come in through the 311 system are rerouted to the 911 system. We respond to those calls, or as in we answer the phone, but we are not the primary responder for those calls. That's really EMS. We assist EMS as needed, or as I mentioned in my testimony, if they're experiencing backlog or if their estimated time of arrival is longer than 10 minutes. The second area where we activate during Code Blue is on patrol. So our patrol guide instructs our officers during Code Blue to do increased outreach to homeless New Yorkers. So that could be both in response to a call for service through 911, but also through their own personal observations as they're doing their work. So if they see someone, they are obligated to try to do outreach, to try to offer them services, and connect with them there. And then final, and I think this was probably one of the more effective things we did in this emergency, was proactive outreach. So starting right before the storm, we instructed all of our patrol boroughs, and then they instructed all their precincts to canvass known locations for homeless individuals, and to either offer them services or get EMS there, as the case may be. That was very successful. We made hundreds of contacts during that weekend, and there were a number of connections to shelter as well as to hospitals during that period. So I think think that proactive outreach, which continues today, we did not stop it that weekend, it continues to today, was really effective at connecting people to services and is probably something we continue in the future.
All right, so in other words, you engage with individuals when a 911 or 301 call is made, but also when a police officer sees someone for example, in the streets sleeping in the severe cold.
That's correct.
When someone calls 911 or 301, what does a general police response look like? So you mentioned that services are provided. What do the services look like?
So during Code Blue, we're not the primary responder. It would really be EMS. So EMS would respond. They would determine whether the person is in need of medical assistance, if they need our assistance. And that assistance could just be to provide, safety, their need of police support, or if they think there might be an instance of involuntary removal needed, they will call us to respond. So we really play a support role in responding to those 911 calls. We're not always dispatched.
When a 911 or 311 call is made, how long does it generally take to get a police officer to that specific location? Let's say if an EMS worker needs a police officer for whatever reason. So EMS is the primary responder. If needed, they can respond to how quickly they respond. What happens is there's a dual dispatch if the case that they're backlogged. So if they are, encountering a huge number of calls, we will be dispatched simultaneously. So our average response time in those situations is 45 minutes. Now that does not mean a person is waiting 45 minutes for someone. Oftentimes EMS does make it well before we do, but we're of course balancing, crimes in progress and things like that. So our final response time is 45 minutes, but many times we get there much earlier than that, and we are the first responder to get there. What are steps that NYPD officers take when they see, for example, someone sleeping in the streets during the severe cold? So again, you mentioned 311, 911, but also they're proactive. If they see someone sleeping in the street, they'll respond. So what does that general response look like?
Yeah, so if there's a medical emergency, right, if the person is in need of medical assistance, of course, they'll contact EMS and arrange for an ambulance transfer. I will say that during the course of this emergency, we have put people in need of medical assistance into our own police cars to get them to the hospital as quickly as possible. So that's on the medical side. On the shelter side, our officers are trained to know where drop-in centers are, where DHS facilities are, so they can facilitate transfer to those locations if the person does agree to placement.
So you mentioned that you usually relay information to EMS and other agencies. I'm sure DHS is also another agency that you relay information to when you see an individual who is homeless and might need some help.
That's correct. So in the patrol guide, it says that if there's chronic homelessness, if there's a person who is consistently homeless who we're encountering over and over again, officers are supposed to reach out to DHS and see if any assistance can be given, and that's really happening at the local level.
And what is the information that is usually relayed to DHS when you are faced with that circumstance?
That's really happening, at the officer level. So it really depends on the context and the situation that they're encountering. So it really depends on what they're encountering, in their particular neighborhoods.
Is there any data related to the amount of people that NYPD engaged with that specific week that we lost 17 New Yorkers?
Yes, so I can say that, we used January 19th as the beginning of the emergency, just because when Code Blue was starting to consistently be called. So we did engage, offer shelter to over 1,500 individuals, and actually 540 of those did accept shelter. Now, sometimes those people say, I will get there on my own, right? And so they may make it, they may not. Sometimes we are going to transport them. Sometimes we work with DHS for transportation as well.
And approximately how many of those individuals were engaged with through the 911 or 311 system versus the proactive system where you just provide help if you see someone that needs help?
So hold on one sec. I just want to make sure I have my numbers. So during Code Blue, we responded to 2,679 Code Blue calls. That was as of midday Sunday when we pulled the data. So again, those could be instances where EMS is also responding or ones where we're the only ones to respond.
So earlier today, DHS testified that they conducted 32 involuntary removals. NYPD put the number of removals at 52. Can both of you provide clarity on each agency's role in the process of evaluating and conducting involuntary removals?
Yeah, so the 52 are NYPD, they're called 941 removals because that's the section of mental hygiene law that allows us to make involuntary removals. The standards are the same, however, it's just the difference is who's making the call. Officers, as I mentioned, are trained. They've received training as recently as 2024 in the proper protocols for 941 removals. That includes the protocol during cold weather emergencies. So signs of exposed skin, individuals not wearing shoes would be an indication that the person is a risk to themselves. They are then taught on the proper method of doing 941 removals. Again, these are involuntary removals, so it requires them to do it carefully. They do it in conjunction with EMS, so officers are not putting these individuals in a patrol car. They are working with EMS to secure them in an ambulance. They accompany EMS on those ambulance runs, and then they are, of course, dropped off at a hospital, at which case our participation in the process is over, and it gets turned over to clinicians.
And we refer to our removals as 958s, again, in reference to the section of state code. These have to be done by not only a clinician, but a clinician who is certified to do an involuntary removal. So we, DHS, have, I believe, 21 nurses that work with us and our outreach teams who are all certified in doing 958 removals. And then our contracted outreach teams also have clinicians who are certified and can do 958 removals as needed. We also, have if a team that doesn't have a nurse on it encounters somebody who they believe needs a removal, that they have the ability to connect with a team that does, and we will make sure that happens. Like a 941, the removal is to a hospital where there is a more complete assessment done by a doctor.
So there's obviously been a lot of changes and a lot of conversations related to policies related to homelessness, including rules related to encampment. I'm not going to get into that issue because, as we know, the 17 individuals who lost their lives did not have encampment-related challenges. But in general, besides the encampment rules, has there been any changes related to how NYPD engages or interacts with the homeless this past month?
There have not.
No changes at all to no policies?
Other than us being very proactive during the emergency, there have not.
What happens, so earlier you mentioned that generally NYPD will relay information to EMS and also DHS and other agencies. What happens after they relay that information? Does the NYPD role end there, or do they do follow-ups?
It depends on the circumstances. So when it comes to EMS, if we are the first to arrive on scene and we determine that an individual is in need of medical assistance, we'll wait for EMS to arrive, make sure everything is stable there. But if they don't need our help, really our support ends there, right? EMS is gonna take the lead on transporting them to hospital. And it's the same with DHS, right? If a person is referred to DHS for outreach, again, our role is really limited to the initial identification, and then DHS would take the lead in providing any support.
Who does the NYPD believe should serve a top role in responding to calls for assistance of unhoused people in a Code Blue emergency?
So, it depends on the circumstance. During Code Blue, it is EMS. I think the vast majority of the issues are medical in nature, so it does feel appropriate that they would be the primary responder.
All right, so a few questions on involuntary removals, and of course, this is not to take a position on the topic. This is more about to get as much data and information related to it so that we could be able to better analyze the topic. Any data related to the 17 individuals who lost their lives during that week of severe weather? Did the NYPD have any contact with them at any point?
So we haven't done the full assessment of all of our interactions with those individuals. I would note that oftentimes we do not know the identity of the people that we are encountering if it's not an enforcement action, right? So if we're being called and someone's in need of assistance and we ask them, do you need any help? And they say no, we oftentimes will not know who that person is. So it's difficult to know if we've had contact with every single person. There has been contact with some, but we're still doing that assessment right now.
Okay. A few more questions on involuntary removals. And again, this is not to take a position on the topic. This is so that we could better understand the rules related to the topic. So obviously, involuntary removal rules allows for the involuntary removal when an individual poses a threat to themselves or others. How is this rule interpreted? So at what point is someone considered a threat to themselves? That's state law, correct?
Correct.
You have to be a threat to yourself or another person.
That's correct. So threat to yourself or others can include inability to care for yourself. And obviously during the cold weather emergency, that issue comes to the fore much clearer. So we do train our officers on what the indicia are for that. So if you bear with me, inappropriate clothing for the weather, such as no shoes, extreme swelling of legs and feet, malnourishment, exposed skin during a cold weather alert. These are all indicia that a person cannot care for themselves and that they may be eligible for 941 removal.
And are those factors stated in state law, or are those factors that were created based on the general state rule?
I need to check for sure, but I'm pretty sure these are interpretations of state law.
Interpretations by whom?
By our legal bureau.
by the legal department?
Correct.
Okay. So isn't it fair to say that if it's negative 15 degrees or if it feels like negative 15 degrees, even if someone is clothed, if they're sleeping outdoors, isn't it reasonable to conclude that they're at a severe risk and they are a threat to themselves? I'm confused about the application of that rule.
So I think, as Commissioner Park mentioned, these are very context-specific determinations. Obviously, in this cold weather emergency, we did make that determination 52 times that the person was unable to care for themselves. If it's negative 15 degrees, it becomes legally more permissible, right, to say that that person cannot care for themselves. So we train our officers to make that determination, and our legal bureau works 24 hours a day to provide them with additional guidance if they need it.
All right, so in other words, if it's negative 13 degrees and they're sleeping outdoors, they're very likely to be considered a threat to themselves.
It really depends on the context, right? If they're of sound mind, if our officers encounter them, they're coherent, they're answering our questions, they are not exhibiting signs of mental illness, it becomes more difficult. But again, it's very context specific, so it's hard to say right here a blanket rule for when it would be appropriate.
Do we know how many of those cases we had these past 3 weeks where people were assessed?
So it happens every time. Every time our officers encounter a person, they could do it, right? So it's not like a formal, assessment where they have a checklist, right? They're using their training, they're using their experience to understand that the person could be involuntarily removed.
Who makes the decision on whether an individual is a threat to themselves or others?
It's officers on the scene, and oftentimes in consultation with the supervisor.
In what cases they consult with their supervisor?
I think, I'd have to get back to you on that. I don't know if I have data on that. I think it happens a lot, obviously, because it's a difficult decision.
At what point would we consider getting the opinion of a medical or mental health professional?
Well, so once they are transported, then it is up to the medical world to determine what to do next. This is just the initial decision to transport, right? So we transport them to a hospital, and then doctors make the actual decision about what to do. So I think, making that difficult decision in the moment is best done by officers because it can happen quickly. They don't have to wait. And then the real difficult decision about what to do next is left to medical professionals.
When someone meets that criteria, are they always transported to a hospital, or are they provided options? For example, go to a local shelter?
There's no involuntary removal to the shelter, so they always get delivered to a hospital.
Okay. How many individuals were involuntarily transported this past weekend?
This past weekend, hold on one second.
Well, this past week.
I have it here, sorry. So as of, let's see, it's the 10th, we had 3, 8, 10, 11.
11 that were involuntarily transported?
That's since February 3rd.
Since February 3rd.
And again, that's just 941. That does not include the 958s.
How many people were assessed for a potential involuntary removal?
Again, there's no formal assessment, so you could say that every time we come in contact with a person, we are assessing to see whether they have sound mind and if they are able to care for themselves or others.
All right, thank you so much for all the questions. I have a few questions for DHS, and then I'll pause there. I know my colleagues have questions, so I'll be a few questions for DHS. Recently, your agency expanded efforts to keep New Yorkers safe, including this past weekend. We saw when it felt like negative 14 degrees. The expanded efforts included new safe haven beds, 10 school-based warming centers, warming bus units, approximately 150 new outreach workers, and a lot more. These steps were obviously necessary to protect life and prevent another tragedy like the one that we saw in January. Is it safe to say that we didn't have these steps in early January? We didn't have these measures in place?
I wouldn't characterize it that way. So we opened our first school-based warming centers the weekend of when the temperature dropped very substantially. So we have, and those opened. They then closed when school reopened, and then we replaced them with buses. And then we have continued to iterate and add. Right. So there was a weekend where we had some MTA buses. That was a time-limited donation from the MTA. So when those went away, we came up with alternative options. So it's been evolving, but I don't think it is fair to say that we didn't start until this weekend. And with respect to the safe haven beds that we've been adding, right, when at the beginning of the cold snap, we had a higher vacancy rate in the safe havens. As the weather got colder, as more people came inside, the vacancy rate shrunk, and so we added additional beds.
Do you have any data or numbers related to how many safe haven beds we had, school-based warming centers, bus units, and also outreach workers? You mentioned some outreach workers data.
So we have a total of about 4,900, 3,900, about 4,000 safe haven beds, safe haven and stabilization beds. So those are the two different programs that serve people experiencing unsheltered homelessness. We've added within that we've added a couple of hundred since the start of this cold snap. With respect to outreach workers, this is the 400, 600 that we've been talking about. So there's about 400 people through our contracted outreach workers who are literally boots on the ground, meaning their full-time job is to be on the streets working with clients. There's another 200 that includes caseworkers, supervisors, others who spend some of their time in the field and some of their time in the office. Sorry, there was another question there. What was the other data point you were looking for?
Yeah, so safe haven beds, school-based warming centers, bus units, and also outreach workers.
Okay. So both the buses and the school-based warming centers have changed over time. So under normal Code Blue conditions, DHS has 10 warming buses that are dispersed around the city. During this Code Blue, we, DHS, added another 10 buses. H&H is also operating warming buses. As I noted, we briefly got a donation of MTA buses, so those were additive. We had 10 school-based warming centers that first weekend. Those closed when school reopened. This weekend, we had another 10. This past weekend, we had another 10, plus I believe an additional 2 sites at CUNY. So all in this past weekend, I believe there were close to 70 different warming centers that were operating.
Yeah, so these were all steps that were taken since the start of the severe cold weather. I guess the question is, what did we have in place before the January 19th severe weather?
So as I mentioned in my testimony, our Code Blue planning starts, well before the weather gets cold. So our drop-in centers are available. Those are 24/7 year-round. As I noted, we have 10 warming buses as part of our normal course of operations during the winter season. It is normal Code Blue, and this was in place well beforehand, that hospital waiting rooms need to function as warming centers. We were geared up to do the outreach and asking people to do overtime before the storm started. So we had the calls getting routed to 911 during Code Blue hours. All of that was in place before the storm started. I think as it became increasingly clear that not only were the temperatures lower, but the duration was longer, we kept adding, right? It is never okay to say we've done everything that we can, so we started with a toolbox of response in place, and we continued to add to it to make sure that we were meeting people's needs.
All right, 2 final questions, and then I'll pause. So the latest information that I read said 18 individuals have lost their lives since the start of this emergency. Are we expecting that number to go up? I know it generally takes a week or so to, I guess, learn about the deaths and then investigate.
So, I certainly can't predict the future. The 18 is the universe of outdoor and deaths that were suspected at some point to be related to hypothermia. Medical examiner is here and can speak in more detail, but I think analysis is ongoing. There's at least, I believe, 3 of those where it seems likely that the primary cause of death is not going to be hypothermia. You know, but all of that analysis is still ongoing. I'm not the expert, but it is clearly a complicated process.
Yeah, I guess my question though is, are there any deaths that happened this weekend that are being investigated due to potential hypothermia?
So the reporting that the city has done has erred on the side of expansiveness, right? So as soon as we learn of a death that it feels like could be related to hypothermia, it is going on the list that we are tracking. And then, you know, as we learn more, as I noted, we are still talking about 18, despite the fact that it looks like at least 3 of them are probably not related to hypothermia or primarily related to hypothermia. Doesn't mean they are less of a tragedy, but there is another cause of death there.
All right. My final question is, what would we say went wrong in January? This weekend, based on the numbers that I've seen, it was 3 times colder than it was in January, and we didn't get 17 people losing their lives. So based on that, on its face, just shows that something went wrong in January. So just wondering what your take is on that. I mean, again, it was nearly 3 times colder this past weekend, and we didn't get that same result.
So this is a hypothesis. It's not something that I can prove, but I think one of the things that was remarkable about that first weekend, and perhaps Commissioner Iskel can chime in on this as well, is the temperature dropped really sharply, really fast, right? And so I do think that there was, and I will say, frankly, it is, and that happened on a Friday night, right? And it is not uncommon for us in the shelter system to see, you know, lower census in the shelters, particularly the single adult shelter census over the weekend. People will, you know, opt to be outside rather than adhere to curfew, things like that, right? And so we had this very dangerous situation happening very quickly on a weekend, and I think it caught people by surprise. Right? Is there something that we could have done to communicate about the dangers differently? You know, as I said in my testimony, I always believe that I can learn from experience, and when I can't, then it's time for me to go home. But so I think we will be looking at whether or not there's something that we could have done around that particular communication point.
It's a great question, and I don't know if I have a great answer to it other than to say, so as Molly said, there was a precipitous drop in temperatures that was incredibly dangerous and deadly. At the same time, I don't think we will know until we've done a full assessment of the 18 deaths. And I say that, and I mentioned this to Speaker Menon earlier during her questioning, when you review the deaths from Ida, in the aftermath of that, there was a lot of focus, and I was not in this job at the time, but I remember there was a lot of focus on the response during Ida. When you look at the actual deaths and the autopsy reports, it is very, very clear that if folks had doorways that had swung open instead of out, if they had bars on their windows that could be removed from the inside, if they had flood alarms, people would still be alive. And so I think that in the aftermath of this, when we do the actual investigation of the individual deaths, at that point, we will actually know more about what could or could not have happened and what we need to do in the future.
Just one follow-up. I just want to make sure we get an answer to Councilmember Felice's question. So the question was, are there any investigations from deaths over the weekend? Sunday was the coldest day. So are you actively investigating any potential deaths that occurred on Sunday that we might not know about?
Sorry, I'm going to ask my colleague, the Office of Chief Medical Examiner, to chime in. I will say the list of 18 includes deaths that are still under investigation, but he may have more current information than I do.
Yes, thank you, Speaker. That is a fact. This is, and I'm sorry, I'm Jason Graham, I'm the Chief Medical Examiner. We are actively, every day, undergoing surveillance across all cases that are reported to the medical examiner's office, and that we perform scene investigations, hospital investigations, screening for cases that may involve hypothermia. And so as of yesterday, the final numbers in preparation for this hearing, that there are no additional outdoor deaths that we believe until completing the examination, involve hypothermia. But each one of these cases is unique, and they involve a combination of steps to determine whether hypothermia played a role in someone's death. It's a question for us investigatively and medically as to whether or not someone is dying in the cold or of the cold. And that is a process, and we are providing as close as we can offer to real-time data to our partner stakeholders in order to keep, in the midst of an emergency, as much data available as possible.
So, and actually before I ask some additional questions, I think you need to be sworn in. Oh, you were already. All right, my apologies. All right, so 18 based on examinations that have already been done. Is that correct?
Yes. So, and I want to also acknowledge these 18 fatalities and the tragedy they represent for the families, virtually all of whom we've been in touch with. These are individuals that have been examined by our forensic pathologists. We've performed death scene investigations. We're conducting laboratory testing, and based on all the preliminary information available, we believe that at least 15 of the 18 are directly hypothermia related. 8 have already been confirmed. 7, we believe, are very high likelihood that hypothermia played a direct mechanistic role in their death. And so those investigations are ongoing. But at least 15 of the 18, we believe, are directly hypothermia related.
Right, but I guess my question is, so 18 based on examinations and investigations that have been completed, right?
Yes, part of that process has been completed. Laboratory test results we may be waiting for. There may be additional investigative information that we need, but based on all the preliminary information that we have about these outdoor deaths that occurred in 18 individuals, we believe that at least 15 of the 18 are directly hypothermia related.
But are there any cases that are in the process of being completed, not finalized, but potentially deaths due to hypothermia during the weekend? So basically any cases, that are haven't been completed yet.
I anticipate that at the moment I would need to get back to you about what within the past hours, but I would say that I would anticipate that there will be additional cases based on ongoing investigations, and we're not completely out of the cold weather yet, and so we're remaining very vigilant in our monitoring of the possibility of hypothermia being involved in anyone's death, and we will complete a comprehensive investigation, including autopsies and laboratory tests in each one of those cases to make that determination.
Thank you so much.
Thank you. One question for you, medical examiner, and then I'm going to go on to our colleagues. At least 3 of the deaths were attributed to substance use. At this point, is your office able to make a determination as to primary causes of death for these particular individuals?
You're referring to, I spoke of the 15 that we believe hypothermia is directly related. You're referring to the other 3, and those investigations are not complete yet. It was based on scene investigative information and historical information that was gathered as a part of our investigation, felt likely that drugs may be involved in 2 of the 3 remaining cases, but those cases are still under active investigation, and we do not have a final determination yet.
Thank you so much. I'm going to move on to council member questions, and then I believe the chair and maybe the speaker will come back with some more questions. But I want to start with council member Nurse, followed by Aviles, and then Banks.
Thank you, chairs, and thank you all, especially NYCM. Thank you for setting up a warming center this weekend for a power outage. Lots of information here. I just had a simple question to clear up something I had heard from some advocates about whether or not DHS and DHS contracted outreach workers are able to offer supplies for folks in a situation like this, like blankets or any kind of emergency heat warmers and things like that. We had heard that agency folks have said they don't want to do that because their primary mission is to try to get folks to come in, but in a situation like this might be helpful. So just want to get some clarification on that.
Most of our outreach teams are traveling by foot, right? So they are not carrying large quantities of supplies. Historically, we have really focused on making sure that we are trying to get people indoors, that is the focus. But where we need to make particular exceptions, we will. But again, because our outreach teams are largely traveling by foot, they're not carrying large quantities of supplies.
Okay, and in this type of Code Blue, are you equipping, I understand, like, no one wants to carry around 100 pounds of stuff, but for example, just like the emergency heat warmer packets and things like that, I mean, what are they going out with besides just to go make a connection?
It is fairly limited, the supplies that they are, and I will circle back to you potentially before the end of this hearing with exactly what people have, but really historically the focus has been bring people indoors and really try and convince people of that. We will provide medical care. Many of the teams, particularly the contracted outreach teams, partner with street medicine organizations, right? And they're going to be able to provide some food, some other things like that. But the hope is really not to set people up to stay on the street, but rather to encourage them to come indoors.
No, I understand that. And I understand the overall goal. Is there any data that would suggest that providing, in this kind of specific extreme weather event, providing that type of warming supply would encourage or incentivize folks to stay outside?
I don't have quantitative data like that. I think, it is certainly a challenging question, and I understand where you're coming from.
Okay, so no data. Okay, I think I'll just say in this particular situation, it might have been helpful just to have our outreach workers have a little bit of something. I'm not saying they need to have, sacks of things, but just a backpack full of some stuff to go around with, because there are people who are of sound mind who don't want to come inside, and that's their right. It's their right to stay where they want to be, especially if they are able to speak about their circumstances clearly. So just wanted to clarify that, if it was policy or not.
Right. Thank you.
Thank you.
Dr. Long, did you want to?
Sorry. Just wanted to say that in agreement with you, another thing that we've done in concert and lockstep with DHS is we've set up hi Cassandra, a dispatch line where if there's somebody that's in need, that could be maybe a way to have the conversation about them coming to a shelter site. We have borough-based dispatch lines that connect directly to the mobile units that we set up, and they do have blankets, hand warmers, and jackets. So we actually, when we go out to people, are able to give people resources that they would need. But just I want to make the point very clear, as Commissioner Park was making, it's to enable us to have an effective conversation with them, to ultimately try to get them to come into the warming unit, to get them into to come into a warm place.
Agree. Yeah, I think like having some stuff in this kind of situation could more quickly establish some trust. So can you just clarify? You're saying these mobile dispatch units are were they out during this particular period?
Yeah, so the mobile dispatch units are something that we created together with DHS as an enhanced part of this overall response. We went live on January 29th, and this weekend we had 33 of these mobile units, which are clinician-led. Each one has a nurse or a nurse practitioner on it, and they're mobile warm units like ambulettes. They go up, ask, how can we help you today? And if what you say is, one example that comes to mind is there was a person that actually had moved to New York City very recently, came from a warmer place, didn't have a jacket. So giving that person a jacket enables us, which we did, to build trust, then enables us to have a more effective conversation about telling them about the resources that our DHS team has, and to help to make that connection, which in that case, or in a case like that, I should say, can culminate in us actually driving them in the warm ambulette with a warm bowl of soup to a DHS shelter.
Okay.
And if I can clarify, thank you to my colleagues who are feeding me extra answers. We have been giving coats, hats, and gloves in this particular circumstance. It is not part of our standard outreach process, but in this particular emergency, we have been.
On the street, like on the street
Yes.
outreach.
Yes.
And that's been all weekend or during this entire Code Blue? You can like say it back later when you get
the entire Code Blue.
Oh, okay, great. Okay, thank you so much.
Thank you, Council Member. I'd like to acknowledge that we've also been joined by Council Members Narcisse, Stevens, Ressler, and Gutierrez. Councilmember Aviles, followed by Banks, and then Ariola.
Thank you, Chair. So first, I'd like to thank you, commissioners, for all the years of public service to our city. We wish you the best, and we know that you're leaving stronger agencies, and we know you're leaving behind very strong staff. So I just want to thank you at the top for your service. I'd like to, I guess, follow up with NYPD. In your testimony, you noted that the NYPD hadn't changed your policies regarding homelessness during this Code Blue. However, City Hall did note that they were instructing NYPD to not remove homeless individuals from the subway system into freezing temperatures during this situation. We heard widespread instances where people have seen individuals being removed from the subways during this Code Blue. So can you help us understand the discrepancy here with the City Hall directive and what we were seeing on the ground?
Yeah, and council member, you're exactly right. That was a change that happened during this emergency, so I certainly misspoke earlier. So just to set the stage a little bit, if people are violating subway rules, the rules of the MTA, they are potentially subject to ejection from the system. Now, our officers use substantial amount of discretion in when to do that and when not to. So really, they need to be creating a substantial disturbance within the system, interfering with subway operations, interfering with the safe passage of passengers. And obviously, during a cold weather emergency, we would be even more conservative in our use of that legal power. There were ejections that happened earlier, but again, we would do our best, especially at the end of line stations where we work very closely with DHS to connect those individuals to services. That could be something like a warming bus, that could be something like a safe haven. Over this past weekend, we put a complete stop to all ejections, even people who could potentially be causing problems in the subway system. Now, there were other ways, of course, to get to those people, again, in partnership with DHS, but that was paused completely over the weekend.
Well, how is this communicated to officers? Because over this weekend, in fact, many individuals witnessed people getting told by police officers to leave the subway.
I'm happy to look more into those circumstances, especially if you relay them over to us. It was communicated very clearly throughout the chain of command, up from the top all the way down. But again, if there are specific instances you'd like us to look at, I'm more than happy to.
So in the instance that you noted of disturbance, what exactly does that look like?
It could be, yelling at passengers on a train, right? Disrupting the regular operations of the MTA and providing maintenance to their fleet. Again, we try to use it as conservatively as possible. And again, when we do try to use it, we try to connect with the services as best as we can.
All right, well, I think we'll continue to monitor the situation, and we'll ask New Yorkers to please speak up if we see police officers violating the City Hall policy during this particular time. I'd like to know, I don't think anyone is here from FDNY, but it's very important to put on the record that, EMS workers are a key part. Are you here? Oh, amazing, thank you. EMS workers are a key part of our city's response, particularly as you noted that they are the first to receive the Code Blue 311 calls. However, it is clear that our city has long underinvested in EMS services, which we're currently dealing with understaffing, high attrition rates, and no pay parity with other first responders. This results in higher wait times, which can quickly become a matter of life and death. The previous mayoral administration had vowed to take on these chronic issues with the EMS workforce, but they did not keep those promises. How does this new administration intend to address these chronic workforce challenges facing EMS workers, which is a daily situation, it is completely exacerbated by the enhanced Code Blue needs of the city?
Excuse me, Chief, before you respond, we'll just swear you in.
Sure.
Thank you.
Do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee, and to respond honestly to council member questions?
I do.
And can you please state your name for the record?
I'm John Esposito. I'm the chief of department.
Thank you so much.
So, As you know, daily our EMS service is inundated with a large number of calls. Recently, we've been averaging about 4,400 a day. Once we started with the code blue and the 311 calls were routed to 911, that jumped up to about 4,800 a day and further inundated EMS. Soon after the snowstorm, on that Tuesday night, we were at one point holding 300 calls, meaning that we did not have ambulances available for 300 people, including the cold calls that we were trying to assign ambulances to. We had spoken and reached out to our voluntary hospitals. As you know, FDNY EMS only provides 66% of the ambulances in the city. The other third are from our hospital systems. We call them the voluntary ambulances that they supply into the 911 system. So we were able to reach out to our voluntary partners to supply more ambulances. But for the rest of that week, it was quite difficult to staff. Response times did increase. We are currently working with the administration to seek better compensation for our EMTs and paramedics.
Thank you, Chief. I think it just can't be underscored enough. If we do not get pay parity for our EMS workers and continue to expect them to do these gargantuan tasks, we will never meet the mark. And so we are deeply committed and expect this administration, in order to systemically address emergencies across the board, whether it's cold or heat or any other manner of natural disaster or man-made disaster, we need a fully funded pay parity EMS service for our city. So thank you.
Thank you. And you look at the work that our EMS folks did during COVID. When you could argue that they saved the city, and they've certainly earned it. And during this as well, the EMS unions have been incredibly supportive of the city and the fire department's effort to increase our resources out there in the streets to increase or improve ambulance response times.
Thank you, Councilmember. Councilmember Banks, followed by Areola.
Thank you, Chairs. First of all, just an observation. It's a little concerning that the mayor and the administration, with two departing commissioners, wouldn't send a deputy mayor, first deputy commissioner, to be a part of this hearing. But we'll go forward with what is here. When it comes to shelter access during the code blue, DHS is required to relax intake procedures, accept walk-ins, and prohibit discharges. Were there any reports of individuals being turned away from or discouraged from entering shelters during this past few weeks? And how does DHS monitor and audit compliance with these requirements in real time?
Thank you for the question. I'm certainly not aware of any instances where somebody was denied walk-in. And to the extent that anybody has any information, you should please share it with me. I'm happy to do the follow-up. We've been very clear with our shelter providers that this is part of the obligation. And, we are talking about mission-based organizations that take this work very seriously. So I have a lot of confidence in our providers. And we actually went beyond that in this particular disaster. So not only requiring providers to accept a walk-in, but actually asking them to be doing perimeter walks themselves, so that sending their security guards, their staff out to say, in the few blocks around your shelter, do you see anybody? And if you do see anybody, try and engage them, try and encourage them to come inside to wait.
Thank you. When it comes to refusal of services and follow-up, when an individual declines an offer of a shelter or medical assistance, how is this refusal documented? And if EMS or the NYPD responds to a call, and an individual refuses services, is that information shared with DHS or outreach providers for follow-up engagement?
So I'll start and then I'll pass it over to my first responder colleagues. So if our outreach team engages somebody and they decline services, that is noted in StreetSmart, which is our system of record for outreach, and that has all DHS staff, but also all of our contracted providers has access to that, as well as the state OMH contracted outreach teams and the city's Department of Health. So we will record that and note that that is a client who needs additional follow-up. So that is our approach. During a code blue, we are not receiving the 311 calls in real time, but we do get details after the fact on an aggregate basis so that we can use the data to inform how we shape outreach going forward, so that if we are seeing an increase of calls from a particular neighborhood, that is something that we will use to drive the work going forward.
Okay. And there was an article on January 30th by the Gothamist. The article reported basically a report. It was reported that a man who had died during the freezing temperatures after a 311 call about his welfare was misclassified. According to an NYPD spokesperson, the call was logged in as a disorderly meal. What safeguards are in place to prevent this misclassification of welfare checks during code blue, and how are 311 and 911 operators trained differently during cold weather emergencies?
So 911 operators classify code blue calls as what's called 54Q. In that instance, it was categorized as disorderly, but actually in the text of the entry, they did write that it was a code blue job. So even though it was not labeled 54Q, it was still treated as though it was code blue. So it was as a data entry issue, but the response by the police department was exactly the same as it would be in something that had been coded 54Q.
Okay. And when it comes to nitrogen and heat and hot water cold exposures, how does DHS and the NYPD and the FDNY and NYCHA and Department of Health share real-time data during extreme cold events? And what coordination mechanisms are in place to ensure rapid response when residents are at risk? And were there any individuals who passed away during this recent cold weather period? Were any of these NYCHA residents? And if so, what support or interventions were provided prior to their deaths?
So I'd have to get back to you. I mean, we don't have all the information on the deaths that occurred, about whether they were NYCHA residents or not. I do know that our housing bureau works, really quite closely with NYCHA, and when there are emergencies in a NYCHA building, they oftentimes are there helping residents. They have a good relationship usually with their residents, right? Because they know the housing bureau cops really well. So while I can't speak to NYCHA or to those specific cases, I knew that partnership is very close.
And last question, and I guess I'll come back in the second round. Given the documented increase in unsheltered homelessness, particularly in subways, where outreach teams sufficiently staffed to meet the heightened demands of the extreme cold, and were additional vans and overnight shifts deployed as required?
Sure, thank you. So we have one outreach provider that is specific to the subway work. So although the subways were at least arguably a bit warmer than other parts of the city, they continued their subway outreach work throughout this emergency. We didn't have additional outreach workers per se brought on precisely for this cold snap. It takes longer to hire and to train than we were able to do that. So what we did instead was we have outreach workers working overtime. We received volunteers from city employees volunteering to work overtime who were embedded with the outreach workers. So in particularly some New York City Public Schools nurses who were embedded with the outreach teams. And then we enlisted the services of sister agencies that do work with people who might be experiencing unsheltered homelessness, even if it isn't their primary role. So, for example, the DOHMH mobile crisis teams. Another change in policy that we made during this, or change in process that we made during this, was we reached out to the State Office of Mental Health, right, which operates SOS teams. These are teams that do homeless outreach that tends to be a very deep clinical focus, right? They're coming from a healthcare agency. Their focus is really on delivering mental health services, but in this particular moment of crisis, we asked them, and they have been great partners, to really focus on this bringing people indoors rather than the in-depth clinical engagement that they might normally be doing.
Thank you.
Thank you, Councilmember. Councilmember Areola, followed by Mealy.
Thank you, Speaker. Thank you, chairs. I'd also like to echo Councilmember Banks's statement on the fact that we have two extremely competent commissioners who are not going to be with the administration moving forward. And this whole committee was put together to find out what's happening, what are we doing, and what are we doing moving forward. So I find that the administration did not send anyone that could speak about what they're doing moving forward to be an affront to these committees and to our Speaker, and it should certainly be addressed. Additionally, I agree with you, Councilmember Aviles. In order to beef up our staffing for EMS, we need to pay them more money, and I know that this entire council believes that. So I want to speak to you, Commissioner Parks. You spoke about a light touch. That we've been hearing that a lot. Could you tell me the criteria for a light touch when the administration sends out notification to NYPD, FDNY, DOHMH, to Dr. Long's operation, that there be a light touch put forth for the street homeless and homeless in general in these freezing weathers?
Thank you, Councilmember. I'm not familiar with this light touch notification that you're talking.
Well, you mentioned it. That's what brought it to my mind.
Okay.
You said we're using a light touch. What does that mean?
So I think the context in which I use that phrase is we have two different types of shelter that are geared towards people who are experiencing unsheltered homelessness. We have what we call stabilization beds and safe havens. Safe havens are more clinically intensive. They have a higher level of service. The stabilization beds are, this is where I would use the phrase lighter touch, in that doesn't have necessarily exactly the same level of clinical services on site. And so as we connect people to beds, our first goal is getting people indoors. And so if there is, particularly in this moment when we're operating with fairly scarce vacancies, we will connect people to the bed that is available. But when we have the opportunity to direct people to the bed that we think is more appropriate, if somebody has more clinical needs, they'll go to a safe haven versus a
right. The light touch that I'm talking about is that the agencies, first responders and beyond, have been told to take a light touch when going to a person who is unhoused, especially the street unhoused, which is a completely different type of unhoused person that has reasons why they don't want to go into shelter. One of them being that they have belongings. So if you or one of your CBOs go out and encounter a homeless person, and this is an actual case, who is continually just sweeping and randomly walking back and forth, and she's unhoused on a sidewalk, cleaning the floor, mumbling to themselves, not really being cohesive when speaking, and they're approached by DOHMH, one of the CBOs, our EMTs, our NYPD, would that person meet the criteria for involuntary removal?
So it is very situational. And obviously I don't know all of the facts associated with this particular individual, but it is a dual criteria, right? So it is obvious sign of mental illness and a danger to themselves or others, right? So to the extent that I am not a clinician, but from the way you describe it, it sounds like this is somebody who is experiencing mental health issues, but if they are not also a danger to themselves or to others, then it wouldn't meet the.
Well, the fact that they are acting in this way and not wanting to go in, and it is below freezing, well below freezing, I think that would make them fit the criteria for not really having the mental capacity to do the right thing for themselves. But a lot of times it's because of the items they have left behind. What is the protocol for the removal of any type of mattress or anything left behind by that person, even if it is an animal that they may have with them, which would preclude them from going into a warming bus, a warming station, to the hospital because they're afraid of what they're going to lose.
Right. So DHS operates a storage facility, and we can voucher their belongings. There are some limitations if there's, something is obviously pest infested or something like that, we wouldn't voucher it, but we take a quite broad view of what is voucherable, and we do that. With respect to animals, we have very recently changed policy, and 3 of our drop-in centers across 3 different boroughs now will accept an animal.
And what is the timeline when items are not vouchered and say are infested and left behind? What is the timeline for those items to be removed when they're left at the encampment if the person has sought shelter?
So I'm going to defer questions about encampment cleanup policy to City Hall. I will note that DHS's role in encampment cleanups traditionally and on an ongoing basis is that we are the social service arm, right? Our job is, before any cleanup ever happens, to make sure that we are engaging with individuals, trying to build the trust and trying to convince them to come inside.
Oh, Chair, I just have two questions. It won't be long. May I?
Yes.
Thank you. So we have 4,500 to 4,600 approximately street homeless, street unhoused. And so the numbers that you're giving us for the numbers that you've taken in, they're abysmal. That means you haven't reached the majority of them. So when we're told to call 311, now 311 is automatically putting people to 911. 911 then calls NYPD, EMT, and they route it from there. And again, we have NYPD who's understaffed, EMTs who are understaffed. So I'd like to know if the NYPD and the and EMS, according to the Unified Pre-Hospital Treatment Protocols, FDNY EMS must follow certain protocols in treating a person exposed to extreme cold. One such guideline is to apply heat packs in the patient's groin area, lateral chest, and neck. Has FDNY EMS, first responders like the NYPD, have they been given this equipment with heat packs to provide treatment when encountering a person with potential hypothermia, and are they directed to do so? And my second question is to the medical examiner: are there more than 18 individuals on tables in your building right now that could possibly have died from hypothermia? So we'll go with the first question.
Before I turn it over to my colleagues, let me just chime in on the number of engagements and the work that DHS is doing, because the DHS staff and the contracted outreach workers have been working around the clock. We've had more than 5,700 engagements. We've had more than 1,400 placements, plus all of the people who have come onto warming buses. On just the DHS-operated warming buses alone, we are averaging 150 to 200 people a night. It is an immensely challenging situation, and it's people who, serving people who have been failed by every level of society, every level of government. But I do want to argue that, in fact, the agency is working very hard to try and reach people. And just note, last year we placed about 1,200 people who had been experiencing unsheltered homelessness actually into permanent housing. And I think as we think about crisis response, we need to think not only about what we are doing in the moment of crisis, but why there is a continual flow of people who are discharged from different institutions and onto the street.
Right, but earlier I think you testified that there were 33 that were street unhoused. I'm just really referring to street unhoused, not globally homeless people.
The 33 were the involuntary removals. Mm-hmm. There have been about 1,400 voluntary placements.
Okay. About the heat packs. While they're discussing, maybe we can just get to so we could save some time. Are there any other? I'm sorry, Chief.
Apologies, Councilman.
That's okay. I wanted to give you time.
All right. So, in the time from January 23rd to February 5th, the fire department received 5,700 cold calls. These are the ones from 311 to 911. In 680 of those calls, we transported somebody to the hospital. So remembering that those original 311 calls were reporting somebody in the cold, not necessarily somebody with an injury. So in 680 of those 5,700 times, we transported somebody to the hospital. If they had an injury, a cold injury, they would be treated according to the protocols that you mentioned.
So you have those items in your ambulances?
If it's for the if it meets the protocol and that's how we treat people, then we would have that.
And the NYPD?
That's just EMS, so that would not.
Okay. And sir?
Yes, the 18 cases that we've been discussing are non-residential outdoor deaths. There have been investigations into other cases that have hypothermia as a causal or contributory cause involved in their death in residential settings. And so
Sorry, is your microphone on, sir?
No, it's bad.
So, yes, I was referring initially to the 18 cases that we've been discussing here today, which are the non-residential outdoor deaths that have occurred in the setting of this emergent cold weather episode. There have been investigations and are ongoing investigations into other cases that cover a range of situations, residential situations that are active ongoing cases. And so the short answer is yes, there are others that are that hypothermia may be involved in their death, not the focus of what we've determined to be the 18 of greatest concern coming from the outdoors in a non-residential setting.
All right, thank you. And thank you for the latitude.
No
I'd
problem.
like to go on the list for a second round.
Okay, will
Thank
do.
you.
Thank you, Councilmember. Councilmember Mealy, followed by Ressler.
Yes, I just want to commend everyone because the job that you do is not easy. But I have a couple of problems with you. Could you explain to me, you said outside of the norm, this cold snap. Were you not informed that it was going to be cold? And could you be kind of quick? I have a couple other questions.
Of course, we were aware it was going to be cold. We had.
So why were you not prepared?
With all due respect, council member, I do think we were prepared. We implemented our Code Blue procedures, our enhanced Code Blue procedures. As the cold snap continued, as the very low temperatures continued, we continued to iterate.
Could you explain to me when did you hire, and who you got the grant from, the money to hire the individuals, and how many did you hire?
So we have about 7 peers working. 7 peers who are working out with outreach teams.
Only 7?
It's 7 thus far. This is something that we have innovated with very recently. The grant came, and I'm very thankful to them for the Fund to End Youth and Family Homelessness, although this is outside their normal scope of work. It's an organization that we have strong relationships with, and they took rapid action for us.
Okay, then, could you explain to me just give me 3 locations of the warming buses that you posted. How did anyone know where they were at?
There were many locations.
Give me 2.
South Ferry, 181st Street in St. Nicholas. There's Midtown. There's a variety of different locations.
How many in Brooklyn?
Let me pull the exact number, but in answer to your question, we are keeping the information live on the 311 website and then actively.
And I have a problem with that. How many homeless people or mentally challenged people going to call 311? Could you give me that data?
So we have been actively dispersing that information out to all of our not-for-profit partners, anybody who is engaging with people experiencing unsheltered homelessness. That means the normal outreach providers, but also faith-based organizations, the SOS teams, other sister agencies, our entire list of DSS partners. And we do all of that because we are adapting the locations of the buses in real time to meet with demand. So if we put out written cards, it would be out of date very quickly.
But you
We're
did
trying to
move
avoid
them
that.
around, correct?
We move them around to meet demand, yes.
So how do you think homeless or persons who really need the warming buses would know where you moved to? Someone could have saw you there, and then how many hours you stay at a location?
So we're staying in a location overnight, but in the morning, we look at the utilization results, and if a bus really didn't get utilized, there were nights where we had a bus that didn't have anybody on it, we moved it to a location where there was greater demand. We were trying to be as responsive as possible.
How did you inform the individuals in that area that you moved?
So it's a great question, Councilmember. We took an interagency approach to this, and it was not just DHS alone's responsibility to inform folks of where those buses are. And we had over 3,400 people use those buses during the duration of this event. And so what we did is, as Molly said, as Commissioner Park said, it was critically important that that information was on a website that could be updated.
Everyone is not, if someone is outside in a freezing cold, they're not on the website.
I understand that, and that's why.
So how can you brick and mortar or hands-on, boots on the ground, how are you letting individuals know?
I'm trying to answer your question.
Okay.
And so what we would do is we'd make sure that information was pushed out not only to our DHS partners, but that every police officer, every firefighter, every EMS worker, every sanitation worker, we would mention this on our interagency calls, so all city workers that are out in the streets had this. In addition to that, we have our AWS system, which is our advanced warning system, which is a network of hundreds of community-based organizations across the city. We have our DAFN partners across the city. We have our strengthening community partners, and we have our electeds. And so we took a multi-channel approach to pushing that information out to everybody in the city to make sure that that information was getting out to anybody who was interacting with homeless individuals so that they could get it in addition to the Link NYC site. So it was a multi-channel approach. But if we put out a card or some written information, that could be outdated within 12 hours, and you could have somebody go into a site that was no longer active.
Could you explain to me, from your own words, you said the norm is 10 to 20 deaths every, I guess, a heating or freezing temperature. How are you doing better to make sure deaths get down to zero?
So
we should never be thinking this is the norm, that we're going to lose 20 people every year.
I agree with you, Councilmember. I believe the words I used was it was the average is about 10 to 20, right. which the fact that it happens doesn't mean that it is okay, right?
No, it's not okay.
We continue to look at different ways that we can better serve people. That means making sure that our emergency response on the street is as strong as possible, but it also means thinking more broadly about the continuum that ends up with people on the street, right? So making sure that we have that we are getting as many people placed in permanent housing as possible, and then wherever possible, working with the institutions that discharge people to the street, whether it's state hospitals or carceral systems, right? Because the reality is we are serving an enormous number of people every single year who are experiencing unsheltered homelessness.
Yes, but we
the
have
reason,
to do
the
better.
challenge in terms of getting ahead of it is the fact that other systems continue to discharge directly to us.
Can I ask another question? Why were they not entitled to film on the warming buses?
And then we'll add you to the second round of questioning.
So
somebody got to explain that.
Yeah.
You're a public entity. Anyone should be able to see what you're doing and how you're doing it. So why were they not able to film?
The clients on those buses are extremely vulnerable individuals in a moment of crisis, and we try and respect their privacy.
Okay.
Thank you.
So that's why you did.
Councilmember Ressler, followed by Councilmember Wong.
I firstly just want to congratulate Chair Hudson on this appointment. The General Welfare Committee is one of the most critical and distinguished committees of the council, and we're fortunate to have your leadership of it. And of course, to Councilmember Felice on the similar leadership of public safety. I want to thank Commissioner Iskel for your distinguished service to the city, and also Commissioner Park. Commissioner Park, you and I have had the chance to work together closely over the years. I have a lot of admiration for the diligence and care and rigor you bring to this work. I think you've wanted to strangle me a couple times at hearings over the last 4 years. We'll see if today's any different. But truly, thank you for your service to the city.
Thank you.
You all have, as I think every colleague on this dais has noted, very challenging jobs. What I've just struggled to understand a little bit, and maybe you can break this down for me, is of the 18 fatalities that we experienced during this cold spell, what number of them were known to the Department of Homeless Services or chronically homeless individuals? Can you just give us some context of that data set?
So to the best of my knowledge, nobody fell in the definition of chronically homeless, but they were among the, sorry, my eyes are very bad. So I'm going, and I can't read my small print, so I will circle back with you, but I will say that the majority, but not all of them, were known to the agency, but the number that were recent DHS clients is quite small.
So just so I understand, that basically means a majority of the 18 were people who were street homeless, known to DHS, but not for more than a 6-month period? Is that the discrepancy in all likelihood?
I actually was going even further back than 6 months, right? There are people on the list, as I say, we've taken a very expansive view of having touched the DHS system. So there are people whose last contact with us was, 5, 10, 15 years ago. My hypothesis, although I don't have the data to support it at this point, and we may be able to determine this through investigation, we may not, is that these are people who had various forms of sporadic housing, right? So that it's not that they were on the street for 15 years and never encountered DHS, but rather they were couch surfing, they were, moving from various, unstable place to another unstable place, and unfortunately, that whatever safety net that they had for themselves at this point in time fell apart during very cold weather. That is, as I say, a hypothesis. That is something that we will try and investigate, and on some people we may not ever get full information because they were very much living under the radar screen. There are individuals who have been in and out of shelter within much more recent periods, meaning even the last few weeks to a few months.
And can you share just a client-by-client breakdown with the individual-by-individual breakdown with the committee so we understand just what the history of contacts were with DHS and the outreach teams?
We will, that was a speaker request as well, we will figure out something to share that doesn't have personally identified information.
Can just, for 30 seconds, which is totally unfair, as you look back on your tenure, I find myself just frustrated. We invest a lot in outreach services, and organizations I think are underfunded, under-resourced, struggle to retain staff. But broadly, I wish their work was more effective. I wish that we did a better job of bringing people inside and that we were able to do that more efficiently. Any recommendations for your successor, briefly, because I have one more question and I only have 62 seconds.
I think my recommendation is really to look further upstream, right? Which is not to say to ignore the work that DHS does with people who are on the street, but once they are on the street, they've already fallen through a lot of different safety nets, right? And so how can we, I think this stat is a year or two old, but there was a year where we placed 1,100 people who had been experiencing unsheltered homelessness into permanent housing, and 1,100 people were discharged from state psychiatric care directly to DHS. Right? So if we want to get ahead of that number, we have to think broader than just the immediate on-the-ground actions.
I totally agree with you, and I think one of the commonalities that we see among street homeless New Yorkers is that they've all been through our DHS shelter system, and I think that we have to be honest about the fact that our single adult system, serving people in a congregate setting, it can be rough. To have 10 or 12 or 15 people in a room who are struggling at a low point in their lives with very little privacy, too few services, we need to do more to provide privacy, high-quality services to connect people to the housing that they need. The last thing I just want to ask before the chair yells at me is about supportive housing. As you know, we passed legislation last year that required DSS to create the first report on vacancies in supportive housing. We found there are 3,200 vacant supportive housing units in New York City today, and about 1,000 of those units are under the purview of HRA and DOHMH. These are units that are either offline or are ready to be activated but have no client referred. This is a tremendous opportunity for us to drive down street homelessness if we can fully activate each and every one of these units. I'm not asking you to solve for the failures of OMH, which I know is a big problem, but I am asking how do we do better on the HRA side and the DOHMH side to make sure that every single unit of supportive housing is activated and activated soon?
Right. So on the shelter quality issue, first of all, I think we've been working very hard at the Department of Homeless Services to raise the bar on the physical layouts of our buildings and the footprint that we have. In my last couple of weeks, I'd be more than happy to go out with you and show you some of the newer sites that we've brought on because they're
you're going to regret having said
really,
that.
really beautiful. With respect to the supportive housing, I think this is something that we look at every single day. We've developed reports so that we can follow up on individual buildings, even individual units that are taking a long time. What you see when we talk about supportive housing, we talk about it as if it was one thing. There are in fact many, many different sets of eligibility criteria. It intersects with low-income housing tax credit regs and other kinds of things that make it complicated, but we are doing a lot of very hands-on work with providers to try and speed up that process wherever possible. I will say there's about 39,000 units of supportive housing in the city of New York, so there is always a 1 or 2% vacancy, 2%, 3% vacancy rate, which is sort of standard churn, is always going to be several
but to be clear, at HRA it's a 6%.
This is me yelling, Councilmember.
All right, sorry.
Okay.
6% vacancy rate at HRA today, not the 11% at OMH, but those are just the offline units and the units that don't have clients referred. Thank you, Chair, and thank you, Commissioner.
Thank you. Council, I'd like to acknowledge that we've been joined by Councilmember Hanks, and now Councilmember Wong, followed by Narcisse, Stevens, and Gutierrez.
Thank you. First, I'll just start with a story, and then I'll follow by a question. This happened on January 29th, 9 a.m. The 311 call was made around 8:45, and the caller was on his way to work on 250 Broadway. And there was a homeless individual sleeping in the front next to Citibank, and he could have looked the other way, and then I'm certain if he did nothing, that would have been another fatality because the temperature that day was 10 degrees without the wind chill. With the wind chill, it was like with a -5 or -10. So what happened was he saw an individual lying on the concrete, and he had a stack of newspapers. I have to demonstrate. He was wrapping himself up with newspapers like this, and then he was wrapping his legs with newspapers, and that triggered a lot of alarms, and that caller called 311, and the 311 was called at 9 a.m. Here's that number: 311-261-58988. Now. After the committee meeting, which I think ended around 12:15, the caller came out that the person was still there, wrapping himself on newspapers. So now, based on what you told me, there should be like a warming bus on South Ferry, which is only a couple of blocks away. And also, based on statements that I heard, I think you only need a common sense to conclude that he has no capacity to make his own decisions. He is unable to come to care for himself. He does not have a sound mind, and he has shown signs of mental illness, right? Because if you have a sound mind, you would know that in those temperatures you cannot stay warm or wrapping yourself up with newspapers, okay? And I feel really, really bad today because that caller was me. I called, okay? So when I saw him, that he was still there after the committee meeting, I reached out to my chief of staff, who I believe reach out to homeless service providers that I fund, and they were able to take care of the situation. But what I'm trying to ask is that I made that 311 call, and then and then there were no responses. And according to you, there really should be a bus like South Ferry, a couple blocks away. There should have come like right away to pick him up, and he should be subject to involuntary removal. And the response I got was, the person has refused services from the mobile outreach response team. And I wanted to tell you about it, and clearly the person is unable to make sound decisions and really should be involuntarily removed. And I want to hear, like, from you, what happened? What happened?
So I'm very familiar with this individual. Many of your colleagues called me directly about him as well. And so we had, particularly given the location, this is an individual who's had a lot of engagement and has been on most days, not always, but on most days has been very clear that he is not interested in accepting services. And that decision about whether or not somebody is subject to an involuntary removal is one that has to be made by a clinician, has to be situationally specific, and has to conform with state law. And so while I understand that, it feels entirely unrational to want to stay outdoors, there are circumstances where even in the coldest weather, it doesn't meet the standard for a 958 removal. We have kept at it with that client. I believe there was at least one instance where he did accept services, but certainly we will, if he is back outside, this is one of the things that DHS does, is that we do not give up on people, and we will continue to engage.
Yes, thank you. And it's clearly evident that he was incoherent and he wasn't making sense. When I asked him, like, are you okay? Do you need help? And he was just mumbling, and it clearly has issues that needs to be addressed, and we cannot just look at the other way, especially in front of the City Council building. Thank you.
Thank you, Councilmember. Councilmember Narcisse, followed by Stevens, and then Gutierrez.
Thank you, chairs, and thank you, all of you, and Commissioner Hisco. We're going to miss each other. And Parks, I know we have different views on certain matters, but you remain a hard worker. But I have a quick question for you. Have you, based on what you said before, have you feel like you reached your plateau? And it's based on what took place, like the 18 deaths that we have, that serve as your catalyst of your exit, and what you have learned that you can share before your exit.
No, my decision is based on what's best for me and my family and for the agency. This is an immensely draining job, and my husband made it clear that if I got one more middle of the night text call that, I was sleeping on the couch. So, it's disappointing. I have loved this job, and I care very passionately about the work that I do, and the people that we serve, and my colleagues, who are some of the most amazing public servants I've ever had the privilege to work aside. But no, this is not related to the last 2 weeks. I've said this to other people that, in 22 years, there has been plenty of tough moments, and 2 weeks is not going to bring me to the door. So, things that I have learned. Because I know we're on the clock, I guess I would leave it at the importance of both persistence and creativity. And we've talked about this a lot today, that there was a set of responses that were in place on day one, and we realized we needed to go beyond, and so we iterated and we iterated and we iterated, and we keep at it, and that is, I think, government at its best when it continues to come up with creative solutions for serving the people in need.
I appreciate you. And what have you learned? Because it intrigued me when I heard in Tenton, when I believe this gentleman that's saying that the reason he was out, for him, he wants to be out, but he said something to me. I mean, it triggered me, because he said that there is many services that people needs in order for them not to be out, but not being addressed by our city.
Interesting. So listen, I think even people who've had every opportunity are unbelievably complex, right? Mm-hmm. And the people who are sleeping on our streets are certainly not people who've had every opportunity. They have been, failed by family, by religious institutions, by multiple levels of government, right? They have fallen through every safety net that we possibly have. And I have no doubt that there are very specific services and needs that individuals have. And when somebody comes inside, when they're living in a safe haven, and we can sit down with a caseworker and really try and understand what those needs are, we do our absolute best to make sure that we are connecting people to what they need. That's a lot harder to do when we are, on the streets and in the real moment, although it is, we try and meet people where they are and get them. But, it is an ongoing struggle, and we are sort of perpetually working on making better relationships with our sister agencies so we can meet the full spectrum.
I appreciate you. My friend, Dr. Long, the freaking flyers in the ER, because I say ER nurse, we have an amount of folks that always, if it's too hot, they come to visit us. If it's too cold, they're gonna be visiting us. So anything that been putting in place to help those populations, because that way we can decrease the amount of folks that end up to be on the street and end up dying in our hands, on our shift, on our, leadership, on our clock.
Yeah, no, I 1,000% agree with you. And I think the way that we've been thinking about this is trying to see how we can use this crisis as an opportunity to do things, as Molly was saying, differently and better. For example, we haven't done this before, but when I tell you, I think it makes perfect sense to do it this way. For people that are coming to us, because we're the hospitals, everybody's been to us before, we're trusted places. They come during the cold, they come when it's too hot outside. But what we're doing now is we're not saying in the morning, okay, I hope you have a good day today. We're saying, okay, you've been with us for the night. Clearly, there's ways that we can help you, that your needs that haven't been met yet, as Commissioner Parks said. So we're giving everybody a same-day primary care appointment. Now, not everybody's taking us up on this, but I think that's just to me, a really good example of a way of doing things differently and using this as an opportunity to address some of the fundamental reasons why people are still experiencing unsheltered homelessness and why they still haven't gotten the medical care that they need and deserve.
Before I finish totally, I have one more question. How long you will be taking, Commissioner Graham, how long is it going to be taking for us to have a clear answer? And because right now you say it's preliminary, knowing that is hypothermia that folks die. So how long it will take for us to have an absolute report?
Thank you for the question. Yes, it's very true that the investigations are active and ongoing. Of the 18 cases, 8 of the 18 have been finalized with final cause of death involving hypothermia. Each of these cases is complex in its own way. That includes laboratory testing. We've asked for our lab testing to be expedited, and so we're hoping to have the remainder of those cases finalized very soon. 7 additional cases we suspect hypothermia will be involved.
Okay. And I have to say thank you. My time is up, and I will have more questions probably later. Oh, I have to run. We have the more. So thank you for your time.
Thank you, Councilmember. Councilmember Stevens, followed by Gutierrez.
Good afternoon, and thank you guys for still being here and answering these questions. I know you guys have been here for a while, but if people know me, I'm Councilmember Stevens. I'm Chair of Children and Youth and the youth person, and so I'm a little disappointed that DYCD is not here to answer questions, because we know that that's a different system for young people, and so I'm a bit disappointed, especially when they have given little guidance to providers on how to respond during this time. So unfortunately, now I have to ask you guys questions that I know you're going to say you're going to have to refer to DYCD. So it's going to be very frustrating for me in this moment, because this is a message and a signal to young people that they don't matter again. And I keep saying it when we're talking about housing crisis and homelessness. Young people are a part of this conversation, and we should have representation here to talk about the plans and things that they need to do moving forward. So my first question is, how does DHS and DYCD how are they incorporated into the Code Blue planning process? I know you said that started way before it got cold. I just wanted to know, how were they incorporated into?
That's something I'm going to need to get back to you on the specific details on. I think they are at the table, but I don't want to misspeak, so we will circle back.
Didn't I tell you I was going to be frustrated? Of course I am. But again, this is another sign that this is a problem because they should be here to answer these questions because young people are part of this. And so my next question is, how is the city supporting homeless and runaway youth and minors since they do not have the right to shelter? What is outreach workers being instructed to do if they encounter an unaccompanied minor?
Sorry. So if we encounter an unaccompanied minor on the street, that is something that we really leap into action. That is, we'll call ACS when we need to, right? Whatever we need to do to get that child into a safe place. So, I am relieved to say that it doesn't happen often, but anytime we see a child on the street, actually, frankly, unaccompanied or otherwise, but that is a all hands on deck commissioner call at 2 o'clock in the morning.
Yeah, and I think that, yes, it is all hands on deck, but like just they don't have the right to shelter, and I think that's something that we do need to acknowledge that is different from adults where like even removal, and I know we're calling ACS, but sometimes it does get difficult. And like I said, a lot of the questions I had were just around like DYCD and the preparation and what did that look like, especially since there was very little to no guidance for even the drop-in shelters, and we know a couple of years ago it was rescinded that young people could sleep in the drop-in shelters, and so had a lot of questions on like what those responses have been and what have they supported providers in doing in this time. But because I don't feel like hearing you say you have to refer to DYCD or I don't have the answers, I will follow up with DYCD. But thank you guys for being here and thank you for your service and your time.
Thank you, Councilmember. Councilmember Gutierrez.
Thank you all, and I would like to second my colleague in thanking you all for being here. I know we're here right early. I just have 2 questions, and I was a little late. I was at a hearing across the street, so my apologies if you covered this already. Can you all just kind of walk me through after the 311 calls and, for me in Brooklyn, let's breaking ground, for example, if someone's there interacting, are folks on the ground like, what is the language accessibility interaction like? Are they logging it somewhere? Are there instances where, staff is just not there equipped? I know sometimes PD is called, but kind of like, what does that look like on the data side, or what does that look like for someone like that's just not there that can speak their language?
Yeah, thank you, Councilmember. So just to clarify, during Code Blue, and we've been in enhanced Code Blue for 24 hours a day for quite some time at this point, the 311 calls are routed to emergency response, so to fire department or to PD. So in that case, you actually wouldn't have the outreach worker responding in real time because the nature of things is that there are many more first responders than there are outreach workers, and although we are all crunched for resources, you can get faster response times with the first responders than with outreach. So we do that during very cold weather. But all of our outreach teams have access to a language line so that we can do real-time translation in a whole variety of different languages. And Street Smart, which is our system of record for outreach workers, which both the DHS staff and all of our contracted outreach providers use, will record language of preference. Given the nature of unsheltered homelessness, our identifying information isn't perfect. In some instances, a person would be in as Molly Park, and in other instances, the person would be in the database as the woman in the black jacket, right? Because depending on what they are willing to share, but when we do know a name and a preferred language, we will note that.
You do make a note of that. And can you just remind me, for language line, is it just the 10 languages?
No, language line is very expansive. Certainly if it is a more unusual language, it might take us a little bit more time to set that up, but we are, I know we've arranged outreach over the years in languages that I had almost never heard of. So.
Mm-hmm. Would you be able at a later time to just share, specifically in District 34, the amount, like the languages that, have been called in these like Code Blue situations?
I will need to see if we can break it out at that level of detail, but we will figure out what we can share.
Okay, I'm curious about that. Thank you. And then just on the, just kind of on the looking forward, and I think that's been an incredibly hard time and I really applaud the staff that are on the ground braving the cold with folks. So shout out to all of them because they're away from their families, and it's been an extremely hard time. What are some of the community qualifiers, if that's the appropriate word, that we can engage with starting now? I think about my neighborhoods of Bushwick and Williamsburg. We have we have the same kind of unhoused folks that will move from one corner to the next, and you have the bodega owners that go and offer them water during the summer and, ask them to come inside. What are some of these, and I know that a lot of these folks are transient. I know that it's maybe not that simple for everyone, but are there some of these steps that we can be taking now, and, just throughout the year? And I support the administration's decision not to forcefully, to force people into some of these shelters. I totally understand it. But what are some of the things that on the ground community can be doing to help? I know it's not easy. I know it takes multiple touches, but those relationships do exist, whether it's with the church or, whoever it is. What are some of those things that you think that we can be doing now? And that's my last question. Thank you.
I'm very grateful for that question, so thank you. First and sort of lowest hanging fruit is please call 311, right? In a code blue, it is the way to get people connected to services immediately, but it is also data that we look at on an ongoing basis so that we can say, hey, here is a block, a neighborhood where it seems like we have something going on and we need to be spending more time there. So it is important both on the individual and the macro perspective. I'd say, to the extent that you're identifying institutions within the neighborhood that are more trusted messengers than government might be, then that's helpful information to feed to us, right? So if there is a church that might be the get more trust than government would, then that would be a partnership that we can build. And then the last thing that I would say is every year, usually around April, we send out a request to local elected officials and community boards about whether or not that there are any sites in the neighborhood that might be appropriate for shelter. I know that's a challenging question to ask neighborhoods, but if there is a need for a safe haven in a given neighborhood, then and you have some ideas about what might be a good site, we would be very welcome to explore that. One of the things that we know about people experiencing unsheltered homelessness is while they do not have an inside place to be, they can be very connected to community, right? So if I offer somebody in Brooklyn a placement in the Bronx, it's very likely that they're going to say no. So one of the things that we're trying to do is make sure that we have appropriate sites in many different neighborhoods.
And thank you both. Thank you. Thank you.
Thank you, Councilmember. I'm going to ask 3 questions, then go to Councilmember Banks. I have over 20 questions, though, remaining. So I'm thanking you in advance for your patience and trying to move through these quickly. This is a popular topic, of course, given the severity. And so I wanted to make sure we allowed everybody an opportunity to ask questions. So, for those individuals who died and had a previous connection to the shelter system, how recently were they staying at shelter, and what led them to no longer be in shelter?
So that does vary tremendously, as I've indicated a few times, right? Some of them had in the last, few weeks, a couple of months. In other cases, it was years or decades ago, and we will follow up with some version of the client-by-client information. With respect to, what led them not to be in the shelter system anymore, that's, I can't do anything more than to speculate about that. For some people, their shelter has rules, right? We can't operate shelter without rules. You can't smoke inside. You can't, they are spaces that are shared. And so that might be something that they would chafe at. For other, and I say that because these are, in many cases, people who've been had negative experiences with institutions before, right? So being in an institutional setting, even one that is intended to be trauma-informed, can be challenging. I do think substance use is a real factor in many instances. Certainly not everybody. I absolutely do not want to suggest that that everybody on the street is a substance user, but there are higher rates, and you can't use within DHS facilities. So there can be interpersonal conflicts. As I say, they are shared spaces. So there's a variety of different reasons.
Okay, thank you. Would one outreach team know if a different canvassing team with a different program met with an unsheltered person?
Yes, in that we have a shared database, possibly in that.
Not in real time.
Not in real time, but also sort of almost by definition, our data about people on the streets tends to be a little weaker than our data about other individuals, right? So as I was just saying, you know, some people will give a full name. Other people we know as, you know, middle-aged lady in a black jacket, and then if I'm not wearing the black jacket next time, then that outreach team might not be able to make the connection.
Okay, thank you. Could you walk me through the capacity of DHS Street Homeless Solutions city and nonprofit contracted outreach teams?
Capacity, sorry, in what sense? Like the staff capacity?
Yes, staff capacity, thank you.
So there are about 400 people within the the contracted outreach teams whose job it is to do the full-time outreach work, and then another approximately 200 who include the caseworkers, the housing specialists, the supervisors who are doing, most of them are doing a mix of field work and in-office engagement.
Thank you. I'm going to turn it over to Councilmember Banks
Thank you, Madam Chair.
for some quick questioning.
Yes, real quick. First, I want to just go back to the warming buses and the responses. During the January 27th, there was a power outage in my district, and at the Essex Terrace, which is a development, and it probably consumed close to about 300, a little under 300 customers of Con Ed. Residents were left without power in freezing conditions for more than a day and a half, close to 2 days. And we were told that warming buses would be deployed, but did not occur. Can you walk us through how the decision-making and deployment process worked in this instance, and what factors contributed to the outcome? And let me just get my questions out. When it comes to data sharing with Con Edison, can you describe data sharing protocols, if there are any, that currently exist between DSS and Con Edison, and the use of outage data? When power outages occur, what real-time information does your agency receive, and how is this data used to inform outreach efforts during these emergency responses and resource deployment?
So I can't speak specifically to coordination between Con Ed and DSS. So what I can say,
there's none.
I can't speak to it because I work at New York City Emergency Management, not DSS or Con Ed. So I would defer to them.
I
can
believe
speak to the coordination
the commitment
that NYCM does with Con Ed.
OME actually made the commitment once it was, I guess all the agencies were talking about the power
I'm sorry,
outage.
which agency did?
OME? OEM, sorry about that.
OEM. So I am not, New York City Emergency Management was formerly known as OEM. So I'm not familiar with this specific case. What I can tell you is that what we do on a normal course of basis, and I'm happy to look into this and get back to you with details about what did or did not fall through the cracks. What I can tell you is over the last...
The commitment was made, or the promise was made to
Who made the commitment?
The first deputy commissioner.
Okay, I will look into it.
All right, I just, the reason why I'm bringing this up is because residents were left out in the dark, without heat, without electricity, and to have a commitment made or this false sense of relief that was supposed to come and it never came was disheartening and I was disappointed in the response of the city, and I just hope that never happens again.
It shouldn't have happened. Like I said, I'm happy to look into it. I'm also happy to speak to the protocols that we have in place and the way that we work with Con Ed residents and buildings during these emergencies to ensure that it doesn't.
Well, I hope that's the case, because we're seeing constantly. throughout the entire city, these outages taking place. And we just want to make sure that when these outages do take place, that there's a commitment and a commitment's made and it's kept.
I'll just add, and I'm not sure whether this is the incident that you were referring to, but there have been a couple of instances of power outages in DHS shelters, and in those instances, we offer transfers and move people to other facilities.
I'm talking about the 4 warming buses that was promised that never came to East New York. Thank you.
Thank you, Council Member. I'm going to turn it over to Chair Felice for his questions.
Thank you so much, Chair Hudson. I just want to start the second round of questions by thanking you, Commissioners, Commissioner Iscol and Commissioner Park. Thank you so much for your service to the city. As we know, New York City is a busy city, and public service is rewarding, but it is not easy. So I just want to thank you all for everything that you did these past few years, waking up early every single day and working around the clock to do everything within your power to help resolve the challenges of the city and the people of the city. So just want to start by my second round of questions by thanking you for everything you've done. All those tireless, many hours of work that you put towards resolving our issues. So I'll be fast because, of course, we want to hear from the advocates and others that want to testify. So I'll just going to be pretty fast with my questions. If we could just be a little bit more concise with the answers, just to make sure that, again, we could get the answers and then move on to the advocates. So a few questions. The first one is about effective outreach. My understanding is that lots of homeless individuals, they resist assistance, because, especially related to temporary shelter, because they don't trust the system. They've had horrible experiences with the system, including, for example, unsafe shelters. And also, they've also had many negative interactions with different agencies of the city for many different reasons. So just curious, what's being done to restore that trust with those that we serve, those vulnerable populations?
Thank you, Chair. So I think that I would answer that on 2 tracks. One is making sure that we are continually improving the services that we are offering in shelter. I think there are many stereotypes about what shelter is, and a lot of that is rooted in what shelter has been. But we are really focused on making sure that we are offering safe, dignified spaces with appropriate wraparound social services so that that people can get back on their feet and heal. I mentioned to Councilmember Ressler, we've been doing a lot of work on our real estate development, for example, and many of the newer sites that we're opening are really state-of-the-art buildings. So that is important. And then also, I think, making sure that we are using a lot of different voices to communicate to people who are experiencing unsheltered homelessness. Absolutely, sometimes government is not going to be the trusted messenger. So we work with not-for-profits, but we also support volunteer organizations. We are bringing peers onto the outreach teams, right? Really trying a lot of different ways so that you don't have to trust me, that there are other people that you can trust.
All right, also, what steps are we doing or taking to ensure that people feel safe in the homeless shelters?
So, as I noted, we're investing in the real estate, we're investing in the services, and if you look at the data, the rates of incidents, and particularly the rates of violent incidents, have gone substantially down. So the shelter system is overall a safe place to be, certainly a safer place to be than the streets. But I understand that we are serving people who have been failed by many levels of government, many types of institutions, and that the stereotypes and their memories of shelter from the past may hold true. So that is why we're really trying to make sure that we're bringing sort of many voices to the table so that we can help people understand that, in fact, shelter can be a quality place to be.
My next question is about those 3 individuals that we lost due to overdose-related problems. I know, obviously not a medical expert, know very little about the issue, or know very little about the data related to that issue, but 3 individuals lost due to overdose challenges that specific week. I don't have data on the general amount of people that we usually lose due to that issue, but that number does seem high. What do we know about drug addiction problems or alcohol-related challenges or the effect of it being exacerbated when there's extreme temperatures. Is that something that we've seen based on the medical data?
So let me start and then turn it over to medical colleagues. Substance use and overdoses are the leading cause of death among people experiencing homelessness. Unfortunately, the numbers are down from where they were a few years ago, but they are still high, much higher than we would like. We've done a lot of harm reduction work within the DHS shelter system. Every site has naloxone on site, trained users of naloxone. We train not only staff, but we train clients in use of naloxone. We've gotten federal grants to do harm reduction work so that we're really trying to embed that in everything that we do. And the fact that we have seen a reduction in the number of overdose deaths suggests that it is working, but there is still a long way to go. Outreach teams also carry naloxone, but that, of course, depends on encountering somebody in fairly quickly after they overdose.
Right, but I guess the question is, are the risks related to drug use or alcohol abuse, are those risks exacerbated when there's freezing temperatures outside? For example, your system might not have the same defenses. I'm just wondering how much of a role did the cold play with those 3 individuals that we lost?
I can start with a couple thoughts, then turn it over to our medical examiner. So your question is, does the cold make it more challenging, or does substance use pose an additional risk? And the answer is absolutely. So what we've been doing is taking this also as an opportunity to do what we can for harm reduction. For example, at our warming centers, at some of them, we actually are passing out naloxone, to Commissioner Parks' point, and xylazine test kits. So we're trying to take this as an opportunity for people that are coming to us to have us be able to make a positive intervention to reduce the harm, or in other words, reduce the risk of them having a fatal overdose. I'll turn to
Thank you, and I would agree with everything Dr. Long said and what Commissioner Parks said. I would say that absolutely when it comes to putting someone in a vulnerable position at risk of dying of hypothermia or hypothermia contributing to their death in some way, both drug intoxication of a variety of illicit drugs and also, importantly, alcohol is very mechanistically placing individuals in a very cold environment at risk for hypothermia because of the physiologic effects of alcohol. And so the answer is yes, in an environment that is potentially threatening due to environmental cold, individuals who are drug intoxicated and also alcohol intoxicated are at greater risk.
How much of a risk would you say is presented? Would you say it's a level 10 risk? From a 1 to 10, how bad would you say that risk is? I'm just wondering how much attention we should give that problem. Obviously, it deserves attention, but I'm just wondering how bad it is.
Well, I think it's difficult to place a numeric value in terms of a risk assessment. I think that each case is unique in a variety of ways. The drugs, the alcohol, the environment, natural disease conditions, comorbid conditions. So there are a variety of risk factors, but I think it's important, as you've done, to highlight the risk of that vulnerability in the population. And so Dr. Long may like to comment further.
I'll give a more colorful response. I think that overdose deaths from a public health standpoint are a level 10 risk. I think there's much more that needs to be done across the country to address overdose deaths. And I think that what we've done, the examples I gave are a small piece of our overall citywide approach to doing everything that we can to make sure that, 1, we're building trust to get people on the right treatments, 2, we're distributing things like naloxone, xylazine test kits, and 3, that we have overdose prevention centers that can continue to keep people safe.
All right, thank you for the information. 2 more questions. The next related to 311 calls. So 311 calls on this issue are generally transferred to 911 due to the fact that it would generate
During a code blue, yes.
And the reasoning is faster response.
Yeah, I mean, as I've testified, there's about 400 outreach workers. That's total, not on any given shift. As strained as the resources for EMTs and police are, there are certainly many more.
Is it true that, well, is that policy, is that a rule, department or agency rule, or is it by law, or just makes sense? to do it?
I believe it is policy, and I would need to check whether or not it's ever been codified into regulation, but it is very long-standing policy.
Is it true that 311 calls started being routed to the 911 call center only after more or less 2 weeks, 11 days?
No, that's not exactly accurate. So during Code Blue, which even whether it's a regular Code Blue or an enhanced Code Blue, calls are routed to 911. That is typically done during the late afternoon to evening hours, so from the 4 p.m. to 8 a.m. range. What has changed during this emergency is that we actually declared a 24-hour enhanced Code Blue, and that has been in place for, I would need to double check the exact date that we started, but for some time.
And that I can add, the 24 hours was on the 31st of January, and Code Blue has pretty much been, in effect most nights for most of the month of January. There have been a couple nights where it has not been, but every time it has been, those calls are transferred to 911.
Got it. Okay, so 311 calls were transferred to 911 starting or before January 19th, all of them?
I think we saw our first Code Blue in November.
Okay. All right, and final question, and I asked about it earlier, but I'm just trying to get more specific information. No, the mayor had a briefing earlier last week, and you testified earlier today stating that there were new safe haven beds, 10 school-based warming centers, bus units, outreach workers, 150. How many do we have now, and how many did we have of all of that before January 19th? So now how many were added, how many do we have now total, and how many did we have before the start of this January 19th emergency? Safe haven beds, school-based warming centers, bus units, and outreach workers.
So we are at about 4,000 safe haven beds. That is, we added a couple of hundred in there, but it still falls in the about 4,000 range. School-based warming centers was not something that we did prior to this emergency. We had warming buses, but not school-based. And then there were, I actually believe that, excuse me, that the school-based centers have all closed at this point because school is back in session. That was something that we did for the weekend. But there are, across DHS and H&H, probably about 25 or so. DHS has 20 warming buses, so I'll let Dr. Long talk about how many H&H has.
We have 18 additional sites, warming centers. To answer precisely for your question, hospitals have always been, as Commissioner Parks said, a safe place for people to come to be warm during Code Blue. We have 11 hospitals, and I use the number 18 to say that we also activated 7 new Gotham Health Community Health Centers. And for the 11 hospitals, we didn't just take the lobbies, we created new special areas with food, jackets, and primary care appointments. In addition to that, we also have today still 33 of our new mobile warming units, which we had over the weekend as well.
All right, so hospitals are always warming centers. What about the buses, though, the bus units? How many do we have now, and how many did we have before?
So we have 10, I'm going to answer specifically for DHS. There have, as we discussed, this has been on all hands on deck. But for DHS, we have 10 buses that are part of our standard winter response. We have 10 additional buses, so a total of 20 that are operating now. At various points in time during this emergency, that has gone up and down. And as I mentioned, the MTA gave us some buses for a short period, so we operated those as well.
All right, so 10 standard buses and 10 additional buses. What about before January 19th? Did we only have the 10 standard buses?
That was the 10 standard, yes.
All right, so we basically doubled
Correct.
Our bus units. What about outreach workers? Final question, and then we'll move on to the... How many outreach workers did we have before January 19th versus now?
So with respect to people whose full-time job it is to do street outreach, that is the 400, and that has not changed appreciably. What we have done since January 19th is expand overtime hours for those outreach workers to draw on the skills of other organizations that are working with that are working with people who might be experiencing unsheltered homelessness, like the DOH mobile crisis teams. We have recruited people who are city employees with related skills to supplement. So New York City public school nurses, for example, were embedded in some of our outreach teams so that we could stretch the resources that we can. But we didn't do actual hiring of outreach workers in the last several weeks.
All right, thank you so much for the information. I'll pass it back to Co-Chair Hudson.
Thank you so
Chair,
much.
Do you mind if I just correct something for the record?
Go for it.
So I've just been in touch with my team about the remarks by Councilmember Banks about the warming buses. We will follow up with his office, but Christina Farrell, who's our first deputy commissioner and is amazing, the only interaction she has with Councilmember Banks around a warming bus was on January 27th. And the last note from him was thanking him for delivering that bus. So we'll follow up to see if there's any other.
Councilmember Banks thanked your team.
That was the last interaction we had, was Councilmember Banks thanking our team for delivering a warming bus on January 27th to his district.
Okay.
My first deputy has not had any other interactions with him. So we'll follow up to find out where this miscommunication is and where we may have fallen short with the delivery of 4 buses. But we don't have any other communication with him from my office.
Okay, thank you so much for the correction. Okay, overall Code Blue operations. New York State requires districts to submit an annual Code Blue report on how many people were served, what services were provided, and related expenses incurred. Can this report be shared with the council?
We're happy to share the prior year report. I will note, with respect to spending, the state appropriates $20 million a year for the entire state, and we get a few $100,000 of that. So the spending that is reflected in that report is in no way, shape, or form reflective of the city's commitment to Code Blue work.
Can you give me a specific amount that you're given, the hundreds of thousands?
I don't remember it off the top of my head. I'm happy to
But
circle
you'll follow
back.
up. But a couple $100,000 out of 20 million for the state feels like a disproportionate amount of funding for New York City.
Disproportionately low, you mean?
Correct.
Yes, correct.
Okay. Compared to the size and population and.
Yes, we are in most other funding allocations, we get 60 or something % of the funds when it comes in social service dollars, and this is well under that.
Okay. That's an understatement, I think, well under out of $20 million. But there was reporting that the city had made more than 1,100 placements into shelters and safe havens, although it is reported that it is not clear if some of those placements were duplicates, although I do think you mentioned that they were not unique placements. Why is this the case? What efforts have been made to track those that the city is taking in during this weather emergency?
So an individual can come into a shelter on a Monday, leave on a Tuesday, come back on a Thursday, right? That happens on a regular basis, and we would track those. I think there will be opportunity to go back and do screening and do our best on the deduplication. That is something that we haven't prioritized in the urgency of the moment, where we're really putting our resources into the response. But I think it is something that we can look at going forward.
Okay, thank you. And I think a similar question was asked here, but I'll ask with specific regard to Code Blue. Former shelter residents and those who opt for living in the street rather than seeking shelter often cite shelter conditions as a major reason for doing so. What steps are being taken to ensure the safety of shelter residents during the Code Blue advisory period specifically?
I mean, I think my answer, thank you, is really beyond Code Blue specific, right? We want the shelter system to be a safe and stable place for everybody at all times of year. So we've been doing a lot of investment in the real estate, really trying to make sure that the buildings themselves are safe and clean and well-maintained and dignified spaces for people to get back on their feet. Every shelter has wraparound social services, really to, both caseworkers and housing specialists in most cases, to make sure that we are meeting people's diverse needs. Shelters all also have 24/7 security, which is important for both the residents and the community. And I think if you look at the data on the number of incidents in shelter, and I would, the incident is a very specifically defined under state regulation word, so it includes, there were big spikes in the number of incidents, total incidents during COVID, because COVID cases counted as a priority 1 incident. But if you look at the number of violent incidents, what you see is a downward trend that our shelters are safer than they have ever been in the past. Which is something that matters a lot to us. I certainly understand that there are a lot of conceptions about shelter, and that it is our job to make sure that we are countering that message and helping people understand the current reality wherever possible.
Thank you. It's imperative during Code Blue that providers respond in a timely manner to emergency scenarios. However, providers report that admitting people quickly without completing every standard intake requirement can result in penalties after the fact. Does DHS have an expedited or emergency intake protocol for Code Blue that prioritizes immediate placement over documentation? And if not, how is the agency ensuring that compliance requirements do not delay shelter entry during extreme weather events?
So, this is something that I'll have to dig in with the providers, because it doesn't exactly align with our protocol, but although I'm sure there is something real that is being felt that we need to understand better. The placement process is run through our central team. They are the ones with sort of the eye on the sky on where the vacancies are, so they're the ones saying, send Molly to this particular bed, and the intake, particularly for the low barrier beds, the intake process is happening once somebody is in that bed. So I will follow up with our providers and understand what the concern is.
Thank you. There have been reports of people refusing shelter code during Code Blue because they're required to leave their belongings behind. What is DHS's policy on personal belongings during Code Blue, including bags, carts, and bulk items? And what storage options are available during emergency weather? And how is this information communicated to outreach workers and unsheltered individuals?
So our priority is absolutely to get people indoors. We try and walk the line between making sure that the indoor spaces are safe and hygienic, but also getting people in. So we will work with people to try and consolidate belongings wherever possible. We also have a vouchering system. We operate a storage space where people can store things and then claim them at a time that is convenient for them. We ask our providers to be flexible wherever possible, so that we might be stricter on a 2-bag policy in other conditions to flex a little bit, but it is really a circumstance-driven decision. We also ask our drop-in centers, for example, to add extra chairs to be able to accommodate a few more people than is the norm, up to a level that is allowable by the Department of Buildings, right? So if you have extra chairs and extra people in the space, there may be a limit on stuff. So it's a sort of case-by-case compromise.
Thank you. Mayor Mamdani recently mentioned looking at how the city and state share the cost for services for the city. Is the agency or administration planning to ask the state to revisit the adult shelter cap, which used to evenly split the cost of shelter and outreach services for single adults between the city and state, but gradually diminished to only a 9% state share by 2021? It sounds like this is a trend.
It most certainly is. I will have to defer to City Hall on what they actually plan to pursue. That's certainly one that we've put on the list.
Okay, thank you. Let me mark that. Mayor Mamdani announced that the city will be revoking a policy from the Adams administration which required New Yorkers who wish to stay in a low-barrier shelter provide documentation showing they had spent at least 6 months on the streets or 6 months in and out of city shelter. Can you estimate how many additional New Yorkers may be able to access low-barrier transitional housing sites now that this rule will not go into effect?
No, I can't provide an estimate, in largely because the actual wording of the rule gave us significant flexibility to make sure that we were accommodating everybody's needs, no matter what the actual circumstance. So, the intent behind the rule was that we operate shelters, stabilization beds, and safe havens. They are each slightly different types of settings with different levels of services, and we wanted to provide clarity on how we were tracking people to different types of setting. We were in fact sued because we were not providing that level of clarity. The intent behind the rule was to provide that transparency rather than have hard and fast rules. There was room for significant discretion, but I understand that the administration is pulling back, and we'll be taking another look at that.
And how does the city intend to ensure there's enough low-barrier housing to meet the demand?
So we continue to work with our provider community to cite locations. As I mentioned, we are very much open to suggestions for what appropriate and locations might be within your communities. We have an open-ended RFP for safe haven sites and strongly encourage people to propose options.
How does DSS intend to communicate with New Yorkers that they no longer need evidence of street homelessness?
So this will be something that we work with our outreach providers and our other community-based organizations. This is something that is happening in real time, so I don't have a full strategy yet.
Okay. What is the total number of people who were involuntarily removed?
Since January 19th, there have been 33 involuntary removals through Section 958, which is on the social service side, and I will defer to my NYPD colleagues on theirs.
And under 941, there's been 52 in the same period.
Sorry, can you say that again?
Since January 19th, there have been 52 outdoor involuntary removals.
Thank you. Is the issuance of Code Blue guidance followed up with any other types of communication from DHS to ensure that guidance was received and is understood?
We meet very regularly with our providers. That includes the very formal meetings that we do at the start of Code Blue and the trainings that we do for all of our outreach teams. But we follow up with that on an as-needed basis. As we were preparing for this hearing, my team pointed out that there were 2 such follow-up meetings on Saturday alone.
Thank you. I'm going to break briefly for Councilmember.
Excuse me, Councilman.
Yeah.
I don't want to be rude, but I do want to just flag. I have a hard out at 2 p.m. I'm really apologize.
Okay. Okay.
So I'm going to stay on the topic of providers, Commissioner. So you speak about your providers. You said you met with them as early as just last Saturday. So how do you guarantee that your outreach providers are actually engaging with the homeless, unhoused members of our city, and what evidence do you have of how that information is relayed to you?
Well, let me start by saying these are mission-based not-for-profit organizations who do this work because they care about it, and they are fantastic partners, and so I want to respect the work that they do and what their staff does. That being said, we absolutely look at engagement data by shift, by provider, by all kinds of other things, and if we see trends that are concerning to us, we will engage, and if those trends persist, if there's something that is truly concerning, we'll put an organization on a corrective action plan.
And that's all uploaded into, was it Street Smart that you said?
Street Smart is the name of our system. So, we can see the data on the engagements and things like that. That is in the system. We wouldn't have a corrective action plan there because we wouldn't want that to be visible to other providers.
And do our first responders, NYCM, H&H, do they also have access to upload into Street Smart?
No, in addition to DHS and the contracted outreach providers, the OMH SOS teams have access, as does certain parts of the Department of Health and Mental Hygiene. There's a tension here. There's often, fairly confidential information in that system, right? Might be information about somebody's, physical or mental health conditions, for example. So we do try and limit it to people with specific programmatic needs, but we are also always engaging in conversations with other entities about where a data share agreement might be appropriate and how that can enhance services.
Right, but just information on engagement alone. If the NYPD engaged with 50 plus, or H&H engaged with, I'll make up a number, 25 plus. Right. So how do you get that into one number for when you are testifying before our council members, or just for your own edification?
So we do have regular touch points with our sister agencies. We are engaged, and that kind of aggregate data sharing does happen on a regular basis, not within the data system, but based on the regular contact that we have as agencies of the City of New York.
And who coordinates that?
That has varied over time. At various points in time, it has been led by deputy mayors. Right now, I would say DHS is through this. At the moment in the transition, this is not a reflection on deputy mayors, but the moment in the transition, I would say DHS is playing largely the leading role.
Dr. Long, did you have something to add?
I was going to agree with the line of question about the importance of communication. I believe communication would solve 90% of the world's problems. But for today,
And I just want to flag, I have a question for Commissioner Iscol before he has to leave, so I just want to make sure we can get through this.
Because we just said things quickly, given the extreme situation, we set up borough-based dispatch numbers. So even though we don't see the same data that DHS does, we're in lockstep with them. They can call us directly when they see somebody that could potentially benefit from our services through a direct number.
Thank you.
Do you want to ask your question?
Yeah, I have a question. I'm going to ask my question. City Hall or emergency management can activate enhanced Code Blue at any point. NYPD stated that Code Blue preparations began on January 19th. Can you please state for the record again when the administration activated enhanced Code Blue?
And as Commissioner Iscol prepares, I use January 19th because that's the date that the administration has been using to describe the start of the emergency. But Code Blue, as Commissioner Park mentioned, has been on and off since as far back as November. So there have been many, many Code Blue incidents throughout the entire winter.
But I'm asking specifically about enhanced Code Blue.
So enhanced Code Blue was on January 31st.
I can scroll back with the exact dates because it also varies over the course of the month based on the temperatures and the weather, and it's been turned off and on. So I want to, for the record, get you the exact specific dates that we've activated Enhanced Code Blue.
Okay.
If I could chime in, I believe the January 31st date that was mentioned was the point in time at which we went to 24/7 Enhanced Code Blue, which is something that had never been done before.
Okay, and is there a
reason? There was Enhanced Code Blue before.
It was Enhanced Code Blue before,
Yes.
and then on January 31st, you did 24/7. But why did you wait to offer 24/7 assistance and more routine checkups on vulnerable New Yorkers until roughly 5 days after the worst of the storm?
So let me be clear. We were doing checkups on vulnerable New Yorkers all the way through. There was Enhanced Code Blue hours during that, but throughout the day, 24/7, DHS outreach workers are there. We have been messaging engaging with 311 that people should be letting us know when they saw people. So again, it was this understanding that the cold really wasn't going anywhere and that the Arctic temperatures weren't going anywhere, and we continued to innovate and try and address concerns as much as possible. But I don't want it to seem as if we were not doing very serious outreach in the days before that, because we absolutely were.
Thank you. It is 1:59. I am going to give you 1 minute back of your time. And just to echo everybody else's sentiments, you've been a great public servant, a great partner to work with. Just as recently as Saturday night into Sunday, I believe it was, you were texting me at midnight and 10 p.m. and 6 a.m. updates about a very unfortunate fire in my district, but it's that 24/7 communication that is so important, especially to the people who are being impacted directly on the ground. So thank you so much for your service.
Thank you. I really appreciate those kind words, and I am so grateful that my last question in front of City Council came from you. So thank you. Appreciate it.
You're welcome.
So I'll just finish up.
Okay, you have one more question?
Yep. So when when we started to see that the temperatures were dipping, contacted H&H, contacted NYSM, contacted DOHMH, contacted the NYPD, contacted our first responders, and we were getting kind of all different messaging. Then I hear the mayor on television, and he's saying we're putting a light touch. 18 people lost their lives. I wrote a letter to the mayor, and it said clearly, get the homeless people off the street. Get them help. Get them off the street and out of the cold. I received a response to this letter, and that response was received. I don't think that was a response. And I was hoping that today someone beyond yourselves that are going to still be here could have answered it. I still have no answer. But in closing, I want to say that Commissioner Park, Commissioner Iskell, you are battle-tested. We have gone through the most trying times this city has seen together, and you did it professionally, never lost your temper, no matter how many times we did at this dais. You will be sorely missed. Anyone else at the table that's gone through, and each and every one of you have, I'm glad to see you're still here. I hope you stay. But whatever you do for the rest of your life, may you be blessed.
Thank you.
Should I ask you another question so I can actually be the last one with the question?
That was a statement, not a question. So I think we're...
All right. Thank you so much. Everybody else is sticking around, though, right? I still have some questions. Okay. Are H&H hospitals permitted to release those who have not been admitted to the hospital out to the streets without engaging DHS to make the offer of a warm placement? I know you touched on this a little bit earlier.
Yeah, so just to emphasize, if a person experiencing homelessness is admitted to one of our hospitals, we always have our social work team, who are the real heroes, engage the patient either in the emergency department or in the inpatient unit early on. We're in close collaboration and coordination with DHS. If the person is coming from a certain shelter, we work with DHS to get them back to that shelter. If the person is coming from a different shelter or hasn't been in the shelter system, we work in close collaboration with DHS to connect them to shelter intake. Our social work teams arranges the appropriate medical transport during Code Blue. We have an enhanced way of doing that to make sure that it's the safest transport, whether it's ambulette or accessoride. And during Code Blue, of course, even though people can make their own decisions if they have capacity and are not a danger to themselves or others, we want to make sure that everybody knows about all of the resources we have, which of course also includes our warming centers, which this past weekend, many of which were 24/7, offer same-day primary care appointments, blankets, food, clothing, and even social work rounds.
Thank you. Some unsheltered people survive on the streets with chosen families who may not meet the family definition to access family shelters. What options can DSS take to encourage these households to come inside together?
So our definition of adult family, which is the family without a child under the age of 18, includes units that are family units that are where there's emotional or financial dependence on there. So while most people in there actually have a more traditional familial relationship, marriage, siblings, other things like that, there are ways that if there is an ongoing dependence on one another, that we can absorb them into the adult family system.
And if shelter eligibility standards are too inflexible, would repurposing stabilization beds be a viable option for chosen families?
We certainly work to place people together in stabilization beds or safe havens if that is what is necessary for them.
Okay, and can you talk about how the opening of new shelter capacity has impacted the response to the Code Blue weather emergency?
Yeah, the DHS capacity development team has really moved heaven and earth over the last couple of weeks. So there were 2 sites that were not open at all that we have been able to get open. That involved sort of very rapid fire work with the Department of Buildings, with the State Office of Temporary and Disability Assistance that certifies shelters. They have been a tremendous partner throughout this. Making sure that the sites were adequately staffed and provisioned and getting them open, weeks or in one case even 6 weeks or so before the original planned opening date. We had a shelter, an adult family site that was slated to convert to serve those experiencing unsheltered homelessness. So we accelerated that conversion, moving some of the adult families to other sites where we had capacity. And then there was a hotel that had operated as families with children capacity, which we were already planning to flip. And we, rather than using it as sort of traditional single adult capacity, we were using it as stabilization beds.
Thank you. How did the massive amounts of snowfall starting at the end of January impact emergency operations relating to Code Blue calls? And did the snowfall impact response times or require a reprioritization of resources?
As I mentioned, a lot of our outreach teams are out on foot. So that's, on the one hand, sort of both good and bad in the snow, that they didn't have the same kind of transportation issues. In some of the further out locations in the boroughs, they do travel by car, and it made things a little bit more challenging. But we adapted, and people were out no matter the weather.
Which non-agency providers have data sharing agreements with the city for Street Smart? And are there providers who do street outreach that do not have those agreements? If so, which and why?
So all of the outreach providers that are contracted with the city have access to Street Smart. We've also given the outreach providers that are contracted through State Office of Mental Health, through the SOS program, we've given them access to Street Smart. There are... the other, I think, formal organizations that city contracted agencies that may interact with people experiencing unsheltered homelessness actually serve a more diverse population, right? So, we are grateful for the help from DOHMH and their mobile crisis teams during this emergency, but they serve some people experiencing unsheltered homelessness and some people aren't. So we explore where data sharing agreements are appropriate in that context. Where I think it's been a little bit more challenging is, there have been questions about whether or not some of the volunteer organizations or bids, other kinds of things like that should have access. That's, I realize it comes from a place of good intention, but we're also really concerned about protecting people's privacy from people who don't have the same kind of rigor around their privacy as we might.
Would you be willing to follow up with a list of the organizations that have those agreements?
Yeah, sure.
Okay, great. How is information shared with outreach teams once the outreach team engages unhoused individuals? And is this information shared with all outreach teams, including those without contracts?
So information gets entered into Street Smart. That's our system of record for the street outreach work. The list of organizations that I mentioned will have access to that. The organizations that excuse me, don't have that same kind of broad-based view. I'd say one piece of information sharing, excuse me, that it's been a lot of talking, that I should have added is we have what are known as our behavioral health intervention teams. I think I'm getting the acronym slightly off, but what has been colloquially known as our top 50 lists, which are known lists of individuals about whom we are particularly concerned, both streets and on the subways. And there we bring together, a real diverse set of players who might have information about that client and really try and work on a retail basis to come up with particular outcomes, right? That's not the same kind of emergency response that we're talking about in the context of what we've seen over the last couple of weeks, but it is a really important network that we've established and that has been successful in helping get to longer term solutions for what are some otherwise very high need clients.
Thank you, and it's the last few questions here, so thank you again for your patience. What's your view on whether encampment sweeps hinder the city's ability to connect homeless New Yorkers to services, and have these sweeps created distrust among unsheltered populations? Does this create a hindrance when working to shelter people long-term?
So, I will say that the DHS role in the encampment sweeps actually happens largely not at the actual moment of sweep, but in the days and sometimes weeks leading up to it, where DHS is out engaging, working with clients, really trying to build a relationship to try and convince them to come inside. So, the first thing that I would say, and I know there's been speculation about whether or not change in encampment policy has contributed to the deaths. I don't think that is the case, right? Because really the work of bringing people, helping to convince people to come inside is all happening in the lead up to an encampment sweep, or was happening in the lead up to the encampment sweep, and that kind of ongoing outreach is still happening. We are still engaging with people who might be living in encampments. With respect to the overall policy conversations around the future of encampment sweeps, I'm going to defer to City Hall.
Okay, thank you. What investments has your administration made in recent months to strengthen street outreach, safe haven beds, and 24-hour warming options, particularly for our most vulnerable residents? And do you plan any additional changes in the mayor's FY27 preliminary budget?
So I've mentioned that we've opened a number of additional low barrier sites. That has been a really important part of our response. The vacancy rate would otherwise be really problematically low, so I'm glad we've been able to do that. We are in ongoing conversations with City Hall and the Office of Manager's Budget about potential other changes, but nothing I can speak to at this time.
Were the individuals living outside who were found dead on DHS's Code Blue priority list?
None that we are aware of at this time.
And why wouldn't that be?
The priority list is really individuals that are both known to us and have, a very specific list of acuities that, as I mentioned during my testimony, of the individuals who were known, who passed away, who were known to DHS. We are taking a very expansive definition of known, right? So some of them goes back, years, and so they wouldn't have been on the list because we weren't actually engaging with them at this time. And then for the people who had more recent engagement with the system as a whole, and as I noted with the speaker, right, it may not be literally with outreach, it might be with the shelter side of our operations. They didn't have the underlying acuities that we focus on with that particular vulnerable client list.
Okay, and for the last question. Today, the NYPD testified that 22% of Code Blue calls were deemed not needing assistance, some of which were deemed such because the individual was not identified, as was the case with Frederick Jones, who was found dead a day after police officers reportedly checked on his location. Can you talk about how identification is determined? Do the responding officers leave their vehicle to try to identify the individual in the near vicinity, including, for example, in a store?
So it's, again, very context dependent. In that scenario, they did canvass for a number of minutes in order to find him. They did stay in the car in order to cover a larger geographic area because they knew that individual did move from place to place at time. So that was really their judgment. And I won't second guess their judgment in that scenario. They do their best they can. They weren't able to locate him at that time.
Okay. Thank you. Alrighty, thank you all so much, and to Commissioner Park, also echoing everyone's previous statements. It's been a true honor and pleasure to work with you over the years. You have also received many texts from me at all hours with constituent cases, and you've always been incredibly responsive, and so thank you for your service.
Thank you so much.
Thank you. Alrighty, I now will open the hearing for public testimony. Thanks to everyone else from the administration for being here. I want to remind members of the public that this is a government proceeding and that decorum shall be observed at all times. As such, members of the public shall remain silent at all times. The witness table is reserved for people who wish to testify. No video recording or photography is allowed from the witness table. Further, members of the public may not present audio or video recordings as testimony, but may submit transcripts of such recordings to the Sergeant-at-Arms for inclusion in the hearing record. If you wish to speak at today's hearing, please fill out an appearance card with the Sergeant-at-Arms and wait to be recognized. When recognized, you will have 2 minutes to speak on the oversight topic, New York City's Code Blue operations. Can we quiet down a little bit, please? If you have a written statement or additional written testimony you wish to submit for the record, please provide a copy of that testimony to the Sergeant-at-Arms. You may also email written testimony to testimony@council.nyc.gov within 72 hours of this hearing. Audio and video recordings will not be accepted. It doesn't seem, though, as anyone from the administration has remained here. Is that accurate? There's nobody here from the administration? Okay. I'm noting for the record that nobody from the administration has remained in the room to listen to the testimony of members of the public and advocacy organizations. I'm sure they will tell us that they're watching online, though it's not always sufficient. I'm going to call up the first panel: Joshua Goldfein, Allison Wilkie, Graham Horn, Carolyn Norton, Kristen Miller, and Catherine Trapani.
Allison left.
Not a problem. Thank you. Noted. Do you want to begin?
Thank you, Chair. My name is Josh Goldfein. I'm a staff attorney at the Legal Aid Society. I want to thank the chairs for holding this very important hearing on such short notice and asking good questions and getting good answers. I also want to note for the record our appreciation in particular for Commissioner Park and Commissioner Iskell for their work over the last few years through what was maybe the most difficult test ever faced by those agencies and ensuring that people had places to go inside. We see now why that is so important and why we were talking about how important it was to go inside. We will be submitting written testimony that addresses our concerns that the solutions, as we've heard today, are known to us for the problems that we are experiencing, and that is to expand low-barrier shelters, to reduce the reliance on large congregate shelters, to approach people with solutions that they will accept. And that we have seen that those strategies will work, and we just have to expand them. And that is, in fact, what the administration did over the last several weeks, and they showed that that would work. So I think the record is clear that that is the solution. I just want to highlight for today some points that were made during the testimony that may not make it into our written testimony. First, on the point of the hospitals, you heard a discussion of what happens when people are discharged, and it's important to zero in that what we were talking about was people who are patients are discharged, but people who are in the emergency room who are never admitted are not considered patients. And so all of that conversation did not address what happens to those people. And so we need a solution to address in these kinds of crises what happens to people who are physically present, who are not considered admitted to the hospital. I also want to note that Commissioner Park's numbers on state funding were very generous to the state, that in fact the city is responsible for 90% of the cost of the single adult shelter system and 50% of the cost of the family shelter system. So the 60% figure that she gave doesn't, I think, highlight enough the way that the state has cost shifted these obligations to the city and left us holding the bag in a way that the administration needs to address in Albany with all of our support. Finally, I just wanted to note I'm here on behalf of Coalition for the Homeless, who are our client as well. We will be submitting joint written testimony, and I have some numbers that the committee was asking about from the daily discovery that the city provides to Coalition for the Homeless as the shelter monitor. And I just want to note these for the record. On January 19th, the actual safe haven capacity on that day was 3,550 beds, and 123 of them were vacant.
Sorry, say those numbers again?
Sure. Now we're talking about January 19th, which is the day they said that they started keeping records. There were 3,550 safe haven beds, and of those, 123 were vacant. Now, fast forward to the most recent day for which we have data, which is February 8th, so 2 days ago. On that day, the capacity was 3,645. So I believe that means 95 safe haven beds were added. And of those 95 beds, 26 were vacant. So hopefully those numbers will comport with what they can supply you with later.
Thank you. I tried to dig into the emergency room visitor versus the patient, essentially, or admitted patient piece. It didn't sound like the answer changed much, but I do appreciate your pointing that out. And also, it sounds like you're giving the administration ideas for funding to ask, which would have been good for them to be here to hear them. So thank you for your testimony. Next.
Chairs, good afternoon. Chairs and staff. Good afternoon, my name is Graham Horn. I'm a coordinating attorney on the Shelter and Economic Stability Project in the Public Benefits Unit at New York Legal Assistance Group. Thank you for your attention to this critical issue. In any discussion about unsheltered homelessness and the adequacy of outreach efforts, we must begin from the point that people do not choose to sleep outside. They are forced to sleep outside because available shelter cannot accommodate their needs. The vast majority of the Department of Homeless Services single adult shelter placements are in congregate settings, which can have as many as 100 people sharing a room or a dorm. Almost all of our clients experiencing street homelessness stay outside because they cannot live in congregate shelter due to past trauma endured in that space. While sleeping outside, our clients are subject to dangers of robbery, assault, rape. They are food insecure and malnourished. Many have chronic underlying illnesses. Their bodies are under enormous strain, and the psychological toll of being constantly on alert has caused many of our clients severe anxiety. And this is the baseline reality of our unsheltered neighbors, forced to endure these chronic and cumulative stressors because shelter is even less safe. The fact that this continues to persist in the presence of this magnitude of a Code Blue emergency, that we still have people unable to return to the realities of our congregate shelter spaces, instead taking their chances on the street, should be for all of us a profound moment of reflection and a powerful call to action. We are very relieved that the administration has chosen to rescind the promulgation of the rules that would have made these very limited low barrier shelter placements even harder to access. But we want to touch also on reporting that we have from a fellow advocate that when folks on the street experiencing street homelessness are contacted and connected with outreach, the person doesn't come inside after multiple engagements. The police will be called in some instances, even if the outreach worker does not believe the person meets the standard for involuntary removal. This is terrible policy, which will have a disastrous effect on the future of outreach workers' abilities to engage. As Councilmember Nurse was suggesting earlier, and as Dr. Long's new mobile buses seem to provide, outreach must move in the direction of assistance providing food, drinks, blankets, and gloves. And also, as my testimony, written testimony will go into in more detail, we do not believe that sleeping outside meets the requirements of mental hygiene laws. And sleeping outside is not evidence of mental illness. It is a function of fear of congregate shelter. Thank you.
Thank you so much.
Hi, good afternoon. I'm Kristen Miller. I'm Executive Director of Homeless Services United. We are a member organization representing the outreach providers that we were hearing about today and other homeless service providers in the city. Thank you, Chairs Hudson and Felice, for convening us here today on this critical issue. I echo my colleagues in thanking the administration leaders, particularly Commissioner Park, for her years of services. We are incredibly saddened and outraged by the death of 18 New York residents who passed during the cold snap. No one should die on our streets. We would like to raise today some of the issues that street outreach and stabilization bed providers have identified as obstacles to successfully place people. There are over 25 different agencies, entities, and data systems involved. This complex network creates significant coordination challenges with different funding requirements, data systems, and reporting mechanisms, making unified client service difficult. We've been hearing about many of the numbers of activities. I think it's really important to note that through all of this, whether there's a cold blue or an enhanced cold blue, our outreach workers are working 24/7. However, the success of contracted street outreach teams and safe haven or stabilization bed providers have been limited by system inefficiencies. We need greater coordination between teams and systems. For example, increased coordination between emergency departments, inpatient teams, and outreach teams. Teams also want more data coordination and increased access to comprehensive client information in the care system. In order to successfully move more clients from street to housing, we need to expand the option availables, including those outside the DHS system. We also call on the administration and the City Council to examine how these programs are funded. The cold snap may be over soon, but New Yorkers experiencing street homelessness are just as much at risk during the extreme heat. Like our EMT friends, outreach workers are also underpaid, working in very stressful situations. There's high vacancies in the nonprofits and high turnover. We must fund these programs to be innovative and responsive all year round. In the event, I want to address involuntary commitment quickly. We believe it should be used in only the most rarest cases, but we must do more to address the post-commitment care to make sure the folks are supported long-term. Lastly, we think this is a moment that calls on all of us to learn, reflect, and be ready to be innovative to meet the needs of all unsheltered New Yorkers. We look forward to working with the council and the administration on these issues. Thank you.
Thank you so much.
Good afternoon, Chairs Felice and Chairs Hudson. My name is Carolyn Norton, and I'm the Interim Chief of Litigation and Advocacy at Legal Services NYC. Legal Services NYC is the largest civil legal services provider in the country, and our neighborhood-based offices across all 5 boroughs serve over 100,000 individuals annually. One of those practice areas is focused on housing, and we have a very robust practice focusing on eviction work. I'm here today to discuss a critical contradiction in the city's policies that puts New Yorkers' lives at risk every winter. Wisely, the city has created a code blue policy to ensure that the unhoused can gain access to shelter during periods of extreme cold. This policy is in place for a good reason. Living outside during freezing temperatures, as we know, is not only dangerous, but can be deadly. The city recognizes that for the unhoused, freezing temperatures present a real threat. Yet at the same time the city is working to bring the unhoused inside, it allows city marshals to continue with evictions, thereby rendering a new class of New Yorkers homeless. Our organization analyzed, using publicly available data, the number of evictions that occurred across the city when the temperature was below 32 degrees, thereby triggering a code blue response, and found that from 2017 to date, there were nearly 15,000 evictions carried out. Climate change is exacerbating the risk posed by both excessive heat and extreme cold. Last summer, Legal Services NY released a report, which I'll include with my written testimony, on the dangers of being evicted during periods of extreme heat. Last summer's brutal heat wave was followed by this viciously cold winter. We know from these past weeks how dangerous it can be to be unhoused during freezing temperatures. And yet last Monday, when the actual temperature in the morning at approximately 9 a.m. was 20 degrees Fahrenheit and 9 degrees with a wind chill, city marshals began evicting tenants and ultimately evicted 107 individuals and families. The city has acted to suspend evictions during periods of extreme weather in the past, and they did in fact suspend evictions for the first week of the storm. But unfortunately, there's not a uniform policy in place, and the notice to suspend evictions are typically not issued until the day prior, so tenants may still be taking steps to prevent the eviction, such as traveling to court to file an appearance, filing emergency papers during dangerously cold weather. As climate change intensifies extreme weathers across all season, New York City has an opportunity to take a bold step on behalf of its most vulnerable residents when they need shelter the most. In doing so, the city will be joining other jurisdictions like Washington, D.C. and Cook County, Illinois, which includes Chicago, who've implemented policies suspending evictions during periods of extreme weather. Allowing evictions to occur when it puts New Yorkers at risk of serious harm or even death is inhumane. New York City has recognized extreme cold as a grave threat to the unhoused, yet the city allows tenants to become newly unhoused during these same conditions. By establishing a uniform approach that suspends evictions when a cold blue is in effect, New York City can prevent unnecessary illness and death, reduce strain on emergency services in the shelter system, and demonstrate that basic human dignity and public health are paramount. Thank you for your consideration.
Thank you so much for your testimony.
Good afternoon. My name is Catherine Trapani. I'm from Volunteers of America, Greater New York. I want to thank everybody for this hearing and the opportunity to testify. First, I want to touch on things that I think were helpful. I think the decision to not sweep encampments probably saved lives. Allowing people to keep tools that keep them warm, like blankets and tarps and tents, is the right decision. I think that the warming buses were a game changer. I want to thank Dr. Long for sending one to my neighborhood when we noticed an unhoused person in need. The response was incredible. And I also think that the addition of single rooms and low barrier beds is a policy that needs to continue. In terms of what went wrong and how we can fix it, there's still not adequate communication and data sharing. Some of the CARES and Street Smarts access that we've been talking about this morning is actually read-only access. There's not real-time data updates throughout shifts, and so that needs to improve. The definition of a family is still too strict, despite the ability to make exceptions to policy. That's not a uniform thing, and a lot of folks on the streets don't know that they have that option. Safe havens and stabilization beds should not be a prize. They should be readily available, and we need to continue to ramp up capacity until we have enough capacity to meet the need for everyone unsheltered. And certainly the general shelter system needs both repair and a design overhaul. If people do not feel safe coming in, we're going to lose the whole thing. And so I want to applaud the Commissioner Park in particular for her innovations on purpose-built shelter that is designed from the ground up with the needs of homeless folks in mind. But remember, the bulk of the system is old. It was created haphazardly, and it's been, going on for years with challenging conditions. And I would love selfishly to ask DHS to expedite some of the approvals that we need to do some improvements in sites that VOA operates, because it's really been a long-standing battle. And I think if we can show that it's possible to make these places more safe and humane, other providers will be able to do so as well, and we need the flexibility and the funding to do that. And finally, pathways to housing have to be faster. Street teams can and should be linking people directly to homes. Our Street to Home pilot program received 15 referrals in the last 2 weeks for some vacancies. We have 69 additional units that could be added to this pilot to house people almost immediately, and all we need is for the city to say yes. So thank you very much for the opportunity to testify. I appreciate all the work of this committee.
Thank you so much. Thank you all for your testimony. I'm going to call on Oren Barzilay, who's online. And I believe we'll wait for you to be unmuted. Oren Barzilay.
You may begin.
Oren Barzilay.
Hi, I was waiting to be unmuted. Thank you.
Okay, no problem. We can start your time now.
Hi. Thank you, ma'am. I want to thank everybody at the council who's been advocating and supporting our pay parity issue that's been going on for years. And I want to thank the chief of the department for mentioning that today. As you heard by his own words, EMS is holding 300 calls each hour. It's not just 300 calls for the day. As calls get dispatched, more calls are coming in. It is hard for us to keep up with the demand. And unfortunately, people who are suffering from hypothermia have longer waits. Even though they are receiving preference now to pick up these calls, they're still waiting minimum to half an hour. It's just the public is not getting the aid that they need, specifically under this crisis that we're going with, this extreme weather. Both our men and women in EMS and on the fire side are doing heroic work, but the city is asking us to do something that is impossible to achieve without the resources, and the public is paying the price. And now we're seeing that 18 people have passed. When the police or EMS get dispatched, they're no longer there because they waited an hour. Sometimes calls are waiting for 7, 8 hours. It's an ongoing issue. Hopefully, this new administration will advocate and give us the funding that we need to deal with these calls.
Thank you. Thank you for your testimony. I'd like to call the next panel in person: Helen Strom, Eric Rosenbaum, Erica Strang, Judith Rosenfeld, Van Yu, and Jody Rudin. Okay, you may begin.
Chairperson Felice, Hudson, and members of the Committee on General Welfare and Public Safety, thank you for the opportunity to testify on this important topic. My name is Erica Strang. I am from the Center for Urban Community Services, CUCS, where I serve as the director of the Manhattan Outreach Consortium, commonly referred to as MOC. We are a group of 3 nonprofits contracted with the Department of Social Services to provide outreach and placement services to unsheltered New Yorkers. Annually, we make more than 1,800 placements of transitional and permanent housing. For years, City Hospital and nonprofit collaboration around Code Blue operations has saved countless lives. The recent terrible weather and tragic cold-related deaths highlight that improvements can be made. Since the first Code Blue notice in November of 2025, MOC has made over 320 placements from the street to sheltered settings. We applaud the city for increasing low-barrier, low-density safe havens and warming bed capacity as an alternative for people who are fearful of and overwhelmed by shelters, and we encourage more of these options. We know that when single rooms are offered, people are more likely to accept placement. One additional step the city can take is to relax current shelter rules, limiting the number of belongings that can be brought inside. People hesitate to surrender their belongings to come inside, or often want their belongings stored nearby. We recommend increasing the bag limit from 2 to 4, or the acquisition of storage vans near shelters to assure clients their belongings are close by. During Code Blues, our social workers, nurses, nurse practitioners, and physicians conduct 9.58 and 9.37 community removals to hospitals, a very last resort, yet a critical tool for preventing death. We find that NYPD and EMS workers who respond to transport calls aren't familiar with our removal authority. We urge the city to lean on nonprofit partners like CUCS to provide training for first responders around this type of removal. Additionally, we recommend that the city develop an enhanced Code Blue notification to NYPD and EMS workers about removal authority for all outreach teams to reduce barriers to immediate hospital transport. Our final recommendation is to build capacity for outreach teams to mobilize during weather emergencies. MOC has over 1,800 people on caseload. To satisfy the FY24 PEG, MOC was forced to cut its budget by 3%. However, our caseload has doubled in the past 8 years. We advocate a 6% increase to the MOC budget to meet staffing needs for its current caseload. We also advocate that funding levels allow us to raise starting salaries from an average of $40,000 to $50,000 because low pay compounded by high caseloads makes it difficult to staff a sustained and enhanced Code Blue response. Thank you for your attention and consideration.
Thank you for your testimony.
Hello, my name is Helen Strom. I'm the Benefits and Homeless Advocacy Director at the Safety Net Project at the Urban Justice Center. We work directly with people who are street homeless to organize for actual solutions to homelessness and permanent housing and to stop the criminalization of homeless people that's occurring on the streets. And we also provide services and directly work with people on the streets to get permanent housing and to come inside. I want to read part of a statement by someone who is street homeless as part of my testimony who couldn't be here today. This is a statement this person wrote in December. And he said, on December 4th, I experienced an emergency sweep at 7 p.m. at night where all of my belongings were thrown away, including a bicycle worth over $1,500, my medications, and toys and clothes for my 2 children in Queens. I was arrested and released to start over again. This is just one of the over 40 sweeps I've experienced in the last 3.5 years. Over half a dozen times, 100% of my belongings have been disposed of in the back of a garbage truck with tears in my eyes as I watched. So I start with that to say I agree with what the earlier panel said, that stopping encampment sweeps likely did save lives this month, and the opportunistic framing by someone in the media saying that sweeps were somehow responsible for these deaths, I think it's extremely harmful, and it's a way to use an abusive practice that repeatedly harmed homeless people and destroyed trust with outreach, opportunistically use that as a cause for these people's deaths. Is just absurd and extremely harmful. So in terms of the things that we think did work this month, stopping sweeps, I absolutely believe saved lives. And opening new beds, opening single rooms, opening places where people can actually go inside, that worked. This person is now, who I read that statement from, experienced no sweeps this month and is now in a single room. So those things work. But there's a lot that still needs to change. We spoke with many people this month who were getting kicked out of subways by the NYPD into freezing cold conditions. And they were directed as of Friday to stop doing that. And we are hearing reports that the NYPD is continuing to do that. We've spoken to homeless folks who are getting kicked out of stations into the freezing cold. So the mayor has directed the NYPD not to do that. They need to stop kicking people out into the freezing cold in this weather. Because people are being kicked out without any assistance. This is not people who are causing disruption in the station. These are people who have nowhere else to go and are relying on the subways for warmth. And just lastly, sweeps have really destroyed a lot of trust between outreach and the city. There's a lot of homeless folks on the street who see outreach approach and say, I don't want to talk to you because you're the same person who came to the sweep. You're the same person who posted the sweeps notice, right? So there's a lot that needs to be done to rebuild that trust. And I think you've heard today some ways that it can happen: distributing care kits, distributing material supplies, actually working with people on permanent housing. Most people we talked to on the streets have gotten no help in getting permanent housing from their outreach teams. The outreach teams sometimes don't even have access to the city FEPS vouchers. They don't have access to the affordable housing apartments for homeless set-asides. The outreach teams are only able to assist them with getting into shelters, and sometimes they aren't able to assist people with that. So I think we really need to see a complete overhaul of the system to rebuild all the trust that has been broken between homeless people and city outreach. And it starts with giving people supplies and care that they need, getting people into permanent housing, into vacant supportive housing units, giving them vouchers, using housing first that was spoken about, actually getting people the assistance we need, and for people to know that the city is trying to do that instead of trying to push them from one place to the other, as happened during the sweeps in the previous administration and is happening right now with the NYPD and the subway system.
Thank you.
Hello, I'm Eric Rosenbaum. I'm the president and CEO of Project Renewal, a 58-year-old nonprofit that provides housing, healthcare, shelter, and employment services to thousands of New Yorkers experiencing homelessness each year. Thanks to Speaker Menon and to you, Chairs Hudson and Feliz, and to the members of your committees for calling this hearing. Project Renewal builds supportive communities where people achieve dignity and independence, renewing their lives with health, homes, and jobs. When an emergency strikes, providers like us need to act quickly. And we also need to build the infrastructure to be ready for the future. I'm going to try not to repeat things that have been said a lot already, but I would say 3 things. One is that there isn't a map of the entire very complicated system. Project Renewal operates many services, some of which are not funded by the city. We operate state facilities, we operate federally funded healthcare. We can coordinate very well among ourselves for the few thousand people that we that we house and provide services to. But the city doesn't necessarily tap into everything that we do because they don't have a full understanding of our services. And certainly, even though I've been doing this work for 18 years, I don't know the full range of what is actually available out there. I think technology would be a big help right now just to build a full system map and to ensure that data is available in real time. An outreach worker on the street should be able to open their phone and see what the safe haven beds are that are available right now within a 5 to 10 minute walk of where they are, or other resources that might be appropriate for the person that they're talking to. We are also building shelter capacity. We have 400 beds of purpose-built shelter that's going to open in the next few weeks. I sometimes think about what that could have done had it been available a month ago or 2 months ago. And I would invite you to look at this because for all of the concerns about what the shelter system is, we are building an operating shelter that is radically different, radically better, much more designed around the needs of people with lived experience. And we also need to be able to repair facilities that mostly are owned by the city and need fixing up substantially in order to be the kind of place that people are willing to go to get the services that they need. And I think I'm going to stop there.
Thank you. Thank you for your testimony. And you could submit longer written testimony.
Hi. My name is Judith Rosenfeld, and I'm Vice President of Special Projects at Breaking Ground. Thank you to Speaker Menon, Chairs Hudson and Felice, and members of the General Welfare and Public Safety Committees for holding this important hearing. Breaking Ground is the largest developer and operator of permanent supportive housing for low-income and chronically homeless New Yorkers. We operate over 4,000 supportive apartments with more than 2,000 in development and lead street outreach in Brooklyn, Queens, and Midtown Manhattan. Along with our network of 800 safe haven beds and our drop-in center in Queens, we serve over 10,000 vulnerable New Yorkers each year. This recent stretch of extreme cold has been the most dangerous we've seen in years. Our outreach teams were in the field even before the weather arrived, working closely with DHS to adapt quickly. We bring people indoors whenever possible, and when someone is hesitant, we deploy clinicians, check frequently, and keep a very low threshold for intervention during the coldest nights. Our outreach teams have placed many unsheltered individuals into transitional and permanent housing. We saved many lives, but we mourn those 18 individuals who suffered. To prevent future loss, we must expand low-barrier beds, safe havens, and stabilization beds directly in neighborhoods where outreach teams work. We also need flexibility to fill vacant supportive housing so people can move inside faster and free up beds for others at risk. In particular, HACA units often sit vacant for months before they are filled. If we could place non-HACA specific clients into these units and receive the necessary operating supported funding from the city, we would move people into permanent housing faster and free up more safe haven capacity. Breaking Ground stands ready to partner with the City Council, the administration, and DSS to strengthen Code Blue response and ensure more New Yorkers survive and thrive off the streets.
Thank you for your testimony.
Chair Felice, Chair Hudson, thanks for this opportunity to testify. I'm Van Yu. I'm the Chief Medical Officer of the Center for Urban Community Services and its healthcare affiliate, Janney Medical Care, which provides psychiatry and street medicine to city-funded outreach teams, including the Manhattan Outreach Consortium, Breaking Ground Street to Home in Brooklyn and Queens, and the Bronx Works Homeless Outreach Team. In this capacity, we've enjoyed a long-standing partnership with the Department of Homeless Services, including the Joint Command Center. In calendar 2025, street medicine served 489 patients, over 3,417 visits, and outreach psychiatry served 344 patients, over 1,084 visits. I offer the following 2 recommendations to improve Code Blue operations. First is to seek opportunities to increase support, training, and retention of outreach staff. Much of the groundwork for Code Blue success is laid down in day-to-day painstaking work before a Code Blue. Many vulnerable people suffer from serious, difficult-to-treat mental disorders that impair people's ability to accept care and navigate housing pathways. Furthermore, the processes and settings of service can be overwhelming and even terrifying. These are some of the most complicated and challenging psychiatric conditions to address. Therefore, effective service requires psychological understanding, resilience, patience, persistence. Without adequate training and supervision and support, outreach encounters can inadvertently exacerbate symptoms, and outreach providers can get burnt out. Furthermore, having a familiar outreach provider leave a team can disrupt weeks or even months of hard-won trust. During a code blue, a vulnerable person is much more likely to agree to come inside or accept care from a provider who has already nurtured a psychologically effective, trusting relationship over time. So, interventions to support and retain providers, investments made today, will pay dividends during a code blue. Second is to seek opportunities to improve collaboration around and support for hospital transports and inpatient admissions. The senior advisor for severe mental illness, who has reported directly to the Deputy Mayor for Health and Human Services, has been invaluable in brokering such collaboration between outreach, NYPD, also increased acute inpatient, extended care unit, and transitional housing unit capacity could ease pressure to discharge people from emergency departments and provide more opportunity for inpatient stays of adequate duration to realize treatment benefit. Thank you for your attention and consideration of these recommendations.
Thank you for your testimony.
Good afternoon. My name is Jody Rudin, and I'm the president and CEO of the Institute for Community Living, a large behavioral health and housing organization that serves over 10,000 people annually and provides housing for 4,000 people a night across all 5 boroughs of New York City. Thank you both, Chairs Hudson and Felice, for your leadership in calling this hearing, and I appreciate the opportunity to testify. I also, although she's no longer here, really want to thank Commissioner Park for her leadership over these last several years. I personally think she's set the bar with respect to working with integrity, bringing a collaborative spirit to the work, and also really innovating around permanent housing options through the Department of Social Services. I also think the administration deserves a lot of credit for its rapid response during the cold weather emergency, and so do the outreach providers for their 24/7 life-saving work. But the truth is, for people sleeping on our streets, emergency is not seasonal, it's the daily reality. Unhoused New Yorkers face an ongoing public health crisis. People experiencing street homelessness die at rates 3.5 times higher than the general population, and this is driven by hot and cold weather exposure, illness, and violence. We cannot emergency our way out of a structural crisis. We need permanent solutions. This starts with prioritizing housing and expanding low-threshold options, including safe havens, stabilization, and medical respite beds, more intensive mobile treatment slots, and fully funding the STEPS program, which serves people with the highest needs who have often been on the streets for decades. The council actually worked with the Adams administration to allocate $15 million for this work, for intensive mobile treatment and for STEPS, the step-down program, in fiscal year 26. These funds have not been procured. They must be released. Lives depend on it. This is a source of major consternation, and I would ask the respective committees to focus on it. I'll just also say in closing, we need an accountable governance structure in New York City that reflects and streamlines the complexity and cross-agency nature of this work. We've seen it on display today: DHS, EMS, NYPD, H&H, DOHMH, DYCD. Who is ultimately accountable? I would suggest a high-level accountable coordinator at City Hall. When I served as assistant commissioner at DHS, we reduced street homelessness by 40% using by-name lists, prioritizing people at highest risk, and pairing outreach with real housing options that reflect the preferences of people living on the streets. We know what works. Now we need the sustained commitment and investment to do it. Thank you.
Thank you so much for your testimony. And Helen, was it? I wanted to just ask a follow-up question. Anybody could answer, though, but based on your specific testimony, you shared the experience of someone who was who experienced an encampment
Yes.
Sweep, yes,
Yeah.
thank you, sorry. And that their items were put in a sanitation truck for disposal. My understanding was that items were supposed to be, personal items were supposed to be inventoried. Generally speaking, has that been the experience of other folks that you are aware of or not? I'm trying to assess if the normal protocol is that they're actually just throwing away the items, or are they actually inventorying items and then returning them at a later date to folks?
Oh, they're very often throwing people's belongings away. And I think, like, their personal belongings into the trash. And we're very, like, we really appreciate that this administration is not going to do that, that this administration knows that that is not a way to solve homelessness, that's just a way to traumatize people, you know, move them out of sight to another place a couple blocks away.
Right.
It had like no permanent housing outcomes
Right.
in the entire time that data was collected on it, and that is not a way to solve homelessness. The way to solve homelessness is actually having effective outreach, getting people into permanent housing from the street, getting people into single rooms, low barrier places from the street. Like, those are the ways that we can actually solve homelessness. So, yeah, that was happening very regularly under the Adams administration.
Thank you. Thank you all for your testimony. I'll call the next panel, Timothy Pena, Shanna McCormick, Richard Flores, Jennings, Christopher Leon Johnson, and A.P. LaFair. You can start.
Good afternoon, and thank you to Speaker Menon and to Chairs Hudson and Felice for holding this important hearing today. My name is Shana McCormick, and I'm the Senior Director of Government and Community Relations for Rethink Food. We're a chef-led nonprofit organization dedicated to creating a more equitable and sustainable food system, driven by our core belief that every New Yorker deserves the dignity of a high-quality meal. We recognize that food is only one piece of this very complex puzzle. We deeply respect and thank all city agencies and partners for their tireless response. We must acknowledge, though, that malnourishment is an issue amongst our street homeless population, and we take the nourishment of our neighbors very seriously. We're very proud of our ability to respond quickly to emergency meal needs and to do so with dignity. Our model transforms the local economy into a frontline defense against hunger. We partner with over 200 local restaurants to provide chef-crafted, nutritious meals directly to the communities that need them most. We're proud to share that we've distributed close to 34 million culturally appropriate hot and quality meals and directed over 17 million to small local businesses and restaurants. Rapid response is a core part of our mission and is what we do best. We scaled our work quickly to feed newly arrived New Yorkers at a district level. We've responded to local emergencies like fires and gas outages, and more globally, when SNAP benefits and paused during the government shutdown, we moved forward with urgency and adapted. Over the past weeks of extreme cold, Rethink Food mobilized rapid emergency meal responses, often within hours, across New York City in partnership with elected officials, city agencies, and frontline housing providers, serving communities facing extreme cold, utility outages, and fire-related disruptions and displacements. These activations included snowstorm response efforts, NYCHA buildings without heat or gas, health and hospitals, warming stations, and emergency housing sites. In the past 41 days, Rethink Food has provided over 8,000 meals in response to the cold, and are proud to have partnered with Speaker Menon, Council members Kevin Riley and Suang, to name a few. Additional meals are underway through a month-long emergency response at the Bronx Park Motel in partnership with Councilmember Piernina Sanchez. Models like ours rely on strong partnerships with city government. As we look ahead, we invite the council and city agencies to view us as a bridge between the private sector and public need. And we look forward to seeing how we can further support these vital cross-sector partnerships to make our city's emergency food response as seamless and dignified as possible. Thank you for the time.
Thank you for your testimony. You can go.
Hello, my name is AP LaFair. I got a lot of titles. I'm here as a community person. I've worked with a couple of the outreach teams, and so I just wanted to come and say that a lot of the things that have been said today have been a lot based on numbers, and we're overlooking the fact that these are people. And so when we think about that, we have to think about what type of services are being provided and the quality more so of services. And speaking from my experience with this type of work, the quality is not there. Yes, the shelters are in disarray. Yes, there are locations, safe havens, that don't have appropriate accommodations. At the end of the day, the people, the workers, the staff, the people in the literal community, those are bigger determinants of whether someone is able or willing to take housing or to receive housing, not even to mention the mental health aspect of it, which I believe has been strongly overlooked in my position, my past position, the most. Because yes, there are teams that have case managers and nurse practitioners and nurses and all of that. That doesn't mean that they're always staffed that way. And also there's a caveat between a licensed clinician and a mental health clinician who has a graduate degree. And I'm saying that as far as it goes with experience, which goes into the lack of training overall. The training should be improved, because at this point, I think that the Code Blue only continues to exacerbate what is already there, which is the quality of care around the board when it comes to the people who are providing the services, the people who are receiving them, the actual facilities that are being utilized, and also the implementation and the collaboration with community in meaningful ways. Thank you.
Thank you for your testimony.
All right, my name is Christopher Leon Johnson. I need the city council to be on record to saying that the reason Madani doesn't want to remove the homeless off the street is because some of the main nonprofits that got them in are the main ones that are pushing for the non-criminalization of homelessness, Vocal New York and Safety Net. And I think that you, Chair Hudson, need to be on the record to say that you have a lot of dealings with Vocal New York and Safety Net. So when it comes to, I think for the next 8 years, because I think this guy gonna be reelected again, nothing's gonna change with this. This is a waste of a committee time. Nothing's gonna change with really making sure that the homeless are put in the right places to be served. You know, this mayor, he's been on record to say he's not gonna remove the homeless sweeps, and a few members of the committee are the same ones that are pushing for this stuff. Look, let's keep it real that this, keeping people on the street is inhumane. This is straight inhumane, and we have a city council, even with the speaker, all they care about is lining their pockets, using discretionary funding and lining the pockets up to these corrupt homeless shelter-based nonprofits in Vocal New York and Housing Works and Safety Net. Where is this clown of a CEO of WIN? Christine Quinn makes over $500,000. We didn't hear from her. Where is she? Where is she saying that these people is justifiable? Because she said on Twitter that it's justifiable that people die on these streets. It's just out of control. And one more thing I want to say is that I think the city council need to come together and condemn Transalt, because they made it that their bike racks are more viable than 18 people dying on the street. They was complaining all over Twitter today. Ben Fernandez, Elizabeth Adams, and Transalt was complaining all over Twitter today that you gave all the nonprofits. You gave all the nonprofits. Why you gave all the nonprofits more time?
Your time has expired.
You gave the nonprofits all the time, but you only give us 2 minutes. That's not right. Can I get some more time, please?
Next testimony, please.
My name is Timothy Pena. I run an organization called Veterans Justice Project. I came to New York City in July of 2022. I spent 5 months at a veterans shelter in Long Island City before receiving supportive housing or obtaining supportive housing near to Penn Station. Transitioning veteran, honorably served, disabled, and a true success story for other veterans here in New York City. I'd like to discuss purely homeless veterans in New York City. I submit this testimony with urgency and concern. The Borden Avenue Veterans Residence is the only VA-funded grant and per diem program, transitional program in New York City for VA-eligible veterans living in conditions that violate federal policies for transitioning veterans in the VA system. BAVR, Borden Avenue, currently houses veterans in a commingled environment with non-veteran residents, some violent sex offenders, experiencing active addiction and severe mental illness under the city's MICA mentally ill chemical abuse framework. This endangers veterans in recovery, especially those with PTSD or history of substance abuse disorder, and undermines the federal intent of the GPD as a structured, sober program for stabilization. Veterans who report violence, drug use, or unsafe conditions are often punished, not protected. Many are removed from the GPD program and therefore disconnected from the federal HUD-VASH permanent housing program. There are currently no veterans serving on the New York City Council, and this makes it even more imperative that the Council appoint pro-veteran members to the Committee on Veterans, members who will consistently show up and hold DHS and contractors such as Institute for Community Living accountable for how veterans are treated under city oversight. I respectfully urge this committee to, 1, hold formal oversight hearings into DHS and contracted administration of the GPD programs. 2, mandate separate trauma-informed housing models for VA-eligible veterans only. 3, introduce legislative protections for whistleblower veterans and ensure eligibility continuity for HUD-VASH. 4, expand access to transitional programs for women veterans. There are no women programs for veterans in the city.
Thank you.
And 5, establish a second veteran-exclusive GPD site in New York City for veterans who are in the VA system receiving care from the VA.
Thank you so much.
Thank you for giving me the opportunity to testify today. I'd like to testify and say here publicly and officially that I have experienced cold blue weather as a homeless person for over a decade, from November 21st of 2015 to the present. And this is despite the fact that after being illegally evicted from my family's home in November 21st of 2015, I was and have been denied legal counsel in a court of law to this very day. In addition, the right to shelter requiring the city to provide temporary, emergency, and self-shelter to any homeless person, including legal protection from discrimination, respectful treatment and accommodation of any disabilities, the right to challenge placement decisions. Agencies such as the Coalition for the Homeless, Department of Homeless Services, the Department of Social Services, and most notably the Bowery Residence Committee, otherwise known as the BRC, continue to engage in discriminatory practices based on gender, age, ethnicity, race, and economic and social status. One important example is the authorized physical, sexual, and verbal violence and harassment by allied security guards who, in non-compliance with the United States Constitution, continue to violate the First Amendment, speech and religion, the Fourth Amendment, unreasonable search, and even the 14th Amendment due process of law, which resulted in myself filing several incident reports to the NYPD, NYPD Department of Investigation, NYPD Internal Affairs Bureau, and thus far, no official investigation has been conducted by any government agency, FBI, CIA, or independent civilian municipal oversight agencies such as the CCRB. Lastly, as of January 2026, Mayor Zoran Mundani, who I testified with at a joint legislative public hearing for the executive budget on housing, cannot or will not say publicly why I've been illegally denied a City FEPS voucher or Section 8 federal assistance help for over a decade, and I'd like to know why. That's one of the reasons why I'm here, because with all due respect, I've experienced cold blue weather as a homeless person for over a decade, and I haven't heard a single testimony today that would address the reason why someone would, like myself or other people, would experience that type of homelessness for that duration of time, and also the fact that they have taken advantage of services and have gone into shelter, as I have for over 4 years. I actually spoke to Ms. Parks at a hearing, and I never got a call back. I only dealt with the caseworkers who could only do so much, and I'm still at the facility wanting to get out for over 3 years.
Thank you so much for sharing that. I think we both have some questions, so I'll let Chair Felice go.
Thank you. Thank you so much for your testimony, everyone. A few questions. You mentioned you were homeless for about a decade, and there were problems that led you to not want to go into the shelter system, including discrimination, problems with the security guards, and a lot more. What are other reasons, what are other circumstances that you would say play a role inside the shelter that would make any person in that situation not want to go to the shelter? I'm sure safety, for example, is one of the reasons. Can you talk a little bit about that, if that's something that you saw during your time?
Well, what I have learned through the experience was, first, I wasn't fully aware of the violence that goes on in shelters, in facilities, and why. Initially, I didn't know why, for instance, why the NYPD weren't used as security. Why were they using private security as opposed to using NYPD, which, in my opinion, would follow the law, meaning follow the Constitution of the United States of America. They wouldn't engage in what I've seen as arbitrary types of policing. And the Allied security guards, that's exactly what they're doing. There's another gentleman who lives in the facility with me who keeps trying to sue them based on them knocking on his door. They do these wellness checks, and they knock on the door periodically, maybe twice or 3 times within an hour. During the day, I would imagine that that's fine, but when the person is isolated in their room, I don't know, watching television or reading or trying to sleep, it is quite annoying to have someone knock on your door and ask if you're okay. It doesn't seem to make sense. Now, what's more important, and this is something that I'm glad you're giving me the opportunity to say here, is some of these guards are known cannabis users. You can actually smell, and they reek of cannabis while they're on work, which means that their mental capacity is not to be taken seriously. That means the person is actually intoxicated on marijuana while they're at work, and you can actually smell them. And they will get into verbal arguments. I've heard them get into verbal arguments saying they wanted to. I was harassed by one who threw my things all over the table, and I said to him, "Sir, the reason why I carry my things here is because you people confiscate people's things without their, what's the word?
Consent.
Consent." And he said, "We don't do that here." I said, "Yes, you do. I've seen many complaints, and I've heard many complaints here, and I've also verbally heard you people say that you would steal my things." And the Allied security guard got very upset, very, very irate with me. I called the police, and when the police came, I explained to them what happened, and they listened to me and listened to him, and they told him, "Please do not speak with me anymore." And I said, "Exactly." I said, "That's your job." I said, "If someone does not consent to you wanting them here, all you have to do is call the supervisor. The supervisor will come downstairs, speak to the resident, and if the person doesn't want to comply, then I would imagine that the supervisor could tell them to leave or stay. But my understanding with that is that that would be against the law, that they would throw the person out into the street because they didn't want to comply with being wanted." You could tell me that better than I would know. And this was during cold blue weather, by the way. This was during weather. I went to the police precinct and I spoke to an officer who was extremely rude. I know I can't use this evidence here, but I recorded the officer while he was talking to me, because this has happened to me too many times. I've been to the Department of Inspection, I've been to the CCRB, I've been to the Internal Affairs Bureau with the NYPD over and over again to try to have an investigation done. And this particular officer was very rude, and he told me, "Sir, if you don't like how you're being treated there, your option was to leave and live on the street." And I said to him, "Sir, that's illegal." Right?
Are you willing to share your contact information with us, Mr. Flores, so that we
Yes.
can follow up with you and
Yes.
on some of these issues and concerns? And then I just want to confirm, you said you've been trying to get a City FEPS voucher for the better part of 10 years?
Yes, I actually.
Or you have a voucher?
When I was first, I guess, admitted to the BRC shelter, the caseworker said that I had. The caseworker said that I had a City FEPS voucher, and I said, "Well, I didn't know that. How would I know that?" And she said, "You didn't receive any mailing or email." I said, "No, the HRA people didn't tell me anything. I didn't get anything in the mail, so how would I know?" I called 311, etc. 311 didn't give me any information. No one gave me any information, so how would I know whether I had a voucher or not? And she said, "You have a voucher." I said, "Fine." And then after that, what she said to me was, "You have to wait over a year in order for you to get out of this BRC facility, and we would find you a place to live." And I said, "Why would anyone have to wait a year living in a place like this, where it's dangerous and all kinds of things could happen to a person?"
Thank you so much for sharing. We're going to get your contact information so that we can follow up with you directly on all of these issues. Thank you.
Okay. How long would it be to get contacted?
We'll reach out to you either later today or tomorrow.
Okay.
Probably tomorrow.
Okay.
Okay?
All right. Thank you.
Okay. Thank you so much.
Thank you.
Thank you all for your testimony. Yes, sir.
A couple of statements in support of Mr. Flores. I'm out on the streets working with veterans experiencing homeless. I participated in the last 2 HOPE point-in-time counts. Story's the same. Staff taking stuff that doesn't belong to them. What comes in the front door at donations goes out the back door, in the back of staff vehicles. Security, intimidation, using tactics that are just not, using these kind of intimidation tactics. And then when police are called, using other security to provide cover for illegal and unlawful activities within the shelters. I heard this over and over again in the last 2 HOPEs that I did, and continue to hear this despite what DHS is saying. They're not getting any safer. The same activities are still continuing on. Thanks.
Thank you so much.
Can I ask something, please?
We're moving on to the next panel.
Can I ask something?
Okay, on Zoom, we're going to move to Charlton D'Souza and Kakisha Condonito.
All right. Good afternoon. My name is Charlton D'Souza. I'm the president and founder of Passengers United. We're a 501c3 nonprofit organization, and we do a lot of work in the subways. One thing that was not discussed at today's meeting was the cancellation of 311 tickets. When you put them on the website or the app in the subway station to report homeless encampments, a lot of times they're being cleared out by NYPD, and the encampment or the condition is still there. So that's an issue. And the reason why I bring that up is because a lot of times when we do see homeless encampments in large mezzanines that are often isolated away from the station agent booth, I'll give you a perfect example. 5th Avenue, 53rd Street, and also Herald Square, where you have these. So a lot of times you see a lot of these homeless individuals, they're mentally ill, they're drinking, they're shooting up needles. And it's a lot of these homeless individuals that end up going on the, end up platforms and they get hit by trains. This is something that's not even being discussed. The suicides, the 12 nines. Um, Obviously, for 1 or 2 nights for the homeless to be down there, that might help them stay warm, but it doesn't take care of their long-term psychological needs. And when homeless individuals get off their medications, as I've seen, and I've been to incidents where this has happened, obviously they end up getting arrested and they end up getting in the system. So I really wish that at today's event, I really wish the commissioner would let us ask some questions of them. But we are seeing with this cold snap, a lot of the homeless and mentally ill have migrated to the subway system. In fact, 2 people died this weekend on the subway system. We were getting reports that maybe a third or fourth person had passed away. They're saying it was a drug overdose. So that is seriously alarming. And the at the meeting today, they said there was only one
Time's expired.
service provider.
Thank you so much. Kikisha Condonito?
Yes, hello?
Yes.
Okay, hi. Good afternoon. Thank you so much for allowing me to speak and share in this meeting. My name is Nakisha Candanito, and I am a member of a advocacy group in the Bronx called Friends of Echo Park. And I just wanted to speak very briefly about my experience with working with the homeless or unhoused people in our park. There have been encampments in our park where there have been sweeps that have been done, and I concur with the things that some of the folks have shared here today about how these sweeps have affected them in terms of, having their personal items confiscated, thrown out. And as far as, being, I guess, feeling harassed or whatever by how these sweeps are done. Not always, I guess, in the most humane ways, which is very disheartening. Also, too, with the shelter system, I have a family member who is a supervisor at one of the shelters here in New York. And this person has definitely explained why a lot of unhoused people feel very apprehensive about going into the shelter system, the conditions that exist in the shelter systems that make a lot of unhoused folks feel unsafe and not treated in the most respectful ways. And so I feel like between all of those things, there is something that needs to be done in terms of how people can be better served by our city, by our city's services. Just with the shelter system alone, there's so much improvement that can
Time's
be made.
expired.
Excuse me?
You can wrap up and,
Sure.
yeah, thank you.
Sure. But as far as with the cold, right now, I am grateful for On Point NYC that they were allowed over the weekend to be able to stay open 24/7 because I believe they definitely did help to save lives of people who otherwise would not have gone into shelter for the numerous reasons that have been named today and may have added to the number of deaths that have happened because of this severe cold front. So I thank On Point NYC and for the city to allow them to stay open. I pray that there's something that can continue because they do a great service to the people on our streets that are unhoused and need help and services. So thank you.
Thank you so much for your testimony, and apologies for mispronouncing your name earlier.
That's okay. Thank you.
Thank you to everyone who has testified. If there's anyone present in the room or on Zoom that has not had the opportunity to testify, please raise your hand. Seeing no one else, I'd like to note that written testimony, which will be reviewed in full by committee staff, may be submitted to the record up to 72 hours after the close of this hearing by emailing it to testimony@council.nyc.gov. And again, I'd like to thank everybody who's testified. Oh, sorry, there's a hand raised. Charlton D'Souza.
You may begin.
Okay, Charlton, you spoke already. Did you have something to add? Or is that an old hand raise?
Yes, I had something to add. So obviously, the city council, they need to take our recommendations and they really need to train all the volunteers around the city on how to put 311 tickets in. But when we're putting 311 tickets in, NYPD and DHS and the social service providers need to respond, and there needs to be accountability tied to the nonprofits who have these contracts in the subway system.
Thank you.
Yeah.
Thank you. Thank you so much for that.
Yep.
Okay, seeing no one else, I'd like to note that written testimony, which will be reviewed in full by committee staff, may be submitted to the record up to 72 hours after the close of this hearing by emailing it to testimony@council.nyc.gov. Thank you again to everyone who has testified today. This is a hearing topic that we should not have had to address, but we are here with hope that we'll see some real tangible changes and improvements to the existing system so that we can prevent any more deaths from happening during this cold weather. And I will pass it off to Chair Felice for some closing remarks.
Thank you so much. Just wanted to briefly thank you, Chair Hudson, for this hearing, and also wanted to thank Speaker Menon and the entire City Council team for putting this together. I also want to thank everyone who testified today, including the agencies, the service providers, stakeholders, and also members of our community. Based on the testimony that we heard today, but even putting that to the side, based on everything we know regarding the homeless crisis affecting our city, it is clear that the systems we have in place are not working for the homeless. The systems that we have in place are not working for those that are the neediest New Yorkers. So it's very clear that we have a lot of work to do to truly resolve this crisis and make sure that our systems work for those that need help. Thank you so much.
Thank you so much, Chair Felice. And we've also, there's one more person online, Sam Rivera, who's raised their hand. Sam Rivera, do you have testimony to share?
Yes, I do.
Okay, the sergeant will let you know when your time begins.
Thank you.
It's begun. You have 2 minutes to testify.
Oh, thank you so much. Very quickly, I just want to thank you and our council members, Felice, for this opportunity. I'm sorry, I thought I was off, so I'm trying to catch up very quickly. I'm the executive director of On Point NYC. It was truly a pleasure to step up and step into what we did this weekend. Keisha mentioned it. We opened both our brick and mortar sites, one in Washington Heights, one in East Harlem, to stay open 24 hours a day from Friday evening into Monday morning. You know, the staff and the participants were truly grateful and excited to see this change moving forward and see this change in how we take care of our people, especially those who are at risk for overdose. I quickly want to thank the most amazing staff on the planet, the folks who work for On Point NYC. I want to also share that we had 0 deaths. We had an array of meals and you know, supplies shared to keep our folks warm and safe. It was truly an amazing weekend. We look forward to many more opportunities in this way. And again, to look at the opportunity to shift and pivot quickly and support New Yorkers in the way we did at On Point and the way we are doing moving forward is truly a blessing. And thank you again for giving me this opportunity. I want to remind Mr. Felice, my buddy, that I would still love him to come, and I would love you to come as well and visit us at On Point.
Thank you so much for that testimony, and I look forward to doing a joint visit to your site. So we'll make that happen. Okay, is there anyone else in person or online who would like to testify? Okay, seeing no others, we will officially conclude this hearing. Thank you all again so much.